Ortho, surgery, anesthetic. We're just going to get on, do this.
Not scary and get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output, you know?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up, I know. Come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
I've got trauma, I've got stroke. Well, in half an hour's time, you'll be on your way out, won't you?
You live in Peckham? Yeah, go to working in centre, there's no waiting in there. That little sore throat can be dealt in the area. Okay? You're welcome, bye-bye. We give all this information to the patient, so you need to be assertive, you need to be firm.
It happens in any career, that you've gone from being the new kid on the block, you know, not knowing how things work, to the ones that people look to.
I think that's two things, experience and common sense, isn't it? Do you agree with that small little thing?
Yeah, I kind of do actually.
Yeah.
Experience is like massively important.
Yeah, experience is a good teacher.
Senior nurse Scott has been at King's for 13 years. Today he's in charge of all 10 beds in Resus.
Hello, Charmaine.
Hello, nice to meet you.
I'm Scott. This is just your first shift in here, first day? I noticed the scared look.
You just sort of have to look and take everything in though, don't you?
Yeah, that's fine. Don't be afraid to get stuck in. There was another student at another time on a night shift. So I'm like, have you ever done CPR before? She's like, no. I said, right, you're going to do some CPR now. Okay. She jumps on and she's pumping down on his chest and there's blood shooting out these holes. And I'm like, we stop it after 3 minutes. And I turn around and I'm like, oh, was that all right? And I could see her kind of filling up. And then it occurred to me, and I just went, have you seen a dead body before? And she went, no. You forget that people have a first time.
Fall for about 3 metres, head injury, LOC, GCS now 15, facial injury, C1 to C7 tenderness.
Hello. Hello. Pay attention.
Get you oversleep.
Mum of two, Pauline, had a fall at home 40 minutes ago.
Pauline's 56, had a mechanical fall at 10:30 this morning. She fell down 5 steps, landing on the table. Pauline does not remember the full events.
Lovely. Thank you very much. Yeah. Okay. Okay, we've got 5 minutes for a primary survey. The first 3 minutes are gone. I haven't heard anything. Let's go.
Hello, King's College Hospital.
Wow, okay.
Hems, red phone, 20 minutes. Hems, red phone, 20 minutes.
The air ambulance is bringing in a 62-year-old man. He fell off a roof, head first.
Right, Mary Jane, just so you know, I'm sorry. Here we go. I'm going to get someone to take 7 CDU. 5's going to go around to major cubicle 8. 3's going to go to minus cubicle 2. And then that gives us a bit of space. When you've got a full resus where you're completely rammed, but something else is coming in and you need to fit that in and you've got 5 minutes to do it, you've really got to fire off a lot of big decisions in a very short period of time. Can we urgently have a porter to resus to move some patients, please? Thank you.
Excuse me, if I'm going to go to the toilet, where, can I walk right now? No?
There's 3 of you here that it's waiting.
They're all going to fight for one bed.
Okay, we'll have to split this trauma call off a little bit. How many orthopedic surgeons I've got? 2. Can I leave you with this one then? So what we definitely need is C-spine, CT head. Happy? I'll leave you to it for now. We'll do the other one.
Right, surgery.
It's here, it's here.
Orthopedics.
It's here.
Anaesthetics.
Stand in for him, it's here.
Yes. Do what I tell you, you'll be absolutely fine. Right. Put some gloves on and an apron. You're helping.
So that'll be Hems from the park. So Clem's, just to give you an update, 60-year-old male has severe head, chest and abdominal injuries, is cardiovascularly unstable and intubated and ventilated. This is this patient,
We're going now, are we?
We are just going to take you next door. There's somebody quite sick coming in, so we have to make a space.
Oh, it's okay, yeah.
If you want to get hands on, do. If you just want to stand back and watch, I'm not forcing you to do anything you don't want to do.
I want to get in there, but I don't want to get in people's way.
You won't get in people's way because you'll be told to get out of the way. As soon as he rolls in through the door, he's attached to blood. So we could be looking at chest drains, we might even open his chest, or we could be looking at just, there's nothing we can do here. He might already be dead by the time he gets here. Can everybody else sign in that's here before we start, please?
A 62-year-old man with life-threatening injuries has been flown in from Sussex. He fell to the ground while working on a roof.
It's a very time-critical situation. A fall from height, the 2 big things you're looking at is a head injury and a chest injury. Straight up in here, guys. We'd heard that he'd fallen onto his head, so in the back of your mind you're thinking it could go either way here.
Okay, so it's on Mark's count, he's got the tube at the top.
Okay, we'll go on ready, brace, lift. Ready, brace, lift. Trying out.
Okay, we're all ears, thank you.
Hi guys, this is David. He's approximately 60 years of age. David has had an unwitnessed fall 30 feet off a roof, landing on concrete. Injuries top to toe. He has a traumatic brain injury with a right parietal hematoma. He has chest injuries with suspicion of bilateral rib fractures and concerns of intra-abdominal bleeding.
Okay, thank you very much. Okay, first of all, I want the blood connected and cardiothoracic surgeon, 2 chest drains in the thoracostomy. Primary survey, we've got 5 minutes. Come on then. Ventilation, Jenny. Blood is being connected, yeah?
Peggy, that's me. Okay. Okay, chest drain, please. And just some 10 silk, please.
Since arriving, David has been given 3 pints of blood.
Good. Primary survey plan. Blood being taken, blood is coming up, chest drains in, and we should be ready to go for scan very shortly.
Barbara, do we have any details for him, name-wise? What?
Yeah, come on, so we've got
David
Beck.
Beck. Okay.
Okay. Are we almost ready to go to scan? From an area point of view, yes, we got drugs. Okay, let's go.
He went to work as normal. So he used to fit aerials and satellites up on the roofs. He gave me a kiss goodbye, and I always give him a kiss and say goodbye and, you know, have a good day and all that, and I didn't this particular day. I was always saying to him, it's about time you give up. But no, he wouldn't. He loved it. Got a phone call. Police car pulled up. And he sort of said, Mrs. Beck. I said, yeah. And he said, oh, we're taking you to London. And I honestly, truly thought he was already gone.
Very little happening. I mean, they're not busy, are they?
No.
That'll be a young doctor arriving. And I don't know what the delay is. You know, it's not busy, is it?
Well, we don't know what's going on behind the scenes there.
Don't the people have to be here first?
True.
To go on behind the scenes?
Certainly this can't be sorted out in the next couple of days or so. I'm going to be very handicapped.
Yeah, there'd be two of us. I might have to put off my own.
Well, it just seems sad.
I haven't got a space or a nurse. You just wait there for 2 minutes. I'm getting both. Oh, lovely. Tess, number six. Tess, can you just take this new one? Status.
Okay.
Lovely. Thank you, Tess.
Well, his CT is going to be delayed, isn't it? Unless we find out when it's because they're going to be chocker with these two now. The CT.
56-year-old Pauline's been given pain relief. She's now waiting for a CT scan to show the extent of damage to her spine and neck.
Just arrived status. Just needs to go into CDU. Medics. Just arrived, gone to AAU. Yeah. Thank you.
No, that's I know.
Hello.
How's your neck?
I don't know. Because they're giving me
Morphine.
Yeah. Don't cry, baby. I'm such a numbskull. Please don't cry.
Oh, you worry me, Papa.
I know.
You do worry me.
It just happened so quick.
The accidents do happen quick, though.
Papa, all I did was go up the stairs and I missed my footing and hit the table. Don't cry, please. Please. I'm fine. Don't cry.
Can't help it.
I was just so frightened because I was on my own.
Well, she's a bit accident prone. Tripped in a manhole cover and broke her foot. She ran across the road, tripped and fell onto the pavement and fractured her wrist and broke her elbow. And then this time fell up the stairs, hit her face off the table and smashed all her teeth out. It's emotionally draining. Well, I keep trying to tell her that, you know, just slow down. You know, you're getting old now. You're older, and just slow down and try and take things easy. You know, rather than dashing across the road and falling over and falling up the stairs and, you know, all the stuff that's happened to her. Yeah, it's been a bit scary. I hold her hand more often now when we go out.
Have you seen the bottom teeth?
No, I don't particularly want to.
Man. It's just my teeth.
There's not many of them left.
When is it ever going to end, Bob?
Soon, I hope.
Can you get me some decent underclothes, please? They've cut all my underclothes. They cut all my shirt. It's 38D.
Oh, just get you some stuff.
Yeah, please.
38D.
38D. Yeah.
All right, I'll go and see her. I'll be back. I think you make your marriage. I don't believe in love at first sight. You know, I think you grow to love someone.
Yeah, he has got nasty contusions predominantly on the right side with a large temporal fracture on the right side, bilateral orbital fracture and also a temporal fracture on the left side.
David's head took the full impact of the fall. The CT scan will reveal the level of injury to his brain.
We've got two boys. They're now 37 and 36. We always used to like going to Cornwall, Devon. We had our own caravan, so we went touring. And the boys thought that was, you know, the bee's knees.
So important is now to see if he's got other injuries or bleeding from somewhere. If not, and if it is an isolated head injury, then it's very important to maintain his blood pressure relatively high to make sure he's getting enough cerebral perfusion pressure up there, because this brain will, over the next days, swell up. So this is now our task.
I don't think you could actually say after 42 years that I'm in love with him, but I love him. It's for better, for worse, really. You know, that was in your vows. It's strange, isn't it? You know, I think it's like partnership in the end.
Right, you're going to roll you again. There you go. Madam, you can sit in one of this chair.
Okay. Opera critic John injured his ankle while on a skiing holiday.
Right, you're John Bakan, is that right?
That's right.
And how young are you now this time?
I'm 78.
Right, good. Right, how can I help you today, mister?
Well, I found the second morning running that my left ankle is so sore that I can hardly put any weight on it.
Right, okay.
Fall in love, don't forget we were in our 30s, you know. It wasn't romantic love, oh, here's the love of my life. It was just a very interesting man and very charming, very easy. He asked me to go to an opera, the English version of Wagner opera, and we've been going to music ever since. I've been married to John for 42 years. So we tried massaging it a bit with oil, and did not make the difference it made yesterday morning.
So you're being oil massage?
Yeah.
And pain relief?
Yeah. Sorry, I didn't take any pain.
Oh, right, okay, just the massage.
She wear the trousers, do you think?
Yes, I think probably she wears 1.5 of the legs of a pair of trousers, yes, I'd say so.
Do you have any medical problems, sir?
Yes, I'm suffering from prostate cancer. That's being treated.
it's got out a little bit of it onto the pubic bone.
Yeah.
So he's on female hormones.
Okay.
Casodex. Daily.
Many men die with cancer rather than of cancer. And that seemed to me a fairly encouraging thing to keep in mind. And I never had any pain, so I've been lucky, perhaps.
I just stay on the chair.
Yeah.
And
It's medicines, if you need to know them.
Oh, we got simvastatin as well. We got blood pressure. We got cholesterol as well. The way I look at it.
Cholesterol is under control.
Good. Plus your diet, I think. You need to get your diet
the
done.
diet, we eat extremely well.
You need
And
to
it-
limit your level of oil, basically.
The only thing he takes too much is
Yeah,
red
fish is
wine.
less oil.
That's all.
My husband would say that I rule the roost. In everyday matters, there's absolutely no doubt. You know, he's not interested enough, really.
Right, sit you back to the waiting area.
Okay.
But with my husband, it's not a matter of let you do, really, is it? You know, you kind of accommodate one another, don't you?
Right, I'm going to get something to eat. I know you can't have anything, so I'll eat it out there.
Too right, you will.
Okay, I won't be long.
Don't kiss me.
There is kiss you, don't be silly.
I mean on the lips.
Yeah, you're having a laugh, isn't it? Wait a minute.
Do you have any relatives at all yet?
Apparently there's a wife who is being blue lighted in by the police. She's expected, yeah.
So should we send her to surgical critical care if
I think that would be very good.
Yeah.
We would talk to her there.
Yeah.
Thank you. That'd
No,
be
Jane,
good.
did you get that as well?
David's CT scan has revealed significant injury to his brain.
He's obviously sort of gone like that, hasn't he? And sort of as he's landed, sort of
And then
gone
slipped a bit
more like
further
that,
on the-
Yeah. But I'm surprised his chest and everything.
Chest is,
It's not even a rib, well, not an
Very
obvious rib
surprising.
fracture, I can
Yeah.
see. Gosh, so already, gosh, that's an hour really from getting here into scan and back out again. It's
I've seen some people fall from great heights and bounce. I've seen people that have fallen from standing and had a big bleed. But usually, the higher up they've fallen, the more chance you've got of them having some brain damage. Once you've stabilised the patient, there's not that much more to do for them.
He was on a life support. He was in a coma. We all moan about our partners, but you just don't realise until something like this happens.
I can't believe how quiet it is. I can't believe how quiet it is.
Yeah. This floor's a bit cold.
Oh dear.
So I can't get my shoes. I've got shoes there, I can't get them on. All swollen. I put my coat on the floor. Getting chilly now.
How can I hide your Daniela?
I'm going to Jamaica tomorrow.
Oh.
Say hello and goodbye.
For how many? Like a month?
Just for a week.
With your girl boyfriend?
I hope so.
Enjoy your holiday. All right, enjoy. Oh, I love it, that Daniela. It's one of the FY2 doctors. This is quite sweet. You got a boyfriend? Really? Yeah, good girl. Continue with your studies and the rest will follow.
Sounds good.
Yes. Hello.
Oh, yeah.
How can I help?
But I'll be next, nurse. You know?
You're next, yeah.
A very, very fit man. Just finished with the army in 1952, April 52. And there was, I went down to get a job, you know, at the Labour Exchange, And they turned around and said, we ain't got no job for you. I thought, that's tasty. I said, I've been out there for 2 years, right, doing your bit and pieces, whatever it was you had to do. I said, when I come back, there's no work for me. I said, tell you what, don't bother. I said, I'll go and get my own work. And I took to window cleaning like a duck to water. I was really fast. You don't stand going like this, clean the wind. Come, finished, next job. And that was it, you know.
Don't lick, darling.
Don't lick what?
Don't lick your lips. They'll get drier and drier if you do that.
Well,
You know what? Maybe you should have a lipsil in your pocket, but you'll just lose it, won't you?
Yeah.
Stick some on now, though. There. Put some on. See? That's better, isn't it? Yeah?
She's probably cared for me better than I've cared for her. She's looked after me pretty well. I'm sure it's partly due to her that I'm still around today.
Darling?
Yes.
Your feet are not your best part, darling.
No, I know. Not much of me is my best part.
Well, your smile is lovely if you only had your teeth, you know. He sort of doesn't really focus on his cancer. There is a danger, and that's, you know, always there. If you're awake at night, it will worry you, or if you're having a reflective moment, it will worry you. But in our kind of normal, busy lives, no, we don't let it. And John is a sort of optimistic man. That he would.
So it's more around your ankle.
It's yes, around here.
Classical textbook sprain.
Yes.
Okay.
I bet that's
So he sounds very, very much on what happened to you.
We have good times and the not so good times, and you work through them together.
King's A&E. We're getting a little bit full now. Go ahead.
Charmaine, do you want to start putting these on?
Red here, yeah?
Yep.
Then black underneath, isn't it?
That's it.
It's 10. Lovely. Thank you. And another one. Okay, go on.
You've done very well being stripped down for such a long time.
It's this that's giving me...
Oh, right, yes, it's very dry. There's a bit of crusted blood around there. Well,
The results from
tooth is
Pauline's
gone there.
CT scan are back.
Well, did you say it was
There's a wrong crack in the bone. Right. It's a bit further up, a bit higher up than the coccyx bone. Right. We call it the lumbar region. All right. Lumbar spine. Yeah?
Yeah.
There's no specific treatment for that apart from taking painkillers, really.
Yeah.
Right.
Yeah.
Should we have another look at the back then? Would that be right? Let me...
They found another fracture. Yeah.
So I've got a bit of a bad track record. I've just got to take things a bit easier. It's not fair on John, you know, because he tends to worry about everything I do.
I'm just a bit stiff.
All right.
I class myself as being very lucky. And I often think I put him through too much. And I don't think it's fair. He's an angel. I wouldn't be without him.
Hello, is it Mr. Runcorn?
Yes, it's me.
All right, would you mind coming through this way?
Yeah. Anyway, see him.
Oh, okay. All right, come through this way. You don't seem to have any shoes.
I know, I couldn't get them on. All my feet are swollen.
Okay. All right, do you need any help?
Yes, please, with legs.
Let's get those legs up onto the bed.
Oh.
Oi, well done.
Oh.
Right, well, very nice to meet you. My name's Josh, I'm one of the doctors here.
Oh.
So tell me what brings you into the emergency department today?
I've got swollen ankles to start.
Mm-hmm.
Okay? And my private parts, you know, I think maybe you've got a blockage there somewhere.
Okay.
Also, I've got, I can't go to the toilet. What's it called?
Constipation?
That's it, yeah.
Okay, so three things today.
Yeah.
You got family?
Yes, I've got 2 sons.
Are they
And
still...
my wife died Boxing Day.
Boxing Day just gone?
Just gone, yeah.
Oh, sorry to hear that.
I met her in 1950. Father was a right sticker, I tell you, you know. But one day, she was indoors crying her eyes out. I said, what's happened to you? She said, my dad hit me last night. Well, I said, it'd be the last time he'll ever touch you. Because I went man after him. I said, if you ever lay a hand on her again, I said, it's going to be your lot, my friend, right? Believe me, I was really annoyed. I said, I'm going to marry her shortly, right? And that was it. He packed it up after that. Never touched her after that. Over 58 glorious years, no problems.
Fantastic. You don't see that so much these days.
No. Well, I got married on the 3rd of August, 1952. I was waiting at the bottom inside the church for her, you know, and her father brought her in. Then he brought her down the aisle, you know. I never see him move so quick. I thought he might change my mind.
Had she been at home with you, or...?
Oh, no, she was in a private, a nursing home just round the corner from me, you know.
Okay.
Beautiful place.
Oh, what a terrible Christmas for you.
Yeah. But it's released for her. She had dementia, Parkinson's.
Oh. Right, we're just going to pop this line in.
Peggy was ill. She was about 70. In the beginning, I used to, when she really got bad, I used to dress her, everything, you know. Give her a stick wash. And she got to that stage where she hardly recognised you, you know. So I said, right, enough's enough. I said, don't give her no more oxygen. Oh, she said, been through enough. I said, just let it take its course. And me and Robert was there. We both held her hand, you know. And that was it. She went away peacefully and had no pain.
Who does all your cooking for you?
I do it.
You do it yourself?
Yeah.
How's your chefing skills?
That's all right.
Right, we'll just get that X-ray done next. Okay. They'll come and get you though, so you just relax here for a bit.
Okay.
You're warm enough like that?
I'm fine.
Good.
Thank you.
And that's your water.
Yeah. Hello there. All right.
Yes. Do you just want to go over there and look after him? The old man. I know, I hate leaving him in the room. I want to go talk to him. Imagine how Grandad used to feel, man. He might feel the same. It really hurts, man. We was with Grandad most of the time, like, because he lived up literally the top of the road from us. I used to come home and I used to dance with my Grandad round the sitting room to all Frank Sinatra and Perry Como and all things like that. He had a stroke. He became ill. I started to take up care for him. I gave up dancing, college, social life. I think that's what I might do. With old people. I don't think you'd have the patience. I don't know. It's not something that's easy, trust me. You see so many people go, it starts fucking with your head. Doing care work. It's not really the life of a teenager, is it? But that was my life. Just had to kind of deal with it, and I enjoyed it. So I didn't really...
Didn't feel like you missed out?
Nah. I feel like I'm missing out now my Grandad's gone. Because I don't really have that routine no more. Of I've got to do this and I've got to do that, and it's like I ain't got that smile no more to look at when I come home. And I miss it. He deserved everything we did for him, and I just thought it was my place to take up because of everything he done for me.
He was very lucky to have you.
I was lucky to have him.
Is this the trauma one? The fall down the stairs. It's up in 5, but I'm not sure if the bay's ready yet. Oh, we've had a bit of anything close. Are you right?
Cardiac arrest, which means like a full resusc. Which is...
A lot of the sisters are amazing. Their knowledge is just... It's not a patch on
But
any...
then I just think, sometimes, am I ever going to get to that level? Like, obviously you will.
Traumas are reasonably simple to look after. If you're trained right, it's exciting, it's gory, it's the stories you take home. But if you want to be a proper A&E nurse, you know, show me how to look after a really good chest pain, sort out an asthmatic, being able to manage a good miners area, sit out and triage for 12 hours and triage 140 people and get it right all the time. Good A&E nurse is an all-rounder.
Thanks for a lovely birthday.
Yeah. Make sure you come back for a second one.
Alfred's X-ray shows no significant problems. He'll stay in overnight for observation.
Alfred, have you got any family that live near you?
No, only my son.
So you don't need any help at home with anything?
Oh no, I'm fine. I do everything from...
You're absolutely fine at home,
Yeah.
and then if you need any help, you can just ring your sons, can you?
Okay.
And they'll...
Oh, yeah.
Yeah?
Yeah.
You sure?
Yeah.
Okay.
Can cook, sew, iron, all the jobs that a woman can do. Yeah. The times I've heard something, oh, I wish I had you for a husband. Oh, I wish I had you. But you can't have me, I'm spoken for. I have a wonderful life. Yeah. I know the carers are very, very good, right? But I like to have it my way. You understand what I mean? It's got to be my way, right?
If we just wait on the chair there, I'll see if a porter can come.
Okay.
And then we'll take... Yeah. You're walking quicker than me, though. All right, so leave them there.
Yep.
And I've got a couple of paracetamol for you up here. There you go.
Was that then?
Just paracetamol.
Okay, fine.
All right?
Yeah. Sorry? Oh,
Didn't say nothing, darling. My granddad passed just like literally before my 18th. It was like, is it my turn now to be the adult? Is this where it's time to choose my path? Because I'm 18, granddad's always told me, don't do this, don't do that, go and do this, go and do that, and he'd always advise me, and it was like, well, now I've got that option, what do I do? I learned quite a lot from my granddad. I think I got a very old soul.
We're off.
Okay.
Oh, can I pop them on your lap? Is that all right? All right.
Yeah.
So much stuff, isn't there? Mobile chemist.
I know he's up above watching over, so I'm blessed.
Are we going to wait in reception?
Well, we're going to wait just out there.
What, in the cold? What? Oh, it's cold.
So just like the party, I'll be the last one here. Fuck's sake.
Everything that happens to me daily is new to me, and you work with it or work round it or whatever. I just want things to be normal, but it won't happen. I know that, and people have told me that. So only time is a healer, isn't it? Being with Pammy helps me immensely. I couldn't do without her, I'm sure.
He's infatuated with me now. I'd sort of say to him now, I like going to bed. You know, if you're tired, go to bed. No, I'll wait until you come to bed. He won't do anything on his own without me now. Which is sometimes, I think it's nice if I could have a quiet 5 minutes. Even an hour.
At Camberwell, I do private jobs as well, as regards cleaning. I've been going there 30 years. They think the world of me and don't want to get rid of me. I threaten to leave them, really. You're not going anywhere, you're not going nowhere. But I've had enough, you're not going anywhere.
Hi everybody, this is Wayne. He's been stabbed twice in the left thigh.
As a parent, all you want is for your children to be happy and healthy. You may not even be back tonight. You have one tumour and then you're told it's gone, and then it comes back.
With your track record, we have to assume the worst and hope for the best.
Surgery. We're just going to get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up, I know. Come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Good morning, A&E, Michael speaking. Hello? No, this is accident emergency. Okay.
It's getting silly now, man, come on. I need to go and have a beer or withdraw stuff.
Letitia.
That wasn't bad. That was a tiny one.
I was just wondering, could I get something to stop me from withdrawing from alcohol?
But you're not actually withdrawing them?
No, I've got the shakes, but...
Because I think they've seen you. The doctor doesn't think you need any of those. Medically, you're fine.
Yeah. Until you show symptoms, so it won't give you anything.
Okay, I'll just go back that way.
It's gonna be one of those days.
Any resource King's College Hospital. That's lovely. Thank you. Bye. Fitting.
Fitting after head injury. So do you think it's a fit and then fall over and hit the head? Have we got lorazepam, sister, or have we got diazepam? IV access, if that's possible. Just normal saline in case it's a drinker.
Hello, King's A&E resource. Okay, go ahead.
Can you say so?
1, 2, 3.
Stroke red phone, 8 minutes. Stroke red phone, 8 minutes.
If you imagine your brain's entrapped in this shell, from a head injury point of view, if you bang your head, it's been shaken quite vigorously. So you're going to be confused, disorientated, and then you've opened your eyes, you don't know any of your surroundings.
Hello, Elaine. I'm Dr. Hobbs. I'm one of the accident and emergency consultants. Hello. And can you remember what happened? OK. Now, listen, we're going to have to pop a little line in your arm and take some blood.
Imagine how scary and frightening that must be.
You right there, John? Can you hear me okay? Yeah. Do you know where you are yet? No. Do you know who I am? No. You're in the hospital now, John.
You need a pet sign? I've fallen down the stairs at a tube station and woke up to a doctor who I knew shaking my legs saying, you know who I am, you know who I am. And I said, I don't know who you are. I don't know where I am. Where am I?
1, 2, 3.
And I was petrified. There wasn't a friend in sight. There wasn't a face I knew. I'd never been so scared in my life. I was petrified.
En route, he was quite absent en route, and since the police has no idea where he is, who he is, what he's doing, anything.
Okay. Can you tell me your name?
Good old shake.
John.
Come back
John.
once he came back. Yeah,
Do you know where you are right now?
No.
You're in King's College Hospital.
So I know and imagine what these people are going through in their heads.
He has got complete right side of it. He's got no sensation down his right arm. He's got sensation in his right leg, but no sensation in his left arm.
Do you know why you've come here today? No. No, okay. You went to St Thomas's Hospital. You showed signs of a right-sided weakness. So they're querying whether you may have had like a little stroke or something. Okay? Now we're a specialist centre for that, so that's why they've sent you here, so we can get a scan of your head. And if it does show that you've had a stroke, then we have a sort of clot-busting drug to clear that blockage, yeah? And try and get you back to normal again. Are you allergic to anything?
Just work.
Work. I think I might agree with you on that one.
How quickly can things change with a person with a head injury?
Within a click of a finger. You could be asking them their name, then they could be fitting, next minute they're unconscious, next minute they could be dead. So very, very, very quickly.
Hello, King's A&E. 12 minutes. Okay, thanks so much. Thanks, bye.
Who have we got?
I think we have an orthopod. I think we have a surgeon.
All we know is that is a pedestrian hit by a motorbike, so we need to make a quick assessment. So does everybody know what they're doing?
Should we go in 7? Yeah. Is that all right? Katrina, we'll pop this next one in your room.
Yeah.
Please, so have a call to the strike and trolley ceresis by 7. Call to the strike and trolley ceresis. Thank you. We're not going to have a good day, are we?
know it's a pedestrian hit by a motorbike, so...
Oh, they're here.
Yeah.
47-year-old Chrissy was crossing a road 500 metres from her home when she was knocked down by a motorcyclist.
Okay, this is Chrissy, she's a 47-year-old female, hit approximately an hour and 15 minutes ago, left-hand side impact with motorcycle RTC. Rear area is loss of consciousness, she doesn't remember the incident at all. She's got impact on the left-hand side of the face, she's got altered swelling to the left-hand side.
We'll wrap you all up in a minute, okay? We just need to get some clothes off, okay, lovely?
The A is clear for her central.
Concussion is equal.
The left side of Chrissy's face took the force of the impact. The main concern is potential bleeding behind the eye or in the brain.
Okay.
I'm just going to try and lighten your eyes.
Pupil 3mm both reacting. No regular medication.
Doing really well. Chrissy, got a concussion, my love, and a little bruise in your brain. Okay, we're going to scan your head. Do we need to ring anybody?
Depends how long I'm going to be here, maybe.
You got some details of ringing anybody?
No. Do you have any details of...
I've only got the female's details. She's got a mobile phone, but it's obviously coded.
Coded.
So I can't get into that. We believe her husband to be Tim Fenner.
Is there any chance you can try and track down a number for him? Because her memory's a bit stuck at the moment.
Chrissy, is there any pain there? On your neck? Here? Here? A little bit there. So maybe a bit in T7.
Yeah, all right there. I'm at this RTA Shooters Hill. I've got the casualty up at King's. I've got a name and a date of birth, and we're desperately trying to find the next of kin contact number. I was coming back from the garage where I'd got the car. I'd taken the car in to have some work done that morning, and the traffic was just stacked up all the way down the hill, and I was like cursing and swearing because I couldn't get home.
So we make sure we take a vomit bowl.
Of course, I got stuck in the traffic jam that her accident had caused. First thing I knew was sort of coming in and the phone ringing. And I've got this guy from the Metropolitan Police telling me that, you know, my wife's been involved in an accident and I need to get to King's College as soon as possible.
Okay, my love, what we're going to do now is we're going to move you onto the CT scanner. You just lie there and the scanner does the scanning, okay? Sorry, sweetie.
It was 20-odd years ago. We started going out together.
Ready, brace, roll, slide.
We didn't work in the same office as such, but on the same floor. I'm pretty certain it was almost love at first sight. So, sounds a bit corny, doesn't it? But there was an instant attraction in that sort of warmth of her face and the glow that she seemed to give off. And within a matter of weeks, I'd sort of proposed to her and said, well, you know, why don't we sort of make it a go of, you know, a proper go of things and get married, so.
She's got a head injury. She's got a head injury. She's got quite a bad bruise around her eye. She's got a black eye here and a little laceration. I think I felt some gravel here, but we haven't really examined her scalp with the collar off, if you see what we run the back off. But there's no huge big hematoma there. It's all here. I suspect she may have some facial fractures because she's vomited blood en route. But she's very, very sort of drowsy and amnesic. At the GCS-14.
2 hours after the accident, there's the police there. There's still the tape up and everything. And this police constable was sort of more or less gesturing that I couldn't go through. And I'm like, well, you know, I said, well, the accident's actually my wife that was involved in the accident. So I suppose I didn't really ask any questions because I didn't really want to know in a way. I was just focused on the idea of getting to the hospital.
I don't know whether I like even like taking that as a compliment. Everyone always says I look like your sister.
That means I look old.
No, it means I look young, and I want to look like your mum.
That means I look old.
That wasn't me.
Lucy has gone for you as 19.
Who did?
Lucy was 19.
Her mum thought I was 19. So that's embarrassing, Roxanne.
She showed her mum a picture back from my birthday and that, and then she was like, how much do you think that girl is? And then she was like, about 19.
Roxanne, that's embarrassing more than anything. Hello?
Yeah, John? 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 You all right there? Do you remember where you are? I was just speaking to you. My name's David. You're at King's College Hospital.
Okay.
Do you remember anything else I said to you?
No.
No, okay.
Somebody sounds happy.
Are we ready to rock and roll? And now the under's near. I must
So I face the final curtain.
Yeah, you got it, my friends. You got it. You got it. They did it my
way.
Bit of old Frank Sinatra, eh?
Oh, he can't beat him. Hello.
Do you think you'll be able to shuffle yourself over onto our bed, or do you want us to slide?
Of course I can shuffle.
Lovely, great.
Lovely.
I could tango as well if you want.
Just the sliding for the moment, maybe the tango later.
Oh.
I know, spoils the water.
A stroke is a blockage to a vessel which stops oxygenating blood getting to various parts of the brain. If you have a blood clot on the left side of your brain, your right side of your arm and leg will stop working.
Whenever you're ready.
Okay.
I think.
The leg's not working.
Not working.
Okay,
Let's
we
slide.
can slide you
Let's
there.
slide you across. All right.
Why is it not working?
Well, we're not sure at the minute, so that's why we're going for the scan of your head. Okay, but let's slide you across. All right. It won't take too long. Don't worry, we'll slide you across, John. John. Oh, hold on.
Don't want you to. Lovely, well done. Keep coming over. That's lovely. And all you need to do for this is keep very, very still for me, okay?
Okay.
Do your eyes just while the lasers come on, just so they don't hurt your eyes. Okay. Nice and still there.
You did an operation for a cyst.
That would be it then.
Yeah.
The scan has revealed a previous operation to remove a cyst in John's brain. It explains some of his short-term memory loss.
There is some brain there.
Yeah.
But there's no blood.
So we just carry on and thrombolise.
While the doctors have found no significant bleed in the brain, John's history of right-sided weakness means they will still treat him for a minor stroke.
Joan, how are you doing?
We believe you may have had a stroke, Joan, so we're going to give you some clot-busting medication.
Okay. So I'm not going to die yet?
Not at all. Don't talk like that.
I swear I blink about 1,000,000 times a minute when I'm tired.
You always blink. I feel sick.
Yeah, you feel sick probably because you need to eat. This is what I'm saying to you, Rox. You need to eat. You can't just have biscuits.
Had a cream egg as well.
Roxanne, you need a sandwich or something, darling. Shall I quickly nip round then? We're better off going now.
Go on then.
Yeah, we're going.
Go on then.
All right, wait a minute.
Why are you eating a minute?
Okay, I'm gonna go. Right, what do you want?
It's a really thing.
Okay, my love. The scan does show you've got a broken bones around your eye.
Sure.
That's okay, they get better. And you've got a little fracture in your skull, okay? So you've obviously, when you landed, just landed thump here. These things will fix. That's why you feel terrible, why you're vomiting some blood. The scan shows that you haven't got anything wrong with your brain, so that's good. But you probably do have a bit of a concussion. So you're definitely going to be with us for today in hospital. This lady, the whole imaging's been done. Spiros here is her trauma fellows, just making the phone calls to Neuro and Max Fax as we speak.
Sorry, how this morning was supposed to work out, was it? Tim was on his way. You're not worried about anything?
Luke, 3999. Don't answer any old ones.
It's a significant accident, and like she does not. Your mother walking past would say she doesn't look right.
Yeah.
Do you know what I mean? It's not life-threatening. It may be life-changing. When people have severe head injuries, they can have epileptic fits. They can have character changes, particularly the frontal ones. The truth is, you're not necessarily back to normal again once you've had a serious head injury. You can affect blood flow to particularly the frontal cortex, where our personality comes from, and our personalities change. You can't help the way you've changed because the injury can't be undone. But unfortunately, that living has to go on.
John, do you know where you are?
No.
No. You're in King's College Hospital, okay? Do you know what month it is?
No.
No. It's March.
Oh.
Okay. And what year?
Springtime.
What year is it?
Eight.
It's 2012.
No.
No, it is 2012. Okay. Alright, Alright. Don't worry, okay? going to have to shine light into your eyes as well. The tissues over there. Got some tissues here. It's all right. Okay. Yes. It's gonna be all right.
Hello. Full cream or low cream?
What time do you have your dinner then?
I'll have it later.
What time do you have yours, Ivy?
Later.
About 6:30. What do you eat all day then?
I haven't eaten anything yet.
I haven't had anything, but I only usually have a sandwich anyway. You have no breakfast, friend?
No.
I only have a bit of toast in the morning. Oh dear.
Picnic in A&E waiting room. This is a picnic, just a sandwich.
What did you do about your dinner?
Marion, she talked to you.
Aren't you hungry?
A bit. I'll survive.
Are you hungry?
A bit peckish.
Why life?
Huh?
What's a life?
Oh, hello, eye clinic. Sorry to trouble you. Can I speak to the ophthalmology registrar on call, please? It's a lady who was crossing the road who was hit by a motorbike. In her left orbit, she's got a fracture of every single wall. So the lateral, the medial, the posterior, and the inferior. The only thing she hasn't fractured, we think of that, is the superior wall, okay?
I met Tim when I was 21. He was just very, very good looking. It was just wow. And we were engaged within 3 weeks. 3 weeks before the wedding, I turned around to him and said, sorry, don't want to marry you. To Tim, because I said those words, you know, I don't want to marry you, he just sort of switched off. For me, I thought he was just moving out to just think and get, just get himself together, and that he was, gonna come back, and then we'd ever talk about it, but he never did.
Hello, Mr. Fenner. I'm Dr. Hobbs. I'm one of the emergency medicine consultants. Your wife is able to speak to you in there, but she has had a head injury. I don't need you to do anything apart from sit there and hold her hand.
And then about 4 years ago, I wrote to him and I said, would you want to get in touch, and so we could just sort of have some closure, because you just disappeared and there was no closure, and for me it just was left hanging for over 20 years.
She'll be better for seeing you.
Yeah. There's this letter in front of me from a person that I'd really loved and felt such a great bond with, and yet, things went wrong at the time, but there were still those feelings there. I actually sat on that letter for about a month thinking about things, and I got to the point where I thought, well, what have I got to lose?
There is no bleed as such in her brain. Right.
Where's the blood at the moment coming from?
And it's just like a bit of sort of tissue or swelling, blood swelling from all the soft tissues and the muscles that surround the eye, and it's in its socket.
We didn't plan anything, it just happened. It was like doors opened and you had the choice. You either go through the door or you don't go through the door, and it was just the universe paving the way for us. To us, it was like getting a second chance. It was like, look, we messed up the first time. We shouldn't have broken up. And it just felt like the universe was giving us a second chance.
And I suppose I felt an overwhelming sense of, I'm home, I suppose, in a lot of ways.
seriously.
Alright, it ain't going to be long now.
What have we got to wait for now?
For him to arrange the scan.
A scan or an X-ray?
A scan.
That's where they put the jelly on, isn't it?
I think so, yeah.
Like a baby scan.
Yeah.
They put the jelly on to scan it.
What did I wake up?
Jelly and custard.
Very funny. What time do I get me dinner?
You don't
It
get
won't
it
be
here.
long now.
It won't be long.
Hey?
We'll try and get you a cup of tea in a minute. We've got to wait for him to do the X-ray of your
Just waiting
foot.
to go down for an X-ray.
I got to wait all the time for my dinner.
No, we'll get you something, Mum, because...
Then you can have your dinner when you go home.
Yeah, but by the time she waits...
We've got to wait till I go home for my dinner.
I think so, yeah, but we'll get you something to keep you going.
Do I get my dinner here?
No, you
Just tell her yes, you do.
Yeah, in a
after.
minute, yeah.
They're cooking it now.
And I get my dinner?
Yeah, they're cooking it for you.
What would you... He's going to ask you what you'd like. What would you like for dinner? What would you like for dinner?
Roast dinner.
Requests.
Roast dinner.
A roast dinner. Right, no problem.
Oh, you got to go and buy it somewhere?
No, they're going to do it for us after that. You can't eat before the scan. You're not allowed to eat before the scan.
What am I doing here?
They're X-raying your legs to see why it's swollen.
"22-year-old Benedict is back at King's. He's been drinking.
At the time, before I realised I had a drinking problem, I felt on top of the world. I felt amazing. I thought, this is great. This is all I wanted to ever do is just, drink. At the peak of my alcoholism, my worst, I would say I was drinking basically anything as quick, as cheap as I can to be obliterated, to block out reality. I was just in my own little world. It was just me, the street, the off-licence, and the can of lager. That was me.
How much do you normally drink a day?
About 74 units.
About how many?
74 units.
74?
Yeah.
A day? In one day? Wow. And what in the cider, is it just cider?
Cider, yeah. No, I could easily have up to 9 litres of 3 litres of white ale.
Wow. 9% cider.
9%, yeah.
What made you start drinking in the first place?
I don't know, you can tell me.
Do you regret it?
Yeah, of course I do. You're very pretty.
Thank you. That's nice of you to say. Make me blush?
Really?
Nah. It takes a lot to make me blush, really.
I think I was about 6 years old, just starting out primary school, and we all got brought into the main hall. This guy stood up and he said, well, this is what we call the trumpet. And he must have played something really cool, like the Pink Panther, or something really cheesy theme tune. And I said, from that day onwards, I said, that's what I want to do. It's letting your emotions free. It's my voice. If I can't say something, I'll let you know via the trumpet. I'm just sick of the withdrawals and the fits. So.
And then you drink to stop you feeling like rubbish?
Yeah, I don't enjoy it. I hate it.
It must be hard.
Yeah,
Hard work. Stop you feeling rough.
Yeah. There were some times if I left the house, you know, I would have my trumpet case with me, but there wasn't a trumpet in there. There was a big bottle of cider. I couldn't stay sober enough to sit through one rehearsal. The drinking had really messed up something that I've always wanted to do.
Yeah, I had a chat with her earlier. So she's growing more groggy now. I wish her a speedy recovery. Okay. Yeah. Okay. No worries, Tim. All right. Thank you. Take care.
It is a marathon, it's not a sprint. Long after the hospital has discharged them, the process of getting well may still be going on, and it's the relatives who carry the burden of that.
First floor of Jamie Wing.
Okay. All right, you go and we'll meet you there.
It will affect a relationship between a husband and wife, a relationship between the parents and the children, or even between the children. They will carry the weight of that burden for years to come, probably a lifetime.
I suffer from severe withdrawal from alcohol. The nurse said, I can't give you a fag. There we go, there's someone a lot worse off than I am. Yeah.
I had 3 children. Simon is very political, which I enjoyed. Emily went to my college and did English and drama, and I love English. And Benedict took up the music, and of course that was my first love and first profession.
I'll see you in a sec.
I'm very proud of Benedict. Taking the lead in Tchaikovsky 4 or Bruckner 4, I mean, at one end of the spectrum, or hearing him playing a trumpet concerto from memory. But when somebody that you've brought up and been proud of is an alcoholic, I think there aren't enough words really to describe the intense sorrow and pain that one can feel. It's a disease which just, it's like cancer or you know, MS. It doesn't matter who you are, where you live, how rich you are, how powerful you are, whether you have one parent or no parents, whether you're in prison or whether you're a high court, it just grabs you. And I think I don't think there is a stereotype. It can happen to anybody at any time.
No. What? I don't know, mate, right?
Yeah, what are you doing?
I've got a bed.
You got a bed where?
I don't know.
Wait.
Yeah.
Come here. Yeah. Quick.
Yeah.
Where is it? Yeah.
Yeah.
Put it on the chair for me. Sorry.
Yeah.
He's just getting back to his walking back slowly.
Yeah?
Yeah.
Walking back.
Is it
Don't need a chair.
No.
Hey, you're gonna fall, mate.
Yeah.
I can't control it and I can't cure it. It's the 3 C's. It's a sort of standard little mantra, isn't it? I can't control it, I didn't cause it, and I can't cure it. And again, that's the insidious part of the disease, is that only Benedict can cure it himself.
Yeah.
All right, cool. Thank you, bro.
Ben, what are you doing outside?
I fag.
To tell the nurse you went outside.
No.
You should have told the nurse.
Hello? There's no blood clot. Oh, and everything's all right.
Oh, so where are you now? On your way back? All right, see you in a minute. Bye. Bye.
Show me the pictures you took in Great Yarmouth that you said you had on your phone.
No, on the camera.
Oh, was it?
Take Annie on the phone.
We're never going to see them then.
No, I didn't take Annie on the phone there.
So she's okay, there's no clot?
No clot.
Hi, Benedict. Hi, it's Emmanuel from Mental Health.
Yeah, I remember.
You remember me last night, isn't it? Okay. What's happening? What happened today?
I had a withdrawal fit. Normally, I have a certain amount of drugs that I have to take, but they're not giving it to me, so...
If you need it, definitely they'll prescribe it for you.
No, but I do need it. One doctor said, yes,
you think you need it, but when they've done the assessment, they don't think you need it.
It makes me feel sick to the stomach that I actually became a compulsive drunk alcoholic liar. I was that guy. I was the guy. I was like, I'm not him again, you know. Here we go again. It's the same routine. I wanted the attention. I wanted the care.
How best will you describe your mood at the moment?
Out of 10, about 1.5.
And how long have you been feeling low for?
I'd say since I was about 19. I'm now 22. I cut my 2 sides of the neck, as you can see.
And why did you do that?
I tried to kill myself. I was going to go for here, but I didn't have the balls to do it, so... When I say the balls, I didn't have the guts to do it, because I was dead scared of what could happen if I did it. So.
There have been many times when I've said to myself and to others, something has to happen here. This cannot go on. Do I kick him out on the street? Do I spend thousands in a private rehab? I cannot handle this anymore.
Do you still feel like you want to hurt yourself?
No, not at the moment. No. I just want to have a beer. Because I know that's the one that's going to stop me from feeling the way I feel. You know what I mean?
Why haven't you kicked him out? Why do you think you haven't?
I love him too much.
Yeah, I'm good to go.
Well, I'm having a go and chat with the doctor, so you just take a seat. I wonder what's going on. I'm not going to see him on a park bench or drinking with the winos down the street corner. I'd rather have him here unconscious than allow that to happen. At least when he's here, I know that there'll be a solution.
Your bloods are all completely normal.
Right.
So your liver function's absolutely fine at the moment. Don't think for a minute that means if you keep drinking like this it'll stay fine, because you won't.
Yeah.
Not at all, but at the moment it's fine.
Okay.
So,
thank you very much for your time.
Okay.
All right, take care.
Thank you. Bye-bye.
He doesn't need to apologise. He doesn't need to explain. Because when he's not drinking, he's my son again, and we just move on. I forgive him. Full stop. He doesn't even have to say sorry.
Missing you already. Bye.
I'm not very good at being romantic or anything else. I suppose that's the one good thing that's come out of the accident, is the fact that it's woken me up, and hopefully I think she sees that I actually try harder now. Couldn't imagine life without her, really.
I went to a detox program straight from King's. I was there for 3 days. It wasn't easy, obviously, because I was the youngest there by about 30 years. But I did it. Every night I lie awake and I'm scared. Dad was powerless over my addiction and my actions. You know, the one thing he said to me was, I'll always have a roof and a plate of food. But I didn't realise how grateful that I should have been at the time, you know, to have a roof, a bed and a full stomach every night and every day, you know. To this day, can't thank him enough. Security control, good evening, hello.
There's a reason why we do checks, okay? There's a reason why we do checks. It's a hospital.
8-year-old fallen 3 metres.
Do you want to go round? Head injury in children always makes me worried. They want, please tell me this is going to all be all right. And I can't, because I will not give false hope.
Surgery. We're just going to get on, do this.
Not scare and get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output? You know?
One of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love.
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
Life.
There you go.
I love you.
I love you too.
And loss.
It's all right.
Unfold every single day.
Don't cry.
And we'll make sure Mummy stays with you.
Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Yeah, just keep your eye on the guy that's sitting on the chairs near the phone. Charlotte was having a word with him when I come down. He's definitely as drunk as a sack. And he was irritating people, so I've told him to quiet down, but he's on the phone. The perception of security is people that couldn't make it in the police force. I wanted to be a police officer, I'd be out there, but it's not like that. Hospital was different, 100% different.
King's has 20 full-time security staff.
I need to see a doctor now! What
Every month in A&E, they deal with over 50 incidents, ranging from verbal abuse to assault.
Some people you can help, some you can't. And the ones you can't, in the end, they go. Either on their own or we escort them out. One way or another, peace has got to be made. Go ahead.
He's drinking alcohol out of a bottle now.
Off, ski Manny, come on. You have to go because you're not allowed to drink alcohol on the premises, my friend. No. Yeah. No. It's time to go. You can willingly walk out by yourself, otherwise I'd have to get my colleagues down here and they will sort of kind of carry you out. And you don't want that, do you? Because I don't want that.
Come on.
Where are you on, see?
Come on. That's it. You can go up. That's it. There you go.
That's it.
There you go.
No problem.
Easy.
Let's go.
Easy, tiger. Easy, tiger.
Easy, tiger. You did it all by yourself. Well done.
Easy, tiger.
Easy, tiger, then.
Come on, then.
Oh, don't push me too fucking far.
He's not pushing
I'm
you.
not pushing myself. You're
Yeah, you are.
When they're drunk, then they could walk in front of a bus, you don't know. So then you're responsible now for this person.
Don't push me.
I'm not pushing you. I'm helping you. I'm helping you out.
Caring, isn't it? Mothering. Because it isn't grabbing people up and chucking them out.
Go on, you can take it from there.
Because if he gets knocked over, where's he going to end up? Back inside, and that's where you don't want him.
You're always making new friends, isn't it?
They're always drunk now, aren't they? Yeah, control that gent's left now and he's gone on the bus to Croydon. Jolly good. I won't go into an A&E, I think I'm dying. And that's what it is, an accident. What is an accident? And an emergency.
Hello, King's Only Resource. Slightly sluggish. Okay, did you know if she had a loss of consciousness or anything like that? Bye. Pediatric trauma call in 8 minutes. That's pediatric trauma call in 8 minutes. What is it, lovely? Oh, nasty. Hello, can you please put out a pediatric
Fall 3 meters onto diving board?
8 minutes.
So has she fallen off this higher board onto that board?
Must be done.
The trauma call is for an 8-year-old girl. She has a head injury after falling from the steps of a high diving board.
Can we have everyone sign in that hasn't signed in so far, please? Thank you.
She's being brought to King's by her mum.
8-year-old fallen 3 meters, GCS not stable, but left pupil sluggish. I mean, it's about our ceiling, isn't it? Just about, she's fallen the height of our ceiling.
Yes.
Yeah, if you're happy to, thank you.
Leading the trauma team is paediatric intensive care consultant Tusha.
This is Abby, she's 8. She was going up to the 5 metre board. She actually got to about the 3 metre board. She was seen to fall back down to 1.5 metres down the steps.
So it's a slip?
It's a slip. GP on scene tried to see the nosebleed and laid her on the floor.
Okay.
Do you want to go around? Why don't you go around to the top end?
Baby, you're so
Take a deep breath.
Hey, baby.
All right. Look at mummy. Look at mummy. There's a good girl. Yeah. Head injury in children always makes me worried.
Abby, you want to sleep? Do you feel any pain here? Okay, Abby, don't worry. Here, any pain? Okay, here. Here.
Seeing her getting drowsy was not good. Her brain could be under pressure from a blood clot.
What does that
that mean if it's sluggish?
Normally you expect it to react very quickly to light, so if it's not, I just want to make sure that there's no reason inside her brain why it's sluggish. So what we're going to do is we're going to take her to the CAT scan to do a picture of her brain. If there is a reason inside her brain, then we need to deal with that reason.
And that reason could be
a bleed.
A bleed. What would be the procedure if that were the case?
I think we should deal with that if we need to.
Thank you.
I noticed the sheer look of panic and that bottled up emotion that every mother has when they're scared.
You're such a brave girl. Yes, you are.
I'm so sorry, sweetheart.
Abby, calm down. Breathe, okay? I know it seems frightening, but I'm here and you are doing brilliantly.
Wanting kind of, please tell me this is going to all be all right. And I can't.
All right. Look at Mummy. Look at Mummy. There's a good girl.
Because I will not give false hope.
And you're amazing, just how are you?
Hello? You need to get up from the floor. Can you do that for us? Nah? Can you get up from the floor?
Sit on the wheelchair.
No.
There's a cooler there.
Still smell alcohol. That makes the thing worse. Did you have a drink today? Okay, so why you are here then?
We're doing this thing at college, yeah, where they talk about you have the right to die. They can't force you.
What are you trying to say?
No. This is Ian Brady. Ian Brady.
Yeah.
There's been a hunger strike since '89.
Yeah. They force feed him, don't they?
Yeah. You know, against his human rights.
No, because they say he's mentally impaired, so he can't make a rational decision. So that's why. If you're not mentally impaired, they can't force feed you. If you're deemed not to be of a mental state to make a rational decision, they can force feed you. Okay? Okay. What? You didn't listen to one word?
I did, but
you didn't, did you?
I did.
You didn't, did you?
I did.
No, you didn't.
I did.
You never do. Is that how comes we've been together so long? You just don't listen to me?
It works for
It
me.
is. It works for you, yeah?
It works for me.
Loser.
A bit too much of
Just suddenly overcome.
the sauce, yeah. He saw you, I think.
Was it?
And he got all unnecessary.
Right.
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
I'm not having any of that. If you're not going to
touch
pull
me.
against me.
Okay.
Come on. Okay.
Okay.
Come on, we can do this. Like
Come on.
3. Slowly.
Slowly.
Good.
Ready?
Cool.
We are getting a lot of alkies lately. And what do you think to yourself? Why are they like that? I don't know if it's because of the life the way it is in London now, I don't know. Or in the country itself or the world. But it's not good.
Come on, you're a big man. Come on. Big grown man. Up you get. Good man.
Well done.
Brilliant.
Excellent.
Well done.
Well done.
Daddy's up in Edinburgh, isn't he?
They're always up in Edinburgh.
Aren't they?
They're always somewhere else.
Just trying to get back down to see you, honey.
Following her fall from the steps of a high diving board, Abby is being taken for a CT scan to find out if there is a bleed on her brain.
Okay, ready? 1, 2, 3, move. There we go.
Okay, all right?
Abby, Hey, we just need to tape you down so that your head doesn't move
Just going to
too
put a little bit
much.
of tape over your head. You can still move it, but I don't want you to move. Just to remind you not to move, all right?
We used to go swimming, and in the centre you can see all the kids diving. And she said, I want to do that. She would just jump off, do these straight jumps, pike jumps. She's just had no fear. And that is quite a childlike thing anyway, isn't it, to not have fear of things. So she would just go for it. It was frightening because when you've got so many doctors around her, you've got one at her eyeballs, 2 are trying to get needles in her arms, and it was just frightening. I'm just waiting on the CT scan. And of course, that's your initial thought is that it's a bleed.
I'd missed the last train. I had no passport. I couldn't fly. I just remember just sitting on the floor, just trying to figure out some way that I could possibly get down to London right away. It's worse than agony. I just wanted to be there.
You okay? So you got your work in here, eh? Ah. Got it. It's on your staff area only. This is on your staff area only. Sorry. Thanks.
I think my brain's not functioning.
That's nothing new though, is it?
I'm being serious.
So am I.
This is so stupid. No, I mean, it's my thoughts are getting all scrambled. You are so... Why do I bring you anywhere with me? You should have stayed at home. You could have hoovered, made the bed, washed up, cleaned the sides. None of it got done today.
No, it's a hard one.
Phone Billy and tell him to clean up.
Yeah, okay.
Please.
I will do.
Thanks. I don't want to go home to a mess.
See the chap in the corner, sitting in the corner with a hood on. Is he booked in? Let me get his name, yeah? Hi, have you booked yourself in? Well, people here are booked in to see a doctor. I'm asking you. Okay. I ask you. If you've been booked in, yes. These are all booked in, but you're not. The staff don't recognise that you're booked in. Okay, the staff have asked. Okay. Yeah. Okay. Then I'm going to ask you to leave then.
Why?
Because you're not answering my question.
I don't have a answer to the question. Oh, that's a rubbish question.
Are you booked in? Yes or no? So you're not booked in?
I got nothing to say to you. I got nothing to say to you.
All right, I'm going to check with the staff now. Again. Why's that? It's just asking to see if you're booked in, that's all. It's not a big deal.
No.
If I ask anyone else, there's no problem saying, yep, I'm booked in, this is my name. Simple. There you go. Sorry?
We'll ask that question 100 times a day, especially at night.
Sorry, hey. Excuse me, hey.
You're in uniform, you've got security across your chest, you're going to be a certain type. I mean, I get it all the time. You're being really intimidating towards me. Why? I'm not. I'm just talking to you.
If you don't tell me who you are, you can't just walk in there. This is a children's area. Yes, we try to get the questions out of him, but he's not answering. This one here? Is he with anybody? Yeah. He is. So why don't you just say, if you're with relatives, why don't you just say, attitude's all wrong? Don't tell me, please don't talk to me like that. Your attitude's all wrong. Yeah, attitude's... Please don't... Hey. Don't do it. Don't do it. Don't do it. The language, okay? Don't do it. Don't do it. No for swearing.
Some people could be upset because they've got a family member who's really ill. But you got to be a little bit sensitive about it. And those type of people you want to try and give a chance. That we finally figured out why he was there. But I mean, that took 10 minutes when it should have really took 10 seconds. Don't. Okay, but you got to understand he's got to do checks. There's a reason why we do checks, okay? There's a reason why we do checks. It's a hospital, okay? You're here with your child. We ain't got no problem with that. All you have to do is tell us. It's not a big deal. Sometimes I go home and I think about what I've seen that night. Or I speak to my wife about it. I do feel fear for the younger ones. Because I know how horrible, the world we live in can be. My mum says I'm overprotective, but my daughter, she gets a little bump on, on her head or something. I feel like I want to wrap them up in cotton wool.
There's this young girl, 8-year-old, who's just had a CT head, but she needs a C-spine X-ray, which is in resus.
The CT scan has shown no bleeding on Abby's brain, but there's still the possibility that her spine has been damaged.
I can't do that, darling, because you've got to take one more. I know. Yes, you can. Yes, you can.
A little bit.
Can I read you a story? Yeah, can I read you one of those stories? Well, you feel helpless. To actually face that your child could be paralysed, it's just the worst feeling ever. Wilma and Biff saw a notice. It was about a go-kart race. All right, baby.
Get the saber!
It'll come up soon, my darling. It'll come up soon, okay? I can't take it off, baby. Not yet. All right? You were such a good girl.
We're
Is
going
that
to go on
better?
a little journey again. We're going to try and get those x-rays and those pictures of your bones, and then
All right, darling.
hopefully
All right, baby.
we'll be able to take all this tape and that horrible collar off.
And can I go home?
I think, sweetheart, because you had a nasty bang on your head and you're a bit sleepy.
Oh, don't cry.
Let's see. Let's get this
Listen,
X-ray
we'll
first,
see, okay?
Yeah?
And we'll make sure Mummy stays with you.
As someone who was so bubbly and crazy, it was sad to see her little broken body and her broken spirit. But I still have to say to her, you're going to be fine. You're doing really well. Just to get through it. Just to get through it. Yeah.
Hi. Teacher, going to do a few pictures of your neck today, okay? Alright, hold nice and still there. Oh, you're doing really well. Okay, you've just got to stay nice and still for us, alright? Take this collar off, it's double stranded.
Can I bring a mum in and put an apron on?
Yeah.
Abby, you just need to get the pictures on. Should we get Mum in? Should we get Mum in? She's coming. She needs a neck.
I'll be better.
You're doing so well. Darling, I'm here. Really still for us.
Brilliant.
That's fantastic.
Let's enjoy the
Good
feeling
girl.
of coming off.
Oh, is that nice? Stay
Don't
still.
move, don't move.
So you must stay still, darling. Good girl. Keep nice and still, okay? Abby, listen to me. Make my hand go up and down with your breathing. In, nice and still. Abby, listen to me. Right, it's going to be 2 minutes, okay? See if you can be a statue. Okay?
Brilliant.
Can you make my hand go up and down? That's it, up and down. Good girl. Imagine you're on a nice warm beach, okay? The sun on your face. See, can you hear the waves crashing on the beach? Okay, it's lovely and warm. Oh, that's a good girl. Yeah. Well done. That's a good girl.
Is that you?
It's me. Lunny.
Looney, I don't know.
It's okay.
46-year-old Michelle has come in with back pain. She's here with Hubert, her partner of 30 years.
So tell me, did you have an epidural yesterday?
Yeah.
What was that for?
I've got nerve damage and a slip disc.
Oh, so you had a spinal injection?
Yeah.
So since the time it was given,
As
it
it-
felt shaky?
Really shaky, and then as they pulled it out, then I just thought I was in shock because it really hurt. Gemma was breech. Ashley, Ashley was the worst one, and Billy was born in 6 minutes, and I had him in accident emergency at King's College, and Ryan was 20 minutes, and then Amir, I think, was about 30 minutes, start to finish, got spontaneous labour. But it's right down the bottom they gave it, right there. When I had Amira, through the pregnancy, the weight of the baby was completely on my spine. So it caused some nerve damage, slip disc. So what they decided to do was give me a spinal injection of steroids to try and calm the nerves down. And I had a really bad reaction to it.
Okay, because this was done by the anesthetics department, I would actually like to, I would like to speak to them, and I'll let you know what they say. So let me just speak to them, yeah?
Okay, thanks. You meant to put that in there.
Yeah, it says domestic waste only.
Jump in then. So funny.
What if I could ask them about my knee while I'm here?
Oh, you better get a grip.
I'm being serious.
So am I.
James.
What?
It says Surgeon Smith. Speciality, pain.
It will listen, you don't understand.
Specialises in pain. That's like one of them Dr. Death type dudes.
God, mate, you don't understand how much that hurt to get a needle like that up into your spine. And he tells me, hey, just a little prick, just a little stinging sensation. And you, but I wanted to cuss. My face just feels like it's bright red. Is it red?
I'm not going to answer that.
Is my face red yet?
Yeah, it is as it was, yeah.
We were lucky enough to meet each other at a very young age. Sometimes relationships are long as ours, with as many kids involved as ours, you sort of lose sight of each other. And we always manage, you know, to pull it back in and enjoy each other's company. We still argue, I feel a little bit better.
Should we go home then?
Would you go home if it was you?
I wouldn't come here.
Why are you such a fronter? You bang your toe and it's an emergency call to the hospital. You're the biggest hypochondriac I know. Oh, my knee. Oh. You're not even listening to me, are you?
Did you say something?
Yeah, I thought so. We will not argue in front of the kids. We won't do it. That's why I hit you so often, you know, because you just don't listen.
Call that spousal abuse.
I'll go in one room and he'll go in another room and we'll text each other abusive texts until we make each other laugh. Right, I won't be a minute. I'll be back. So this one little thing I've got wrong with me and, you know, the aches and pains, and yeah, it impacts on my life. But then I just think, wow, like, how lucky am I? How lucky am I that I've got 6 amazing kids? I need them as much as they need me. You know, they're sort of like, they're my breath, you know. They're my life, they really are.
Uncle Stuart's here. 24 times. And say hi. Hey. So she's got the imprint of the steps.
Okay, that's fine.
She was so flipping lucky she didn't kill herself.
I know, could have been.
I'm surprised that, you know, it didn't smash her skull if she fell from that height on concrete steps.
Or maybe she fell halfway down.
Abby's X-ray shows no injury to her spine, but she's fractured her eye socket.
You all right, baby? Think you're going to be sick? All right, darling. All right, my baby. All right, baby. All right. It's all right. There you are, darling.
This is to be expected, the vomiting, okay?
No, they can decide what they want to.
All right. Just rest.
So you just just relax as much as you can.
She's got a fracture of the orbit, which Max Fax needs to see. Okay. What can happen, however, which is why you're staying in, is that imagine if you fall over and hurt your knee, it swells up before it goes down. You can get a bit of swelling. That's what we're looking for. And that's why we'll be poking and prodding her to wake her up.
Yeah.
She's been really good, really well behaved. She is a testament to you.
Hi. She's fractured her eye socket. Yeah. She nearly broke my heart though, because at poolside she said to me, "I love you, Mummy." But she's done so well. She's been a little trooper. The doctor said she's a testament to us.
I just wanted to comfort Abby, I wanted to comfort Nikki. Suddenly you just realise that your family, there's the little family that you've created, and it's bigger than anything, really. And you just feel as though you want to make everything better, you know, just to look after them, protect them.
Hello, baby. I hear you being very, very brave. You're a very good girl. You're a very brave girl, darling. Oh, my little darling, my little poppet. I hope you're okay. You're well done for being a really good girl and a really strong girl. Yeah.
Go buy Banty. Buy me chocolate from there. You go see him. You know Bounty, the one where they get coconut in the middle. You will see it. You will see the number. You know how to operate it.
I know what I've got. I've had it before. I've got bronchitis.
Well, you'll have to stay in because his X-rays don't open till 9 o'clock in the morning, so you could stay in.
They can hear it on a what's it, on a stethoscope.
Stethoscope?
I can't talk properly, I've lost my teeth.
I was going to say, they still use them.
You bought the wrong thing. That's Snicker, innit? That's the wrong thing. Bounty is the blue one. Maybe the Bounty I can see is in front of you. You go buy Snicker.
Oh, here we go.
Yeah.
No, it's not me.
Got my tablets.
My manager loves Snickers.
My children love this. Either when they were young, Robert loved Snicker. Michael liked Masba. Masba is true.
Mama?
Hi, my name is Ade.
74-year-old Joyce has been brought in by her daughter Anne and her grandson Chris.
Can I say something?
Yeah.
I'm not trying to tell you your job. I haven't smoked for 3 days because I can't smoke.
Okay.
And I think it's bronchitis, I don't know.
What, you a doctor now?
I've not had many illnesses, but when I do get an illness, I know it's bad, and I know what it feels like.
Oh, no.
Therefore, I can tell the doctor what it is.
She diagnoses everything now.
Yeah, that's all right. I mean, you know your body, and if it's happened to you before, and if it looks like that, it may not be, okay, but it's a good observation. If you've had the experience before, you think it's similar to what you had then, that's fair, Okay, so the plan now will be, we'll do some blood tests. I will organise a chest X-ray for you. All right? Okay, I'll speak to you later. All right.
All right, thank you. And I want to go to the toilet. You take me down to the toilet, please. Where is it? Down here? Go to the toilet.
Toilet, yeah. Have you given us a sample?
No.
I get you a tiny pipe, yeah?
This should be fun.
Oh, I'm not helping with that.
I didn't ask you to.
Yeah, let me get it out and set it up. You'll be in there forever.
She's coming home, gutted.
You have no manners.
No, she's coming. No, they discharged her, yeah.
Michelle has no infection as a result of the epidural. She's going home and being asked to come back if symptoms get worse.
So did you hear that? You have to stay home and care me.
Did she say that?
That is what she said.
Oh, I didn't hear that.
She did.
That's a pity. I would have done it if I heard it.
The good thing is, though, they're going really quick, aren't they? Getting things done.
You know, it's because of her age.
Yeah.
It's your fault.
It has to be.
Sending me the wrong way.
It has to be.
I keep telling you, dumbass.
Thank you, Michelle.
He's fine. He can. The ambulance driver said he can walk. Stay in there.
The security team has been called to help a drunk and disruptive patient with suspected mental health issues.
Stay in there.
They need to keep him in the treatment bay until the psychiatric liaison nurse arrives.
Will you stop grabbing hold of me, okay?
Hello, security control here. How are you? What has Marley said to do with this patient?
Say again?
What has Marley said to do with this patient?
Well, she's going to see how it goes.
It's always a difficult situation to deal with. It's not the same as if somebody was being aggressive and they had no mental health issues. You could just chuck them out if they're not that ill. But if somebody's got mental health issues, they need help, and it's your job as part of the A&E team to help them.
I hear voices in my head. I hear voices in my head.
Yeah, the PLN's going to come out and see that patient.
Yeah, they're probably not because he's intoxicated.
What that person's doing, that you know that person is not aware of what they're doing. You just know they're in a different place.
Oh yeah. Hello. I've got to hold him like this.
Good morning, sir. How are you?
Someone wants to talk to you now. Come on.
There's some things I've seen that's stuck with me for years. I mean, you're meant to be security, you're big and you're tough and, you gotta deal with this every day, but, we're only human as well. We got families.
Hello.
Your X-ray shows that you've got chest infection.
Mm-hmm.
So you will need antibiotics, and hopefully everything should clear out.
Oh,
all right?
good. As long as I can go home, that's all I
Yes,
want to do. Thank you. got me result of my X-rays.
Oh yeah.
It's a chest infection. So that's not so bad. So I've just got to wait for my blood results now.
Well, at least that's good news, isn't it?
Yeah. I bet you're both wishing you stayed at home now.
No.
You must be
Because
tired.
I wouldn't have been able to sleep anyway. Now I know that it's a chest infection and they can treat it.
You need to stop thinking about everyone else and think about yourself a bit more often. People should start thinking about you more often.
Yeah. You just need to motivate yourself a little bit more. That's what it is. No, because you're not motivating your bones, Mum. Your bones are seizing up because you sit in that chair watching that bloody Dickinson, man. Antiques Roadshow and all that crap.
Dickinson's Real Deal.
Yeah, the real deal.
I like Flog-It.
Same thing.
And CSI and Casualty.
Yeah, I like CSI. I watch CSI.
And I like Holby City better than Casualty.
You got far to go?
Forest Hill.
No, far enough.
But she brought the tablets in.
I've got them in.
It's okay to go now, yeah? I've got my tablets, so I can go now.
Yeah, you can go.
Okay, thank you very
ladder
much.
goes straight here.
Okay, thank you very much.
I won't sleep well tonight.
Anyway, thank the pair of you.
Don't be silly.
Well done, darling. So much. I love you more than bacon. You're supposed to say something back. Sausage. Sausage.
That was quite a special time that night because you're just open and vulnerable and fragile. For me, having that connection that night as a mother to a daughter, I think will always remain with me.
It's starting to get light outside already, isn't it?
Oh, it was really nice. Last night before we came to work, I was sitting, my laptop, my window was wide open, the sun was just going down slowly. It was a really lovely evening.
Book yourself on the desk. Hello, I know.
And your desk?
Yeah, there.
I swung
you
my
done?
finger pretty bad.
Accident?
Yeah.
Or intentionally?
No, accident.
Which fingers?
It's my thumb.
Oh, this one. By what? By its arm?
Standing on.
Is it left thumb?
Yep.
Hello, Michael. I haven't seen you for a while. How's it going? Keeping busy? Hello. Morning.
Good morning. Why are they passing you by what?
Sorry?
Why are you standing here? I was waiting for you.
Oh, yes, exactly. You got it right. See you later. See you, Mike.
100 years from now, there will be about 500 million dead people on Facebook. That's not even funny.
It's the truth, though.
It's not funny.
Well, we're 20 now. I'll probably say we've got like maximum about 50 to 60 years left. So we've actually been through about a third of our life already.
Have we?
Yeah. If you think about it, look, we're 20. Then we're going to be 40 in 20 years' time, right?
I'm dying like when I'm 150 something though.
Oh, okay.
Do you know what I mean?
Yeah,
I don't know about you. I know when I'm dying 150 something.
I don't ever want to die, so especially seeing it here, it brings it home. So you do, you just go out and enjoy yourself. And you come to work and you can enjoy yourself by helping people. That's me.
I am getting better, ain't I?
Probably a week after the whole incident, that both Scott and I would just burst out crying for no reason. But I think what it was just all that pent-up emotion.
Because after the accident, there was a period when we didn't have our little girl. We had some girl who was quite morbid. I think she had just had a shock, a really, really bad shock.
Diving off quite a height since I had the accident has been quite hard. And children kept coming up to me and saying, "How's your eye, how's your eye?" It was turning yellow and purple at the time. It turned lots of really weird colours. It turned green, purple, yellow and grey, black at first. Really weird colours, and red. That was all the colours it changed into. I would like to go high, but I thought just leave it for a few weeks and then start doing 5 metre again.
This is Nicholas. He had one punch to the face. This side is fractured, that side's dislocated.
I think it's better we take the nail off.
I feel like out of everyone here, I'm the most dramatic looking.
There are many patients who have a dislocation. The longer it's out, the more difficult it is to get back in.
No, stop!
Surgery. We're just going to get on, do this.
Not scare and get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output? You know?
One of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
Life
There you go.
I love you.
I love you too.
And loss.
It's all right.
Unfold every single day.
Don't cry.
And we'll make sure Mummy stays with you.
Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her. Come on. We've got to be strong for Mum. If it is the last bit, hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Do you want a cup of tea or anything? Are you waiting to be seen? Yeah. Do you want me to help carry something?
Rugby? What exactly happened?
I was tackled.
Tackled. So you were the ball carrier?
Yeah, but I was going through two guys at the same time and they went down.
Looks like your kneecap's come off sideways, hasn't it? Are you all right looking at that?
Of all the patients who arrive in A&E, 14% fit into one category. Young men.
Do you remember about the family tree and where I said the family are from? Well, Dad's parents and Mum's parents, so that's 4 grandparents, and they're all from different places. And I tell you already, but you just forget. You just hear it, and you just think, yeah, you've gone out your head already as soon as I tell you, innit? You gotta remember it, it's important. You don't think it's important?
This is Nicholas Baldons. He's 26 years old. He had one punch to the face, and we don't believe he was knocked out, but ever since then his mouth has been locked open. Apparently this side is fractured, that side's dislocated, there's bone inside his mouth. I've had to suction him about 5 or 6 times because his mouth just keeps filling up with blood on the way. He hasn't been able to speak, obviously, at all. Okay.
26-year-old Nicholas has been punched in the face in a random attack.
Right. Should we call you Nick or Nicholas? Whatever. Just pop your head back, just make yourself comfortable there. That's it, that's it. I know we're not going to strain this too much. I will take that suction there for you.
So when do you think boys become men?
40. And then they regress shortly afterwards. I'm approaching 50. That's next February, and I like to think that I can do the same things now than I could previously. But I mean, you know, if you go out and you have a few drinks with your mate, it becomes harder to recover the next day. You like to think that you can run, you can ride as long and as hard as you did before, but that's not the case. Look at that there. Is that tooth or bone?
Looks probably a bit like bone, actually.
Yeah, exactly. It is bone. It's rubbing on your tooth, rubbing on your tongue there, Nick, yeah. Try and close yourself together there, Nick, if you can. I don't suppose you can. Okay, and that goes with the fact that you can't close that there. Nick, I know it's really dry there, but can you say ah? Oh. Excellent. Should have been a singer. There we are, okay. So it was just the one blow? And were they standing in front of you? Yeah. Never injured your face at all in the past? A couple of times. Any breaks? Yeah? Jaw? Oh, any treatment? No, no plates or... Sorry?
It's okay. This okay.
Okay. All right. No any fractures of your cheekbone? With Nicholas's injury, it was unusual to have a fracture as well as a dislocation at the same time. So it's a pattern that most people wouldn't have seen before, and I haven't seen one for many years. Nick, I'm just going to feel very gently, okay, along the low border of your jaw here. And what I'm feeling for is the fact that this is all intact here. and here, and that's what runs. But when we get to the angle here, yeah, okay. There are many patients who have a dislocation acutely on the rugby field, for instance, or sporting, which can be put back quite simply. But the longer it's out, the more difficult it is to get back in because of the spasm that the muscles go into.
All right. Do you want to know details of what we're going to do, or should we just crack on and do it? Just do it.
33-year-old Simon dislocated his kneecap 3 hours ago.
Right. Puffing on the gas and air again. Okay. Nice deep slow breaths and try and hold it. Okay. All right. Hold fire. It's well. Don't. Keep breathing. We might need to give him more drugs again.
Nick, I haven't seen any radiographs, X-rays at the moment, all right? But given the degree of the fact you can't close your mouth together there, obviously you fractured it on here, and that's where you were hit. It's going to be difficult for you to rinse your mouth, and the blood will be a bit dried there because you can't get your lips together. And if you can't get your lips together, guess what? You can't swallow. So that's why it's impossible to do that. All right. So keep going with the suction or whatever, and we'll get the X-rays and we'll get you treated as quick as we can. All right. Good.
All right, Simon. This drug, it doesn't have a set dose. Everybody responds differently to it. So we give it little by little till we find the right dose for you. All right. Your job, very simply, is just to keep your eyes open, and then when we reach the right dose, your eyes will close, even without whatever happens. So that tells us it's good to go. All right. So you'll just relax, nice deep slow breaths on that. Keep your eyes open as long as you can. All right.
Simon is given fentanyl, a strong painkiller like morphine.
Might be feeling a little bit lightheaded. Some people say this drug's like 2 or 3 neat shots back to back, and you feel a little bit woozy, a little bit out of it. Okay, Simon, open your eyes again, my friend. Simon, can you open your eyes for me? Okay. One more time. Matt, one more. You saw how much you jumped last time, so let's get nice and deep. Straight head back, Simon. Okay, Simon, can you open your eyes for me? Okay, right, just here we go. He's going to shout a bit again, but there's not what we can do about that.
Oh, for fuck's sake! No! No, stop! Oh!
We're in.
All done.
Thank you.
Thank you. All right.
Right, so come back round this way, that's all right. So your sheet will be a bit wet, I'm afraid, where we've done the plaster. Are you comfortable, or do you want another blanket under there?
I'm actually comfortable.
You're comfortable, okay.
You look like a vampire. Messy one. Is it still painful, or is the stuff helping? Yeah, really painful.
So how's it going at the college, football-wise?
Football?
Yeah, the last match. How did you guys get on?
Lost 3-0.
3-0? Your team lose kind of often.
That's the manager. He made 7 subs.
7 subs in one game?
17-year-old Terrell has come in with a damaged big toe, and his father, Adrian.
He's going through that period in time in his life where he's been a bit independent, and it's the hardest thing. You say to your kids, "Hey, how's your day been?" "Fine." You know, "What you been doing?" "Football." Then you're like, okay. You know, so every parent goes through this. It's not just me. So you just think, you know, how else can you interact with them? And the funny thing is, yeah, when I started this family tree, I didn't even know my grandparents' names. I didn't know what their names were. I just called them Mama and Papa. You know what Granddad's name is?
Yeah, I know his name.
You should do. What about your great-granddad? What about Nan's dad? You know what his name is?
No, I forgot.
How can you not know? You see, that's what I'm saying. I never had a relationship with dad. I never knew him because my dad died when I was 7. And it's not until I actually became a father that I realized, wow, this is the impact a father can have. You know my mom's name. You know my dad's name. What about Nan's dad's name?
Nah.
Possible. But you know all the teams in the Premiership. You know all the teams in the Barcelona League.
I don't know.
Yeah,
all
you
of that.
do. And you know, and you know all the players in Barcelona or Spain. What team? What country they're from? Yeah, you do. But if I ask you where your family are from, you ain't got a clue. How does that make any sense? So all the players in the Premiership, you know what country they're from, yeah?
Yeah, most of them.
Exactly. So you know your team's history, but then if I say to you, all right, then where are you from? You'd be like, I don't know.
So tell me about your parents. Are they doctors?
No. My father is 96. He left school at the age of 13 to work in a brickyard to support the family. My mother left school at 14 and was a shop assistant. So I was the first person in my family who went to university, or in fact, for that matter, did an A-level.
Rob is the clinical director of King's major trauma centre. He's also a world-renowned specialist in facial injuries.
When we're treating facial trauma, it's very much the person. You can injure your arm, your leg, and obviously undergo life-saving surgery. But if you injure a face, that patient expects that face to look exactly the same afterwards than they did before. It's us. It's what we are. It's what defines us.
Oh yeah, oh no, that's your tooth.
Nicholas was assaulted in a random attack 6 hours ago. Since then, he's been unable to close his mouth.
I'm sorry, Baba. I don't like seeing you like this.
He's come in with his long-term girlfriend, Holly.
I hate fights. I hate fights in general. I hate it when it's someone I love.
Don't worry, I'm going to be here with you. Okay? Not going anywhere.
I don't understand it. I just don't understand why you would fight. I don't understand why you would want to get to the point where it has to result into that anyway. Either walk away or these people are just not right in the head that they go about looking for fights because it's like a macho thing, I guess. So I don't approve of it.
So top of your ear, okay?
He's definitely not the fighting type. When I first met him, for sure he was a boy. He was kind of hyperactive. The amount of times he hit his head when I first met him, and I don't mean knocking the head, proper wanged into a wall or a ceiling or something, some of these slanted ceilings. It was just to the point that everybody feels awkward because it must have hurt like hell.
I love you.
Sometimes I feel like a little bit like a mum. I'm like, can you slow down, don't run, or are you going to hurt yourself? That sounds really terrible to describe your boyfriend as you're his mum, but that's the way it is.
Now, if we look carefully on his right side, what's that? And what's that? So what's he got? He's got a dislocation. That's why he can't close his mouth, because he's dislocated on the right-hand side. You can see he's sort of, now this will be good, there you go. What a shot. Hi.
Sorry.
No, it's all right, Nick. Just to say, had a look at your scans now. You've only got one break, which is on the left angle of your jaw. Why it's propped open like this is the joint here is dislocated. So if you look on me, you can see how it moves there. When you've been hit, not only have you got a very nasty fracture on this left angle, but this one here has actually popped it and a joint. That's why you're propped open. We'll get you fixed today. How long? Well, we'll get your fracture done today, all being well, and chances are you'll be going home tomorrow. All right? Now I'm just going to try something very gently, because it might just make you feel a little bit more comfortable in the meanwhile. It's going to be a unilateral segment, so I'm just going to see, because I'm just thinking while he's here, we'll just see if we can make this a little bit more comfortable for you. I don't want to give him any sedation or anything like that. If that pops back relatively easily, which it might, it's going to be a lot more comfortable for him in terms of where he is at the moment. Nick, just pop your head back for us. That's it. Okay, now just bear with me. Just here. Okay. There. How about that then? Better? Close your lips together. You can swallow now. Does that feel easier? Oh yeah. yeah, transoral and buccal. What we do need is...
I felt relieved from the moment he stepped in the room, because it looked like the man in charge, and then he just came to me in a couple seconds. He just put a finger on my teeth and then like locked it, like I don't know exactly what it did, but it went cluck cluck and it was all sorted in a couple seconds with like a magic thumb, and it all went back where it should be. Well, from that moment I knew that I was in good hands.
Do you remember when you became a man?
There is a time in your life which is unspoken. And I think that between... sorry. When the responsibilities change from your parents to you. And I think looking back visibly, I remember standing at the side of my father's car and he gave me the car keys. And something in that unspoken act said that that was that transition. And my father is now 96. He was a fit man until very recently. He now gets about with the aid of a wheelchair and his memory has gone. And I think that passage of right, if you like, it's the start of something. And now is the time to give back.
Is she on a beta blocker? Do we know what medication she's on?
Any medications?
Nothing. How old is she? 78?
78.
So but she's recently diagnosed with a blood clot. Confirm. You don't know.
78-year-old Amway has been brought to King's by her 26-year-old grandson, Ho. He's training to be an architect. Every day, he cycles 10 miles to visit her in Peckham. Today, he found her collapsed in her flat.
It was a shock when I found my grandma. She always has refused to go to the doctor. I think that's one of the things in our culture we preferably do not want to know if we're sick. We rather, knuckle down and live through the pain of it. It was quite a horrific moment because I'd never seen her so fragile before. She came over here roughly around about 1970s during the Vietnam War. During my childhood, my mum and dad, they worked in the restaurant business in Chinatown and they worked very late hours. So I never got a chance to spend time with my mum and dad. The person I call, the person I cry on is my grandma. Yeah, she's a mum figure. She didn't speak my English, but the words that she did know, fuck off, get out, how much, cheaper, and, ideally if she ever gets lost, where is Peckham? Because I've been brought up in the UK, we shy away at asking something to be cheaper or freebies. But you bring grandma along, they knock off a few quid. I think that's a skill that I probably never develop over my lifetime.
We've got quite cold hands. Does she want another blanket, do you think? No? Comfy. So I've got very warm hands.
Sorry, when was the last time you gave the Clexane, the injection?
Yesterday.
Okay. Yesterday, hello?
You don't spend your time normally in hospitals, do you?
No.
A lot of people think that if they come to hospital, they're only ever going to go out feet first. Especially the older generation, that hospitals mean death, and so people are afraid to come into the hospital setting. But disasters happen. I'll never forget one time when a baby had died in the emergency department. This was when I was working as a radiographer, and the mother was screaming her head off, and she was running up and down resus, running up and down, just hysterical, and her little baby had died. And I came along with my little X-ray machine, and I said to one of the nurses, "Isn't anyone going to, go and talk to the mum?" They said, "No, we just leave her. She doesn't want to be touched." And I thought, that's amazing. She couldn't be touched. She didn't want to be touched. She just needed to scream her head off. She needed to release that grief there and then. I know the smell, the sight, the sound. I know it. And it's familiar to me. So when I saw the granny, I could look and see and know that she was not long for this world.
Oh, man.
17-year-old Tyrell has damaged his big toe playing football.
Crazy. Can you kick the ball like that? They might have to take the toenail off. Huh? Do you know what they're gonna do? They're gonna freeze your big toe.
Gonna freeze it?
They freeze your big toe, or they gotta take it off. Not freeze the whole toe, but I think they do something where they freeze the nail. I'm not sure. But it's gonna hurt. It's gonna hurt.
Are you with someone or are you by yourself?
Yeah, Dad.
Come round this way. Tell me what happened.
I was playing football. Had the ball. I went past the player, then he stepped on my foot.
A player stood on it.
Yeah.
How much do you play football?
Yeah, every day.
Well, yeah. I think it's better we take the nail off. All right?
Do that now?
Yeah.
Are you ready? Yeah, he's becoming a man. He's experiencing pain, you know? He's learning to deal with it. He's squeamish, you know what I mean? He's like that.
You okay, boss? I know you can feel me pulling.
Yeah.
But there shouldn't be any pain.
It's gone off. It's gone.
There's still the root.
There's no nail there. Nothing there.
I'll show you.
You know, and I'll still say I love you. It's saying to him, regardless how big you are, I still love you. You know, so.
Does he tell you?
No. No, he doesn't. He doesn't tell me.
Ah.
Do you remember about the family tree and where I said the family are from? Nah. You gotta remember it, it's important. You don't think it's important?
You've got all these wires going everywhere. Where are you going?
No, I tried to call my check.
You want to go home?
So I thought you were do a checkup.
Just lie back for me, okay? Just lie back.
Bằng tay.
Doctors suspect 78-year-old Amway is bleeding internally. They are investigating the cause.
I'm just gonna tell him to look at her eyes. Sorry. Can you show me your tongue? Show me your tongue. How to squeeze both my fingers? Just squeeze. Squeeze. Squeeze as hard as you can. Good. And this side as well. Squeeze. How to pull me towards her. Pull me towards her. I'm sorry. I know this is all tiresome. Pull me in. That's it. Okay. Sorry. I know it's the last thing she wants to do right now. So I mean, a lot of the A&E doctors have seen and the surgeons have seen, and they think there's probably a bleed in the upper GI tract, so somewhere in the stomach or a bit lower down. Now what we're going to do is we're going to give her blood to make her hemoglobin go up essentially, and they've given her a map as well, so that's the next step. So we'll give her lots of medication to if there is any bleeding, that the clot forms. Okay. Thank you. I'll see you a bit later on, okay?
手仲好凍咯，我個手掌冰凍。
Hands actually explains a lot about the person's lifetime and what they've been through, and I have pretty, boyish, girly hands, unfortunately, but my grandma has very strong masculine hands, and you could tell that she worked hard, you know, back in Vietnam. She was usually working in either factories or in the fields, and, you know, wages didn't really pay, you know, to support her children. So, you know, at times she did tell that she used to take stuff from the factory or from the fields as extra portions for the kids during that time to survive. But, yeah, my grandma would probably want to go back for only one reason: it's to have dog meat again. It sounds weird, but yeah, my grandma said if I want to go back to Vietnam, I want to have dog meat. And, you know, we did raise a dog when they were younger, and eventually when food supply was over, you know, Dad got a chop. Don't be shocked. Come on, it's the way of life. She is a very tough lady. She's like Margaret Thatcher. She ruled iron fist. When she starts to become old and fragile, and you realise that she's getting quite vulnerable, I think that's the difficult part about it. And you want to provide back. She cooked, she did all the washing, all the dishes, everything, maintenance, cleaning the house. She was pretty much a superwoman. She looked after me always. And so I felt I had the responsibility to go and look after her.
I feel like out of everyone here, I'm the most dramatic looking.
Tomorrow morning I'll be coming ice skating with my class.
I can't come tomorrow. I can't.
See how you feel.
I'm not saying that I won't feel like it. I'm saying, how can I go there to a beginner's class, like with all the other beginners learning to skate, so excited, and then, oh yeah, I did this on the ice last night.
Like you say, just pop your hat on, no one will move.
I might wash my coat first as well.
Yeah, do that. Well, now they get like... Was that what I thought it was?
These things are sent to challengers.
She's still cold.
Yeah, she still wants a drink.
What about another coffee? All right, I'll remember the sugar this time, all right? I'll go and get that for you.
Since arriving at A&E, 78-year-old Amway has been given a blood transfusion. Further tests are being done to find the cause of her collapse.
我車你背啊，婆，我要翻嚟行落到翻架車，落車翻嚟攞啦。
咁啊，
舒服啲啊？仲痛係咪？
Nhưng mà xử đây xử rồi. Hồi tí tao cứ cho xì phòng. Ý nuôi mới sắm tới.
Sẽ càng gặp họ.
Ý nuôi ở bộ phận nó xỉn tròn sủi.
Sẽ càng gặp họ. Ngoài đây đâu hả?
I think with every elderly person, there's this mysterious factor about them. You see this sort of ideal image of your grandma when you're younger, and then when you have a few drinks, it's like, you know, a completely different person. She would mix all her drinks. She had brandy, she had red wine, white wine, a lager, beer, you know, shots, and she would mix them all in one drink and, you know, drink that, fall asleep, wake up and re-drink that again. I think drinking always numbs the pain, and I think by the time my granddad passed away, she was very upset, very alone, and it was quite sudden. No one really got a chance to say goodbye, and it was very upsetting for the family, and especially for my grandma. We did tell her that, you know, her drink will probably eventually kill her, and she said it's worth it, so it made her happy.
Chụp kêu ra nghỉ tận mấy vậy.
Ý check你個心臟有咩問題啊？依家冇事嘅，冇可能下次有事嘅。嚇？因為你屙血就流出嚟嘛。
係屙血都
有阿婆有好多血添啊。
係咩？
係啊，你屙屎嘅時候屙到好多血出嚟啊！你賴屎嘅時候啊，真係好令人驚啊！有血有屎添啊！而家你救護員依家睇緊你啦，醫生嚇，我幫睇嘅。
This could be the end of my skating career.
No. You'll be fine. You'll be fine.
I'll be fine. I'll be fine. Anyway, tell me what it looked like. Did it look bad?
Do you want me to draw a picture? It looks like you kind of like. Do you really want to?
Can you see my bone?
No, because it was all bloody. But no, well, I don't think so. Didn't look that bad.
Okay, draw it.
So. Oh look, it's even a red pen. How appropriate. So
that's my face. That just looks like my eyebrow. It's fine.
No, but it's like heart. It's kind of like here, and it just looks like you've torn it.
Tearing sounds like it's going to look uglier when it fixes.
Well, it'll be nice and swollen, so if you fall on it again, it'll cushion it.
Yay!
It's fall from ice.
Yes. I was only on the ice for 5 minutes.
Only on for 5 minutes?
Yeah.
Do you want your friend to have a look? Do you want to inspect it?
Beautiful.
Thank you very much.
Have you ever been a patient?
Yes, I have. I've had a life-threatening condition. I had cancer, breast cancer 12 years ago, and that gave me a really huge scare. Because I'm also a qualified mammographer, so I knew After I felt a lump, and then I went for the x-rays, and then they took a bit longer, and then they had to do another view, and I thought, oh no, these are my colleagues, well, they're being so slow, something's wrong. And then when I went in to see the doctor, and the x-rays were up, I saw the cancer myself, and I went, oh shit. I didn't want to die. Other times in my life I thought, oh God, sod this, I don't want to live anymore. I think we all do. I think we all have huge dips as well, when tragedy strikes. But when you're in a really, really good place, and that could be taken away from you, that made me understand how precious life was. And that's also what I see in the roles that I've done within the health service, is that sense of life is precious. Life is really precious.
Last year, she lost a lot of weight. It was that she couldn't, she wouldn't eat. She couldn't. Every time she ate, the food just seemed to come back up again. So we thought, well, maybe there's something wrong with her, but we never knew how severe it would be. So it was shocked when they diagnosed her with cancer. We all got very angry. I think anger for the fact that no one picked it up earlier, or anger the fact that we didn't ask her to go to hospital, or anger the fact that none of us could do anything about, providing her, a cure. And that was the toughest part. You always believe that your grandma's so strong-willed that she will make it through. Apple. My grandma taught me it's like family will always be first. If I ever have my own children, that's what I'll pass on to them. What drives me is the fact that how strong-willed she was. She put more physical effort into doing things, and that thought spurs me on to do well and, not moan as much. I always miss her. She made me the man who I am today. Oriental people have a lot of kids so that one day one or two of them might do well in society. When I told her about being an architect, she was very pleased, and I think near the end of her life she said that when I'm going to start building her a house, and I think that was another goal for me, and I think that was one of the things that drove me on to become an architect. I think she would be very happy right now.
Adult male trauma. We have got food rid patient.
You're thinking what will kill him first?
You got a pulse on the groin? No? Have we got a good pulse anywhere else?
For some reason, the blood is not running through.
When you do that job every day and you realise how short your life can be, literally nothing's taken for granted.
Surgery. We're just going to get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop!
A place where love.
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
Life.
There you go.
I love you.
I love you too.
And loss.
It's all right.
Unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Wait 2 hours. Fuck off, man. 2 hours they're asking me to wait. What do I look like? A mug? I don't think so. 2 hours. Kiss my ass, man. I'm sorry. I'm sorry. You remind me of my nan. You look like my nan.
I'm not that old, am I?
Happy Valentine's Day.
Not it's a 12 o'clock.
Valentine's Day in A&E will see 307 people treated.
Sorry, mate. Thank you.
12 will be red phones.
Cool.
6 will have been assaulted. And 3 will be arrested.
Valentine's Day today. I have to remember to stop on my way home and buy some flowers because I'm going to be shot. I tried to cancel it, but
I'm completely absolved from any Valentine's Day responsibilities.
Lucky.
Well, it's not a very romantic place at the best of times, I suppose.
We had, a couple of years ago, was a couple that had had a blazing row, and we didn't realise at first that this is what happened, but one of the guys came in and he only had half a finger. And we were like, oh, what did you do there? And it, you know, first of all, I caught it in a door and then, you know, some other story. And in the end, it transpired that his partner had bitten his finger off.
Relationships in A&E can go either one way or the other, I guess. One, it can bring people closer together because they get a fright and then they realise that some things actually really don't matter. Now my partner's sick. But you do see the odd fight.
Jenny there?
Yeah. A&E Kings.
Adult red phone in 3 minutes. It's adult red phone, 3 minutes.
So this is a bit more serious, I think. Is this HEMS or is this LAS?
No, they didn't say. They said a trauma. They called it as.
Okay. This is a fellow who has come off his motorbike, we think at about 20 miles an hour, separated from bikes, little on the ground. He's struck a bollard. They're such significant injuries from particularly motorcycles. They just don't have anything to protect them, do they? You go from cruising along at 50, 60, 70 miles an hour to sliding along and then abruptly halting, don't you? So, yeah, anything can happen. You know, there's no crumple zone in a motorbike, so, yeah, they're often really seriously injured.
John, 53, motorcyclist, low speed impact with a metal bollard, probably about 20 miles an hour.
Father of three, John, came off his motorbike on his way to work.
He's basically slid on the floor, right shoulder, right arm have gone into the bollard.
So he slid on the floor and then hit the bollard?
Then hit the bollard, yeah. He has broken the metal bollard though.
Okay. So no open wounds anywhere?
No open wounds. The main concern we have is distal pulse.
Yeah, that's perfect. Thanks a lot.
No worries.
Is this all pain or?
This is anxiety.
Right, okay. Okay, just don't move his right arm again.
John's right side has been severely damaged in the accident.
Fucking arm! Christ!
We've got some painkillers coming, John. Hang in there, mate. Hang in there, John. Do you have experience with ketamine? You don't, okay. Could Malcolm Tunnicliffe please call Resus on 2397? Thank you.
My name is John Moran.
How do you think your wife would describe you?
Chaotic, selfish.
Hey, John. I know you're in lots of pain, mate.
Yeah.
We've got some pain relief coming, all right?
Good.
Okay.
Good. I'm a psychologist. Some of the work I do is with pain management, and I teach particular skills to my clients. None of those skills were of any use to me at that time.
Sorry, John. Guys, can we have a hand just for a sec? Thanks, just to brace him getting off the board. Yeah. Okay, you got it?
John, hello, John. Hello, mate. My name's Malcolm. I'm another one of the doctors, John. In a second, I'm going to give you a really strong painkiller that's going to knock you out.
Okay, fine. Yeah,
all right.
That's great.
I just need to explain a couple of things to you. Okay. It can make you feel a bit funny. Okay. You can have very funny, vivid dreams on it.
Okay, tripping out.
But yeah, you're tripping out. It's ketamine, basically.
Fine. Okay.
So just remember, you'll be in a K-hole. So just remember, you're in hospital. You're quite safe. All right?
Okay.
We can give you something for it if that's really bad.
Okay.
Right, John, I'm going to get cracking to start with. We'll give you a little bit to start with. I won't let them do anything until I'm happy you're away with the fairies. All right, Maddie? Okay.
So guys, I think we need to be a bit quieter around the bed with the ketamine on board.
Well done.
50 milligrams of ketamine, a sedative so strong it's also used as a horse tranquilizer, will knock John out for 20 minutes. Enough time for the team to straighten and plaster his arm.
John?
Only then will he be settled enough to be scanned for internal injuries.
John, can you hear me? Yeah, go boys, do it. He'll probably scream. He will probably scream, but he won't remember.
Oh, bloody Valentine's Day, isn't it? But I see, well, not a very nice Valentine's Day. There you go.
Happy Valentine's, babes.
Oh yeah, did you get lots of cards?
Oh, loads. I got a bunch of roses with a card that said I would.
Really?
And that's it, Abby, I would.
That's nice.
We're all flesh and blood. We've all got 2 eyes, a nose and a mouth. You know, what appeals to one person doesn't necessarily appeal to somebody else. I love him with all my heart, and I love him from the inside out. Gary is my soulmate. I trust him with my life.
I'm in hospital, Dad. Yeah, up in London. So I'm in at King's Hospital now, and I had a CT scan, and he said I've got a bleed on my brain.
Your blood pressure's too high.
Because my blood pressure's too high, Dad. He said,
Gary, a 52-year-old paint sprayer, was leaving work when he began to lose feeling down the left side of his body.
I heard Gary's car pull up outside. He came in and said he thought he had a migraine. And when I looked at him, I could see the side of his face had dropped and his eye had dropped.
I thought I'd better let you know anyway, because otherwise...
I'll keep him informed.
And I'll probably be here a couple of 3 days, I don't know. They're giving me some stuff just now. I've been doing all these sort of reflex tests and stuff. And, I mean, he called it a bleed. I've got a bleed on the brain, I suppose that's what he classes as a stroke, isn't it? Yeah, it is, hang on.
Hello? You know what he's like, he didn't want nothing done. As soon as he came in from work, I phoned for the ambulance straight away. I could see... I had to keep my head, because if I'd panicked, then I know Gary would have panicked. So I had to sort of keep my wits about me. But deep down inside, I was absolutely petrified. All right then. So I'll ring you tomorrow.
Dad feeling all right?
Yeah, he said, are you all right? Yeah, he's all right, he's a bit upset. Yeah. I met Gary at a bikers rally in Chilham in Kent 10 years ago. The night I met him, I was out with a girlfriend of mine, and when we saw the bike club that he belongs to, my friend laughed and went to me, my God, just avoid all eye contact, don't even look at them, because they had a bit of a reputation at the time. And then, of course, when he actually did walk over and speak to me, I couldn't be rude. That night, Gary walked me to my car, and as I got in the car, he actually asked if he could kiss me. My friend sort of like is going, oh my God, you know, I told you to avoid all eye contact, don't kiss him. But he sort of like put his head in the window and said, can I just kiss you goodbye? And I said yes, and he kissed me, and then he just said, oh, I love you. And I looked at my friend as we drove off. I looked at my friend and I went, I think I've just found a raving lunatic.
Hello, I'm Kirsty, I'm one of the nurses. We're keeping an eye on your blood pressure, it's still a little bit high.
Yeah.
But don't worry, we'll keep an eye on it and make sure we try and keep it.
I think they put some stuff to...
Yeah, they did.
Gary is being given medication to control the bleed in his brain. The first 24 hours are critical, so he needs close monitoring by keen stroke specialists.
If I could go now, I'll go now. I just hate hospitals and doctors.
I love you.
Valentine's Day doesn't mean so much to me now as it did in the past years. In the past years, Valentine's Day was a big thing. Cards, flowers, and if it came on a weekend, I'd take her away for the weekend. But now it's just another date, really. Unless, of course, if somebody's birthday, if a young lady has a birthday, okay, I might take her for a meal. With a husband, of course.
Are you here on your own?
Well, no one's ever on their own, really.
No.
84-year-old Ronald has come into A&E after being bitten by his dog Benji.
When I was brought up, we used to respect the ladies. At least that's how I did it with my wife. Kathy was the first one that I really fell for. We were married 50 years.
You've obviously got someone looking after you with your nice. You've got someone looking after you with your nice tidy dressing.
Oh, that's
on.
all right, yeah.
And you were seen here last night.
Yeah, seen here, in there.
Yeah. And
They told me to come back at 10 o'clock this morning.
Who did? Was it definitely? Are you meant to be at fracture clinic?
I don't know, it's a bite, dog bite.
Have you met Miss?
Repairing. She was 5'3". She was a little bit plump, although she'd hate me to say that. She had beautiful hair. I think the nicest thing you can say about her was that we loved each other.
Let's look you up on the computer. Hold that for me, because I think you might be meant to be at fracture clinic or something. Because he was seen here last night.
Nobody loves me.
What's your? Tell me your full name.
Ronald Kane, K-A-N-E.
Ronald Kane.
She tripped over in the previous flat we lived in. She hit her head on one of the wooden jambs, and she had a stroke. She was one of those people who detested hospitals. She was afraid of them. Well, most people are anyway, especially when you get to our age. So I used to go there and look after her myself.
Mr. Kane, do you want to come through?
You want me?
I do.
I was sitting with her, and a nurse came in and said, I want to wash her face. I said, okay. Would you leave us, please? So I walked out the room, and within 5 minutes, the nurse came out and said, I'm sorry, Ron, she's gone. That's it. Fini. All you have are memories.
Oh, Jesus. I'd like some McDonald's French fries.
No McDonald's, no French fries.
No, just their French fries. I love McDonald's French fries. I wouldn't mind a Big Mac either. with some sweet and sour sauce.
Hello, is that the radiology? Yeah, hello there. We've got a fella in here, trauma. He's Delta for the day. For Valentine's Day, he was trying to climb up the side of his flat and got as high as the first floor balcony and lost his footing. He's fallen backwards, and on the way down, he's managed to hit a retaining wall.
Do you ever get any Valentine cards by people at work?
By people that I work with, or from patients?
Patients or people at work.
Oh, okay. No, I get surprisingly little in the way of cards from my patients. Maybe I'm expecting too much. Maybe I give them too much ketamine and they forget who I am.
It's been over an hour since John came off his motorbike. None of his family yet know he's in A&E.
So, John?
Yes, mate.
So far, so good. I mean, we know that you've got a broken bone in your arm here, okay?
Yeah.
And that was, kind of bent out of shape when you came in, causing all that pain, all right?
Right.
But we gave you a really, really strong medicine there that kind of almost put you to sleep. Can you remember?
Can you remember what?
Yeah. Can you remember we gave you a medicine, very strong medicine, and we've made this arm in the right shape again.
Oh,
Yeah.
Oh, you put it in the right shape.
Yeah.
Oh, well done.
Yeah. So it's in a plaster now. Now
what?
it's
you did all that?
Yeah.
In a plaster?
Exactly right.
What?
So it's.
How did you do that? What time is it?
It only took about 20 minutes. But look.
20 minutes?
Exactly. Look, it's not.
No, stop talking.
It's not fixed.
Stop talking.
Me or you?
Stop talking. You. Stop talking.
You got a question?
Time is it?
It's. There it is.
11, 10:40.
10:40.
10:40. Right. Okay.
You've been with us for about an hour.
Fucking hell.
Do you want me to explain some more?
Yeah.
Okay, so this arm, it's not fixed yet, but at least it's in the kind of roughly the right space, the right place, and that's going to have helped a lot with your pain, I'm hoping. How is the pain in your arm?
The overriding thing that has always been a problem is riding a motorbike. I've never agreed with that. I've always worried, but I learnt very early on that there was nothing I was going to be able to do or say. He would placate me that it was safe and that our quality of life was much better if he rode a bike because he would have more time to spend at home.
The procedure that we've done on your arm is not the be-all and the end-all. There's a bit more work to do there, but at least it's a bit more comfortable for you.
There's a bit more work to do where?
With your arm, with the broken bones in your arm, okay. But at least at the moment, I'm hoping that we've got you more comfortable.
Have you had many motorcycle accidents?
Not accidents, necessarily. I mean, you'll come off, if the road is wet or whatever, you might slip on some oil, you might get cut up by a motorist. I've broken a scaphoid, I broke my ankle a couple of times.
Look, you've got some more x-rays coming up, just of your chest and of your pelvis, all right?
Yeah.
Then we've got to go through the motions of making sure nothing else is injured, so x-rays of your neck as well, all right?
Yeah.
The bike has been an overriding shadow because he gets on it every morning and he goes off to wherever he's going, and there is always that fear.
In the majority of accidents, you'll arrive home that day, and, the eyes will be rolled to heaven and you just get on with it. But in this instance, there was, it was clearly a lot more serious. So you think, right, this is going to cause me problems.
Breathe in. Hold your breath. Breathe.
53-year-old John crashed his motorbike 3 hours ago.
Anything? No.
With his arm in a cast and his pain under control, he can now be scanned.
Breathe in. Hold your breath.
I really wonder about his spine as well. Is it? No, it doesn't look like anything. No, we got away with that.
Hold your breath.
Scans show there is no organ damage.
I need to see my star sign to see if it was worth waking up today, please.
I'm Cancerian.
Start the scan whenever you want to come down. All right.
What are you? Different?
I'm Pisces.
I'm See you March.
Yeah, February 26th.
February 26th. Ooh.
Yeah, it's coming
Around
up.
the corner.
It's coming up, man.
Yeah, what are you turning?
Are you?
29.
29.
What? You're only 29?
It's because of the facial hair.
That is stupid. I do worry about getting old because time is going so fast and it's going faster and faster as the years go on. In my older age, I hope I'm one of those elderly little ladies who still loves to wear heels and wear makeup and be all dainty and have some little old man next to me still highly in love, and that's what I hope for because I love seeing the couples that are like that. They're just so sweet. And it's always nice to make an elderly person laugh as well. I had one say to me yesterday, stop treating me so good or else I'll trade my wife in. It's just gorgeous.
Mr. Kane.
Hello, how are you?
Come with me. Let me have a look at your finger. So what happened? Was it your dog that bit you or a different dog?
Oh, no, I wouldn't let any other dog bite me.
Oh, it was your dog. It was your own dog, that's fine.
No, actually what happened is I was at the computer and he's got a ball.
Yeah.
And it's a rope ball and he jumps up, you know, and then I throw it.
Yeah.
Well, I was computing and the ball, one of the strands of the ball got caught on my finger. And of course he jumped up for the ball.
Got excited.
Not knowing. And
That's what happened. You're
yeah.
not getting him put down though, are you?
Pardon?
He's not being put down, no.
Put down?
Yeah, you're not putting him down.
Oh, God, no, it was an accident. He's been very contrite. He's been hiding behind the settee since he done it. He knows.
He knows he's in trouble.
Pardon?
He knows, yeah.
He does know, yeah. First thing Benji does, comes down here and looks for his toy. Hello. Then I got to spend the rest of the day throwing the damn thing to him. I've tried to train him, and they say, well, send him to one of these training schools. Well, that's all very well, but I think that would change his personality too much. I'd rather he stays as he is, mad, like me.
Ah, what were you in?
The RAF and the RAF and Army, the Royal Air Force, 7.5 years, Princess Mary's Nursing Service, and 2 years in Korea with the Army.
Do you want to put that in the bin?
Pardon?
Do you want to put that in the bin? Thank you.
Yeah. When you get to a certain age, well, say my age, a lot of people just sit in the armchair and say, well, I'm too old to do this or I'm too old to do that. Well, I don't agree. I read in the paper and on the radio they were having this the gay pride parade. So I thought, well, I might as well go along and see that because it isn't a militant one. Everybody was going to be cheerful, so I went down Haymarket and where I stood there were 3 or 4 young gay chaps there and we were having a laugh, having a joke.
So we just need to clean this a little bit because you've still got bits of cotton wool and gauze stuck in
But
there.
that's what I said. There was something in there. I didn't know if it was
Just a bit
me
of
or...
fibre. I've got a dressing table.
And suddenly this crowd of very large gentlemen came dashing across the road towards me. They opened up and there's Boy George standing next to me. So I looked and I said, hello, Mr. O'Dowd. And he looked rather surprised. So I said, may I take a picture? He said, I haven't got a camera. I said, I've got one. So he got one of his cohorts to take a photograph of us. It turned out quite well, actually. He was quite a nice person to speak to.
How long have you had your dog for?
Oh, well, I had my first dog 6 years ago after Kathy.
Okay.
I didn't want to be on my own, so I got a dog. And she was beautiful. If I'm feeling a bit low, I say, Kath, what would you do? Or if I'm undecided about anything, Kath, what do you think I should do? And then at night you say, night, night, darling, God bless. Some people can go into a shell. They'll just keep there, contained within themselves. Other people, they can sort of throw it off. Not in their minds, but in their personality. And I think that's what I did. I just threw it off and said, get on with your life, Ron. She's not coming back. She wouldn't want you to be unhappy, be miserable. Do what you want. And I did. And here I am now. Okay.
See you later. Bye-bye. Take care. Thank you. See you later.
Bye-bye. As long as she needs me, I know where I must be. I'll cling on steadfastly. I'm not happy, I'm just fed up being bloody miserable. Bye-bye, dear.
Bye.
These are my favourite flowers. To have in the house anyway. If you're going to buy me flowers, they're quite cheap, so I'd probably want something a bit more expensive than that if you were going to buy me them. But if I was going to buy myself some, just to brighten the house up.
Oh, yeah.
See if I've got any pictures of flowers that I'd be delighted to receive. Yep, they would do. I'm not asking you to get me flowers. But if you were going to get me some.
John, we're getting a bit more morphine, and ASAP we'll get these blocks away and have you sitting up a little bit.
Right.
You all right?
What's going to happen now?
Well, have you been told about the results of the imaging?
No.
So far with the plain films, I mean, you've got some pretty nasty breaks in the forearm here, okay? It's going to require an operation, okay? So that'll be under the orthopaedic team. You've also broken the shoulder blade, okay, the scapula. And it's broken in a few different pieces, and the reason it's so sore around your shoulder here is that it looks like, you know how there's a ball and socket joint? Okay, well the socket of the shoulder, I gather from the CT, there might be a break through that as well as other parts of that shoulder blade. So it's pretty badly broken. And simply for the reasons of analgesia, you're going to have to stay in. I mean, not just for the fact that you need an operation, but, you know, I think you're going to be pretty uncomfortable with this shoulder blade thing. But if I can point out a bright side there, is that your shoulder blade and all the big muscles that kind of pad over that shoulder blade have taken the brunt of this, and it looks on first glance that your scan of your chest is okay. So it's a bit like the crumple zone of a car, if you like. It's all kind of nuts and bolts and bones and things, rather than the important stuff on the inside.
Okay.
Yeah. Do you have any questions?
No, that's all
Yeah,
good.
yeah.
That's all good.
Listen, and as soon as we know a little bit more, as soon as we know the scan results, I'll come back and have another chat.
Okay.
All right.
Thank you.
Okay, no worries.
Okay.
I was hoping I would get away with a cast, you know. You cast would be okay, I could manage that. Surgery, not so good. That means plates and extended periods of recovery and so on and so forth. My partner and my daughter were in Muscat, in Oman.
And it was an experience for us. We hadn't been to the Middle East before, and it was all very different. So we were having a great time.
So, John, now my name is Ibrahim. I'm one of the other orthopedic doctors. Essentially, your forearm fracture is what we're going to fix today, hopefully. Now, this is the consent form, okay? With any operation, there will be risks involved. You will definitely have post-operative pain. You will definitely be left with a scar, okay? The incision will probably be about that long, so about almost 10 centimeters in length. You might have a scar either side, or just one scar, okay? Now, I'd like you to sign here. Are you right-handed or left-handed? Right. So are you able to sign with your left hand? And now if I give you that and I'll show you where to sign. Yep, doing very well. Fantastic, that will do, absolutely. All right, that's it, sorted. No problem, you too.
I needed my sons to know, and I phoned the eldest lad,
Alex,
and asked him to make sure that the youngest lad was okay.
A few breaks. Yeah, it's not good. It's not good. Now, you just need to sort Joe out. Just make sure he doesn't get upset, yeah? Just one more thing, mate. There's no need for your mum to know about anything. Don't spoil her holiday. She's expecting a call from me on Thursday or Friday. So she's not expecting to hear from me today, so there's no need for anyone to call her. So tell Joe, don't call mum. There's no need for it. Okay, mate? Thanks a lot. Bye.
She said yes. She said yes. He got down on one knee, Maggie. He's right in front of us. One knee. He got down on one knee. Oh, and we saw it. Everyone left the pub and we saw it. But he didn't have a ring. No, Maggie. The fault is he went down on one knee and he just said, "Will you marry me?" She had tears in her eyes. It was just...
Oh, it was lovely. It got down one knee and everything. It was absolutely amazing.
It was, man.
Gary's left side was affected by the stroke.
Touch your nose.
But his coordination is already improving.
That's much better.
Be anywhere earlier, over here. I'll stretch me down. That sort of buggered me a bit now, though, isn't it?
Well, it's just giving you a little bit of a warning to slow down a bit. You're not the big roughy-tufty biker that you thought you was. You like to scare me, don't you? I love you.
When you've had a stroke, it makes you realise the things you used to worry about, some of the things you ain't worth worrying about. The other day I was in Bexley Heath and I heard this lady talking to this old lady, and I was sitting there. Tracy had just gone to the toilet and I was sitting there with a bag, and she come out, she goes, "What's up with you?" I was looking in the bag. I had tears coming down my face, I did. And what happened was, I heard this lady speaking to this old lady. She said, "How are you today?" "Yeah, I'm all right, yeah. It's my birthday today. I'm 74. And she said, "Oh, that's nice. Any plans?" She said, "No, I've got no plans." And of course, "All right, I'll see you later." Then she went off, and I thought, that old lady ain't got anyone, that old lady, like. So we walked off, and we got round the corner, and I said, "I want to buy her some flowers." So we bought her some flowers. And I went back there and I said to Tracy, is she still there? And she said, yeah, she's still sitting there. And I didn't know until I got back, because I'd only seen the back of her. When I got around the front, she was blind. So, a bit of joke. So I went up to her and I said, sorry, I wasn't here, Wig. And I said, I just overheard that it was your birthday. And she said, yeah, hello. She said, yeah, it's my birthday today. I said, I just got you a couple of flowers, if that's all right. Oh, thank you, she said, thank you ever so much. And as I walked off, I looked back and I see her smiling. That made my day.
My idea of romance. Gary Mitchell, I suppose. And our sex life is very healthy. In fact, none of his friends will ring us on a Sunday morning because they think Sunday morning is our morning.
And are they right?
Yes, they are. Sod boot fairs.
How long did they say it's going to be?
Lord knows. 21-year-old Anton has been brought in by his mates. He is suffering from mild chest pains.
Oh, bye. Bye. See you later. Facebook me. Don't say she's
really pretty.
No, she's actually nice.
Do you believe in love?
Ooh, gonna expose me here. Do I believe in love? Yes, I do believe in love.
Have you ever been in love?
I don't know, I doubt it. I don't know what love is, really. I mean, I think love is probably being with someone that you know can annoy you, but at the same time you still want to be with them.
Have you ever been in love?
Yeah, I've been in love 3 times.
Oh, Maggie, I wanted to cry. It was lovely. Oh, she put it on Facebook. I should have said I was there. I saw it. Vicky, where's my balloon? I don't know. Where's my balloon? All the balloons gone missing. She's gonna have to take my one. Who's there?
Relationships can be very tricky, and they have to be, well, not they have to be, they can be hard work.
Just stay nice and still there for the sec. G'day.
John is going straight to theatre,
Alrighty.
where he'll have 2 hours of surgery.
Okie dokie. See whether you feel a bit more comfortable. How's that? Is that all right?
Feels good,
Yeah, nice little change, huh?
I genuinely had no idea whilst I was away. I did speak to John on the night of the accident.
All the very best, eh? Yeah. Yeah, take care. Yeah, no worries, John. All the best.
I called her from my hospital bed and just said that, you know, everything's okay, but I'm not going to be able to pick you up at the airport. So I just thought I'd keep the artifice going a little bit longer until I got home.
See you later, John. All the best, eh? Take care.
When we got back to Heathrow, there was a taxi with our name there. Still no idea, and it was only once we pulled up at the house late on the Saturday evening, my older son was here, which was unusual, that I knew something wasn't quite right.
I'd asked the eldest lad to be at home, just in case, you know, Francis was distressed. just to provide support.
Alex dealt with it quite well. My son, he just said, "No, you're not to go into a panic." So he'd calmed me down, and I had a couple of minutes before I actually came up to see John.
And then she came up and she saw me in the bed. By that time, I'd recovered my sense of humour, so I just thought it was quite an interesting situation.
Were you angry?
Yes. But living with someone who rides a bike day in, day out, I've always been concerned that one day I was going to get a call that something terrible had happened. And I think my feeling of relief that that's it now. He didn't suffer any head injuries, and there's, that was always there. And he can't go on a bike again. And I don't have to worry about that anymore. I'm one of the fortunate ones that is not going to have to deal with that.
Do you see yourselves together in another 25 years?
As long as he doesn't ride a bloody bike again.
Lovely. Can you remember what happened?
But she's got a head injury. She's got a head injury.
It is a marathon, it's not a sprint once you've had a serious head injury.
Do you know where you are right now?
Queering a loss of consciousness, she doesn't read the internet at all.
And it's the relatives who carry the burden of that.
It's gonna be all right.
Surgery.
We're just gonna get on, do this.
Not scare him, get you all sorted, all right? John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
and the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
They should give you free meals in A&E, really. If you're here over mealtime, you should get food.
I think you should have tea and coffee as well.
Tea and coffee facilities and chocolate biscuits.
Yeah.
One of the best countries in this world. And all kind of stinking people. They stink. It's the poor doctors I'm sorry for some of these patients.
Yeah, but you have to live and let live.
Not live and let live.
No, you can't. No, you can't be. You can't be prejudiced. You know, be careful.
That isn't a prejudice. It's straightforward. Going into me, oh boy,
Glory be to God.
You think they're going into my eyes, huh? Oh well. Yeah, sure.
Afternoon, King's College. 383. You're hardwired for that red phone to ring. 8 to 10. Thank you. Yes, bye. You get into gear. You go from doing your normal day job to, right, this is what we're going to do. I've got to get this sorted out. I need these people. I need these drugs. And you prepare yourself. It's like going into battle.
Adult trauma in 5 minutes.
A 32-year-old scaffolder has been struck on the head by a 6-metre scaffolding tube.
Oh my God, I was so scared the first time I ever worked in recess. Because being new to the team and not knowing everyone, it's hard when you first start, especially. It's a scary place to be. You're on the front line, you have to know everything about everything.
The red phone patient has come from a building site in Kennington, South London. Before the paramedics arrived, he was unconscious and convulsing on the ground.
Okay then, this is Tommy, he's 32.
Hi there, Tommy, I'm Charlotte.
He's a scaffolder, and what he is complaining of is some pain central in his neck, going from the base of his neck right to the top of his head, roughly in the middle. He does have an injury to the back of his head, onto his head.
Unfortunately, so we're going to have to cut all your clothes off, all right?
Do you round up for me, Tommy? Thanks, darling.
You weren't particularly attached to those t-shirts, were you?
They're the best t-shirts I've ever bought, to be honest with you. Honestly, they are.
Chest X-ray here? Or do any?
Resonant percussion notes.
Cruel lot of people here. Fucking hate it, I really do.
Hold on, mate.
Sorry for swearing. Alright.
The human body is tough. It's built to run, it's built to hunt, it's built to play sports. It's not built to be hit by something hard and metal. And that can really damage your brain. It's difficult, because you often don't know what they've done. Well, what we're going to do, get some blood, make sure that's fine. Get you off the hard metal scoop in a second. You'll probably have a scan of your head and your neck. See if you've broken anything, or if that scope of that scaffold's gone into your head. And then we'll talk again.
Thank you.
Boya? Look at that. You hear him?
85-year-old Hilton suffers from diabetes and is worried about his swollen legs. He's been brought to King's by his cousin Earl.
Now look it. Oh. Yes. There we go.
Yes, come in.
Oh, God. All right, girl. Yes, madam.
Hello.
And how are you?
My favourite patients are the elderly because they're always so grateful for what you do. Yeah, they give you lots of banter and cheek, and yeah, you just give it back to them and play along with it.
Okay, what I want you to do is get your bottom right up on the chair.
Bottom?
Yes, your bottom.
Oh, my God. I'm a man 85. You don't inspect my bottom.
I'm not inspecting it. I want you to sit on it on the chair.
Oh, you must respect it. I respect you. You're a pretty little nice nurse.
Okay, so you shuffle your bottom back and then swing your legs up.
Yes.
All right, and then you can tell me all about it. My name's Nancy.
Yeah.
All right?
Yeah.
What have you come in to see us for today?
I come in to see you because my foot swollen.
Your foot's swollen?
Yeah, I have my foot is swollen, and I won't trouble you all, my dear, if I didn't want it. I'm 85 years of age, and I'm proud of that.
Oh, so you should be.
Yes. I grew up in the Caribbean. Life was hard. When the war was over, my intention was to come to England and do better and to help my family and things. Yeah.
So is this the one that you were worried about?
Yes.
Yeah.
And that too.
And how long have you had diabetes?
Oh, since 1977.
Okay, and are you on insulin?
Yes.
Yeah.
But it's controlled. See?
It's well controlled.
Everything
And how
under
often do you
control.
check your sugars?
Once a day.
Once a day. And have you checked them today?
Today?
And are they all right?
I was ashamed. It's 3.9 today.
3.9. Excellent.
3.9.
Okay. And how do you feel in yourself? Do you feel well? Unwell?
I feel well, but it's only that you could hardly walk sometimes.
Yeah, okay. What I'm going to do, I'm just going to go and check our computer and see if we've got the blood results test. And I just want to do a little swab of your leg, see if there's any bacteria growing there.
Yes, yes,
All
please,
right,
yes,
and then I'll be
please.
back to see you.
Thank you very much.
All right.
No.
Just want to take some blood, put a line in so we can give you any medications that you might need instantly. Okay?
Relax your arm.
When a patient comes in shivering, 9 times out of 10, it's shock. The body is traumatized about what's happened. So the patient thinks they're cold, but really it's just a state of shock.
Going to roll you onto your side, take the other scoop out. Going to have a feel down your neck, down your backbone. If it hurts, say yes. If it doesn't hurt, say no. Okay? When we get to the bottom end, we're going to have to feel your rectum.
What?
Your tail end, your bum hole.
What about it?
You're going to have to have a feel.
No, you ain't.
I need to. Need to make sure all the nerves going from your brain down your spine to your legs are working.
I can feel my toes. I'll tell you, that's all right.
Can I have a feel on the outside without putting a finger in? How about that? Compromise. Yeah.
Unfortunately, they're very specific nerves that go to very specific places, and we can't. Feeling your toes isn't the same.
No, you've got to get rid of all the girls then, right?
The girls be on that side. I'll be on this side. With your bum being on this side.
The girls will be on the other side.
You need to
Okay.
Okay, guys, we'll go 90 degrees on roll. Very steady. Roll. Rest your head on my hands. Okay? Yeah. Oh, fuck. Not sorry.
Sorry about this.
Yes, they're not like a patient.
Can you feel my finger there?
Yeah.
Good, give me a squeeze.
Feels normal.
Well, I don't feel normal, but yeah.
You know what I mean?
Very steady. Roll.
Let's get you warmed up now, okay?
Don't move too much.
I take my head down.
So you can't move. But we worry that after a tumble like that, you may have fractured your skull, you may have fractured your spine and your neck. You're quite sore though. I know you said it's bruised, but it's difficult to know, is it bruised or is it broken?
I appreciate you. Look.
So painkillers, x-rays, scan of your head, see where we go.
Thank you. What's your name again?
Chris.
Chris.
No problems.
Oh, right. Thank you.
Okay.
That's it at the end.
And I'll just go and get that coffee for you.
Thank you.
And there's your coat.
Thank you.
Okay, I'll just turn that.
Okay, I had a quick look at your blood tests. They're all okay.
Oh, yes, it
All
is.
right, nothing out of the ordinary there.
Yeah. You get them quite quickly.
Yes.
Mhm.
Wonders of technology.
Yeah, oh my God.
Do you live on your own, or do you have anyone with you?
uh-huh.
He lives on his own. And who does all your cooking and shopping and everything?
Me?
You do it all yourself?
Yeah. I still have my appetite and everything. I want to take my little rum, you know.
Well, I think at your age you deserve it.
Yeah, 85.
Exactly. Okay.
Yeah, come
Let me
now.
see if I've got some cream I can put on there now for you.
Yes, please.
All right.
Yeah.
I can't promise that I have, but I'll go
Yeah.
and have a look.
Yes,
all right.
please, yes.
Okay.
I do think about getting older because obviously I'm a grandmother now. I'm getting that way, and I do think about it. But I think I've got a fantastic example in my own parents. My grandmother used to say it, and now my mother says it. But old age is no place for sissies.
There you go. You can take this home with you and put this on. All right.
Yes.
It's quite greasy.
Yeah. Oh, that's
It's
good.
very
then.
good.
Could you put them in a bag for me?
Yeah.
That is a gel.
It's an ointment.
Ointment?
Yeah.
What's the name of it?
It's called 50/50. It's
50/50.
liquid paraffin.
Oh, liquid paraffin. Oh, yes.
Yeah. It's 50% liquid paraffin and 50% soft paraffin. There you go. You can take that one home with you.
Could I put it in a little rice at home? Well, as I get older, that's
I
older.
was saying, can he cook this with some rice?
No.
What, you sure? And I had your rice nearby already. You see, you can fry the fish.
Fry the fish in this? Yeah.
Fry the fish in the paraffin, yeah.
And it will be so nice. That's like that. Mm-hmm.
It's 45 minutes since scaffolder Thomas arrived in Resus. Doctors are concerned he may have injured his skull or his brain.
Apart from that, I cannot see anything major inside. Let's check.
Hey, parked. Get you the painkillers and the antiseptics.
Hello.
Oh, yeah.
Hiya.
Thomas is waiting for the results of his
Hey.
CT scan.
Yeah, he's bringing your medication. All right.
Nice accent. I like. Are you Spanish?
No, I'm Portuguese, but I speak
Portuguese.
Spanish. And you?
¿Cómo estás?
Bien, gracias.
Have you all changed shifts?
No,
We've
no.
just been with other people.
Just because he's busy,
I've got
so.
a headache badly.
I've
Yeah,
got
we're
some
giving you
painkiller
now.
for you.
Thank you.
What's your date of birth?
I do know some Portuguese, but I've forgotten.
It's all right, don't worry. Just say your date of birth.
13th of April,
Yeah?
1979.
Very good.
I was born on Good Friday, which is quite rare for April.
All right.
And the 13th, which is unlucky.
Yeah,
Apparently.
even last year was in April.
It was, wasn't it?
Yeah, it was in April, yeah.
Yeah.
Right, we've got some of your clothes that were cut off.
You want to sew them up?
No, definitely not. Maybe someone would, not me.
No, I haven't got anyone.
I can have a quick look through them and see if there's anything in pockets. Do you want them in the bin?
Yeah, chuck them in the bin.
I will show you what I'm doing.
Well, I haven't got anything to go home with.
So there's no Mrs. Herbert then?
Huh?
No Mrs. Hilton?
No.
No.
Strictly Herbert on its own. Some of the women, them is too bad. You can't be worried.
Yeah.
You could have a fling. The women in these islands, they're worse than the German soldiers.
Really? Oh, blimey.
I wouldn't have you. No, don't hit them so hard.
The woman in these islands.
Present company accepted, I hope.
They're worse than the German soldiers.
Oh, my goodness me.
So no, it's no cause for alarm, eh?
No cause for alarm.
I feel as young as ever, yeah. I'm quite happy. Never married yet. I don't want nobody to have me pin down to them. Yeah. I like to be free. He said in the Bible, he said, who is free indeed. I like to be free.
You need to get yourself home because it's cold outside.
Oh, yes, I know. Last time I come here, let somebody get a cab for me.
Okay, we'll get you a cab.
Huh?
We'll get you a cab.
Cab, yes. And
all right.
Put my boy in.
Do you want to go and sit in the waiting room?
Yes, please, Hilton
And
Herbert.
we'll get you a cab.
Yes, thank you very much again.
All right.
And keep up the good work.
Okay, just take it slowly.
85 and it hasn't been
And
touched.
counting.
You haven't been touched?
But what can you trust? Oh my God. All right then.
All right. Okay.
Yeah, see you.
You know which way you're going?
Yes, and before
Yeah,
you
all right.
you won't call the thing for me.
I'll call a cab.
Yes.
All right.
Okay,
Take
then.
care now. All right.
They look after me nice today.
It's because I've had migraines and a lot of medication.
Migraine. I used to get migraine.
So what did you do?
I'm not quite certain what happened.
But you haven't got them now, have you?
No, I don't have them now.
I tell you, once you go into menopause,
Yes.
that's tough.
Yes.
And how do you feel now?
What?
You feel well now, don't you?
Touch wood.
Yeah, touch wood, me too. I've never felt so well in my life. Touch wood.
Touch wood.
The results of Thomas's CT scan are back.
Hello. How are you? My name is Cyril. I'm one of the A&E consultants.
Cyril?
Yeah.
Nice name.
I've got some good news. The CT of your head and your neck is normal.
Thank you.
There's nothing broken and your brain looks absolutely intact.
Thank you very much.
Absolutely fine on the X-ray and the CT. We're gonna remove that.
Can I take it off?
Yeah, I'm gonna take it off for you. Have you got any pain in your neck?
Pain?
Yeah, pain. It's not painful.
Oh, just at the back, but if my CT scan's fine, then it's just bruising, then don't worry about it.
We'll see.
Huh?
We'll see. What I'm just going to ask you to do, to start with, is just to stay very still, yeah? I'm going to remove that and make sure that we haven't missed anything on your neck. Yeah? So you don't move your head until I ask you to do it.
Oh, mate. Such a headache.
Where is the headache? Is it at the back?
Behind my eyes and the bruising's at the back, but...
Yeah. Okay.
Behind the jaw.
Okay, Des? You okay? Yeah, I'm fine. And Thomas is going to be fine too.
Pardon?
Yeah, I was just talking to myself. Right, just don't move your head a moment. Okay. How is it?
Bruised.
You feel it's bruised. Could you turn your head to the right for me?
It's always a relief when you get good news. You do get something in the back of your mind wondering, you know, like, is there some sort of, like, because, you know, you worry about sort of maybe a blood clot or something, you know, that could hit you and switch you off. Because it's a head injury, it goes through your mind, you know.
The feeling in your legs, in your arms is normal, yeah?
Normal, yeah.
Cool. No pins and needles, no. Could you turn your to the left now?
It's a 6 metre tube, and then the tube basically hit me square on the back of the head. I don't remember feeling anything when I hit the floor. I remember being extremely scared, you know, and all sorts of things start running through your mind, like, you know, okay, you're awake, but you think to yourself, are you just going to switch off?
You feel sick?
I was starting to feel sick. I was afraid of dying, really, to be honest with you. I'm a little bit of a worrier when it comes to things like that. Maybe if it happened to somebody else, they wouldn't have been so worried. But I was certainly scared of dying. I thought that was it.
You're going to stay with us tonight.
Do I have to?
It's better. It's better. You lost consciousness, yeah, when that big scaffolding hit your head. So you had what we call a concussion, and a big one too, yeah? It's better to keep an eye on you. So you won't sleep very well, unfortunately, because every hour, well, 30 minutes at the beginning and then every hour, a nurse is going to come back to you and ask you some questions just to make sure that your brain works well, yeah? But we have to do that. I'm sure it did.
So you better let me have the other jokes.
Oh, there's another joke I must tell you. Oh. Again, a priest comes over to visit one of his parishioners, and he comes to one couple and he asks them, how are they happy? And they say, yes, we're very happy. But we would have been happier if we had children. God hasn't given us children. So he says, oh, never mind, I'll pray for you. I'm going to Rome and I'll put a candle up for you. I'll light a candle in Rome. Years go by, at least 10 years, and he happens to meet this lady again. He says, oh, do you remember me? He says, I remember you, Father. So how are things? And she says, we've got 10 children. He says, 10 children? Says, yes. Congratulations, says the priest. Can I see your husband so I can congratulate him? She says, no, he's gone to Rome to blow out the candle. Is that good? It's brilliant. I had a nosebleed. I couldn't stop it. So in sheer desperation, I rang up 39s and I said, listen, should I be having your services or not? They said, yes, we'll come, because you live on your own. So they came over and they brought me to King's. And when they brought me to King's, the nosebleed stopped. And they told me, sit there and we'll keep an eye on you. I remember half a crown.
Yes, I remember half a crown.
Yeah, of course. Yeah.
It's a long time ago.
Yes, we came here in 47, which means I am from Poland.
Oh.
My husband also. We came here in 47.
I came back to England in 1951.
So where did you come from?
Oh, I'm the more than the fourth generation to be born in India.
Oh, I see. I've never been to India.
Oh.
Beautiful.
Yes.
Yeah.
We came from Bengal. My father was Commissioner of Excise in Bengal.
Right. But did you have servants as well?
Oh yes,
yes, you have to have
servants.
Yes.
You've got to have servants because
you've got to. Yeah. There was not that's the way of life.
Yes.
You had to be looked after. But
quite.
Yes. Reaching out to someone, to me, is very important, because I was all my life working with people, being a lecturer, teacher. So I miss it if I'm on my own and I don't talk, just listen to the radio and watch television. I must have a contact with the person.
79-year-old retired architect Edgar has been brought to King's by ambulance after suffering an asthma attack at home.
I came here in 1957. I didn't know that Britain was so cold. I came originally from the Gold Coast, We had so much gold over there. That is why they called us the Gold Coast. But then I didn't have any because I was poor.
Me again. I've come to torment you some more. How are you feeling?
I feel a bit tight.
A bit tight?
Yeah.
I was wondering if you might be able to have a go on this for us. Have you used this?
I've used it before, but did I do it now?
Yeah, so you know how to do it. You hold it and make sure your fingers don't get over the line on the top. And take a good, nice deep breath in and then blow as hard and fast as you can. With a... Okay. Right, okay. What we'll do is, if you take a deep breath in and hold it, and then wrap your lips around it and blow quick, hard as you can. Go. That's it. Okay, good man. Alrighty. Okay. We'll have to double this at least before we let you out of here.
Okay, thank you very much.
Okay.
I have more energy to do anything I want, but asthma sometimes restricts you. Like last night, I was asleep and suddenly jumped because I was short of breath. And I don't know what happened. Maybe my neighbors were worried. Oh, why is this man calling the ambulance all the time? You know, my chest is so tight.
Yes, I think we'll get you one of the nebulizers for the salbutamol to see if that helps.
Okay.
Does that sound all right?
Yes.
Do the ambulance people give you one of those on the way here? You know, the mask with the steam?
No.
No. Okay, fine. Let's give you one of those and see does it help.
Okay.
And then I'll test you on this again.
Thank you.
Every patient has, I guess, particular needs. Older patients, they need more time to say what it is that they want to say. And it's their own time. They've earned that time to take to say what they have to say. Sometimes they're very stoical and they won't complain at all. And they actually won't tell you what the problem is when they're there with you. They don't, because they don't want to admit that there's a problem, or they don't need help. So I think they do need more time.
As my stepmother used to say, laugh and the world laughs with you.
I know, yes.
Cry and you sleep alone.
Absolutely, that's true. That's right. I'll tell you another joke. Two very, very old gentlemen sitting on a bench in the park, and one of them says, "Oh, I'm so miserable. I'm so miserable. I feel like an old man because every bone in my body aches." So how about you? How do you feel? This one asked. And the other one says, "Oh no, I feel quite the reverse. I feel like a child. Just look, I have no hair, I haven't got any teeth in my head, and I've just wet my pants."
How are you feeling?
A
little bit better?
Yeah.
Okay. Can I have another little listen to your chest?
Okay.
Are you comfortable there?
No.
You don't look very comfortable. Sorry, let me take this off for you for a moment.
Yes, yeah.
Shall we sit you up a little bit? You don't look comfortable at all, I have to say.
I think.
Yeah, 1 second now. That's it. Mind your fingers. That help you feel a bit better sitting up like that?
I think so. But it's terrible. I feel tight as well.
Still tight.
I don't know.
Is this how you always feel when your asthma is troubling you?
No, asthma, it hasn't been, I haven't been having it for a long time.
Okay.
It's only when my wife passed away, it's affected me.
Really?
She died on the 18th of Christmas.
Of December?
December.
Just before Christmas?
I don't know. Life is so hard. Oh, she was the most beautiful girl I met in London. She was a student nurse. And what charmed me was her eyes. She has fantastic eyes. It's like the eyes of the pharaohs. So I decided, oh, this is the girl for me.
And is anyone helping you?
I'm living alone at the moment.
Have you many friends or
No.
church or anything?
No, I haven't friends.
Okay.
I don't have friends. I don't have any support. My wife was the only support. If something happens to me, there won't be anybody there. I don't know. At the moment, I'm lost. I'm lost.
Unfortunately, we see an awful lot of patients who are completely alone, living a very, very isolated life. You know, the middle of the night, when you're not feeling well, it's a particularly dark and lonely place to be, and scary, I guess. I think men rely on their wives a lot more than they would like to admit from the moment that they meet and the moment that they get married. And I think that that reliance becomes greater and greater as life goes on.
It's a long time my wife helped me, and maybe company too. I have nobody there, and I'm worried, you know. One is in a mess, and I don't know, my head is in a well.
Yes.
See, I don't know what to do.
Yes.
Whether I'm doing the right thing or the wrong thing. See, life is so hard.
See, I think you are doing the right thing, but I think you're in a very, very difficult spot at the moment.
Yeah.
I think it's
Well, we tend to be in places like that sometime in life.
Yeah.
But I think I've never experienced it before.
Sure.
I'm having too many things.
Too many things, and your best support, your crutch is gone.
Yeah,
Your wife.
yeah.
What I might do is I think I might get one of my colleagues to come and have a chat with you.
Okay.
He works in social services, okay? But what they can do is see if there's something that they can do to, I don't know, to help you get through this period that you're in at the moment. Let me get you a tissue.
Yeah.
To get you through this very, very dark period that you're in at the moment.
Yeah.
And maybe sort of get you in contact with some people locally. Maybe we can see if we can help a little with that or something.
Okay.
Okay?
Okay, yeah, thank you.
So bear with me.
Okay, thank you very much.
Let me see if we can help with the other things.
Thank you very much. Thank you very much.
Not at all. I'm just going to go and talk to this chap and I'll come back to you and let you know how we're getting on. Okay?
Thank you. Yeah, okay.
All right. Okay. Good night. Your dad is here.
Yeah, mate. Oh, hey. Oh, got a headache and a half, eh? Oh, no. Yeah. Oh. Only just come over. Don't know, I don't remember anything. Oh. Oh, dear. I've got stomach. Oh, that's all right.
But I'm tired.
Better for, aren't they? You know? Are they single women here? Get your face on a nice girlfriend. Oh, no, you just relax.
I'll tell you what happened.
Yeah, he said something. You're setting out, and one of the stands come over.
Well, I just remember waking up, thinking I was dying. You know what I mean?
I know it's like because your body goes into shock as well. When I had that car crash, exactly the same.
I know what it's like. I've been in bloody hospital loads. Got hit by that car, didn't I, when I was 8?
Stop making a habit of it, will you? You got any money on you and all that? They reckon just tonight, stay tonight, have a good sleep and everything. They can sedated you a little bit as well, I think.
It brings you together, doesn't it? You know, you just kind of, you realise, it puts things into perspective. You realise who you realise some people are not so lucky to have their family around. Well, my dad thinks he's just dropping off a toothbrush and a deodorant. He's going to make sure I'm all right and just go home. But, you know, he doesn't realise that I'm sitting there and I'm grateful to have my dad there, or anyone, family-wise, or even friends, you know. There's a lot of people in this world that haven't got anyone.
Right, do you want me to leave you and then I'll call you tomorrow? And once you've got the all clear, then I'll come up and get you, all right? All right then, I'll see you later. I just want to say goodbye to the nurse. Thanks very much. It's all right for me to go now then? Yeah. I'll call tomorrow to see how he is.
Yeah, 10 o'clock.
Yeah, because I know you need to free up the beds and all that, don't you? So,
Yeah, well,
yeah. Yeah, but I'll be here tomorrow.
Do you feel better, Tom? Hey? Do you feel better? Yeah.
Be careful what he says, because he does,
okay.
he feels crap. It's like all of us men, you know. All right, Tom, I'll see you tomorrow. I'll tell Mum everything, so don't worry. You know. And I'll finish that Indian off you left. All right, Tom, see you tomorrow. All right, thanks very much for everything. Thank you.
I didn't do very well at school. For someone like me, you leave school, what you're going to do? You're going to be a plumber, a bricklayer, chippy, or my uncle's got his own scaffold firm, so it just kind of went from there. I just kind of slipped into it, really. It's hardly glamorous. There's a lot of wear and tear on your body, you know. I have to wear a knee support these days, and I'm only 10, 11 years into my job. I've got another 30 years to go yet, at least. So I reckon I'll be in hospital again for a new knee at some point.
My husband was a colonel in the Polish army. That's him. On our wedding day.
Oh.
That was 63, 7.5 stone I was. 7.5 stone.
You're not much more now.
Oh, I am. My waist was a man's neck. 1920. He was a beautiful man, beautiful. It never entered my head that I might be a widow one day. Never. And now and then sadness comes over. Yeah. He died in King's College Hospital, cardiac arrest. Oh, I miss him.
Have you children?
No. God never gave me any children. I had a miscarriage one. It is very sad. I would have loved to have a son. I think that the baby I miscarried was a son.
I've only got 2, but mine came through the bay window. You know what that means?
No.
Cesarean.
Oh, bay. I never heard that before.
What?
I've never heard that before. Bay window. Right.
Well, how are you? It's Des. How are you? I was wondering, I have a gentleman who I'm wondering if there's any assistance that you might be able to offer us. He's a 79-year-old chap. He lives alone. His wife recently died the week before Christmas. He's very much isolated. You know, he's got no sort of day centre. He's got no social support or social network. I think he's a little bit depressed because he's grieving, I think, naturally. But I'm wondering, is there anything that we might be able to offer him in terms of sort of... his name is Edgar Bruce Tago. He is, yeah. Brilliant. Okay. Thanks a million. Appreciate it. Bye.
Hello.
Lucy, a Red Cross volunteer, has come to visit Edgar.
Because we've got some volunteers down in Bromley, which nearby the place where you live, and I thought I've got a very nice lady. She's called Mary, and if you would like to, she can come to see you maybe on Thursday, because she's available on
Mary.
Thursday. Yeah. And she's really lovely. She used to be nurse as well.
Oh, I see.
She likes to see people and basically...
Maybe she even knows my wife.
Oh, is it?
Because she's worked for 28 years there.
Wow.
She was a midwife there.
Edgar, as I said, I would... Oh.
I always feel sad. But life must go on. We live together, we help each other. And now she's gone, you see? That's how I feel.
It's a lot to take in.
Yes.
There is a phenomenon called broken heart syndrome. And I think that once your partner and your anchor is gone, then why are we here? I find it difficult to know that there is an aspect of my patient's care that I can't sort out, because that's why I'm here, is to sort out these issues. But sure, I'd love to wave my magic wand and make absolutely everything fantastic, but life's not like that.
And I don't want to live with anybody else.
No.
No. I don't want to live anybody who is looking after me. I don't want to live.
No. No, if my husband goes and I have to be alone.
You want to be alone?
Well, no, my daughter, I don't want to live with my daughter.
No.
It's not fair to her.
Right. Well, she might, yeah.
No.
Because some people, yeah, it just
because she
depends.
lives in Chelsea, she's got room.
Yeah.
But I still don't want to live with her.
Well, it's just how you want it, yeah.
Yeah.
It's just whatever makes you happy, that counts.
I hope I go first.
Oh, no, please don't say that. Nobody knows who goes
What?
first. Nobody knows who goes first. Nobody.
No, please God, I go first.
So how is he going to cope without you?
We can go live with my daughter.
That'll be okay.
That'll be fine.
Will you look after yourself?
Thank you.
Yeah, and hopefully we'll get things a little bit brighter. Tomorrow is always another day.
Yeah, that's right.
Yeah.
Thank you very
But
much.
if you need,
You're very nice.
well, most of them are. These two are particularly. Yeah. Now your chariot awaits.
Okay. Have a seat.
Look after yourself.
May I have one tissue, because I'm crying, you see?
Hold that box.
Yeah, no, a little bit. I'll have only a little bit. And leave some for somebody else.
Good man. You got
Yeah.
enough?
Yeah, that's enough. I lived with my wife for 45 years. But I'm now looking. And I hope, all being well, I might find another one. But then I will be possibly too old. Thank you. Bye-bye. She was so lovely. And that's life, isn't it? We have to carry on, whether we like it or not. And I'm still here. When God wants me, He will have me.
I've never had freedom like this in my life. That I can do whatever I like. I'm completely free. And even now, I'm completely free. I cannot go with a married man. That's the only thing. But I can, if I fancy anybody who is completely free, then I will go with him. No, I won't, but I could.
Head up, man. Eyes open. Let's not fall asleep.
It was a broken heart that led him to get a physical injury. I can't say I've seen that a lot.
Well, longer.
I've got a 20-odd-year-old chap. He's got Behçet's disease and it's quite complicated.
Ortho surgery. We're just going to get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output? You know?
One of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Oh!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
These socks have been hanging around a bit too long now. I wonder who they belong to.
I'm better now. Mummy is nice. It's nice. It's nice. I'll be right back, okay?
When I was just a little girl, last birthday, what will I be? Will I be pretty? Will I be rich? Here's what she said to me.
I like working with children. Could be a future anything in that room, can't there? That's the great thing about it. It's like when you're at school, you could look at who might be the next Prime Minister and who could be the next Marilyn Monroe.
What were you like as a child?
I think I was cheeky and a little bit rebellious, rather than, criminal.
If you'd have asked me what I wanted to be when I grew up, I'd have wanted to be a fairy or a mermaid.
I thought I wanted to be a hairdresser, but the odd occasion in high school when I've cut a friend's hair, it's probably a really good thing that I changed my mind, because I'm not very good at it.
I want to be a fireman, I think. Although I can't go up ladders, so that was out. And then a policeman, I think, the second one.
Truthfully, I wanted to be a car mechanic. The fact that I could come home absolutely head to toe in grease was my idea of heaven.
What were you like as a teenager?
God, you don't want to know. Awful. Yeah, I was quite wild.
Any stories?
Oh, no, probably not.
I was quite boring. I wasn't particularly wild. I didn't particularly rebel. When I got to sort of 16, I started going out. And when I got to 17, started to notice a sort of ongoing headache. It's a weird thing to describe. I call it my tumour headache because I don't have really the words to describe it. Just sort of like a hot poker searing through your head. just really quick, short bursts. And then it would go, and I'd think, okay, it was a bad hangover. But yeah, it was way more than your average headache.
Sarah is 35.
Sorry, I'll stick it all in here. Sorry.
She's had a headache for the last 4 days.
Okay. Oh, let me get that. Sorry, not my day.
Let's get you sorted out, yeah?
Okay, thank you. Thank you.
Sarah.
Hi.
Hello, my name's Ollie. I'm one of the A&E doctors. Tell me about the headache.
I'm sure it's nothing. I've had a virus, so maybe it's that. But I've had 3 brain tumours in the past. I was 17 when I had the first one. And then 3 years later, the second one. Well, it was the first one that recurred.
Why didn't you come in on Friday when the headache started?
I'm very much, I guess it's just the person that I am. I worry just in case it is something really bad, and stupidly I don't. With my second tumour, I knew for a good week that it was back. But I went as far as Heathrow Airport to go to Australia before.
Was it a little bit la 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 la?
Yeah. I've always been told it won't come back, and then it has 3 times and various complications.
That's fine.
And it's just this, yeah.
You are a VIP when it comes to head and brain related concerns. My job is to assume the worst for everyone, all right? Doesn't necessarily mean anything to be worried about, but you're here and you, with your track record, we have to assume the worst and hope for the best. All right?
Okay. When you're 17, you're almost untouchable. You don't feel that much can affect you.
Can I just put that on?
But you're all less aware of the reality of things. It's just we have a saying in our family, if it's unlikely to happen, it will happen to me. So, which is why my parents put on a brave face. I could see how distraught they were. You know, you as a parent, all you hope is that your children are healthy and happy. And when something goes wrong where they're not healthy, all you want to do is put yourself in their shoes and take it away from them and be the one going through it. And I guess as parents, they felt very helpless. And I could see that. So I sort of made a vow to myself then that I would do as much as I could to never let them know how I was feeling. I thought if there was something I could do for them, it would be to put on a brave face, put on a smile, and just not ever let them see how upset or how scared or how worried I was. Okay. Oh, right, okay. Excellent. Because I've spent so long, you know, pretending that everything's fine, everything's okay. It's sort of a role you become used to playing, and then it doesn't become a role anymore, it just becomes who you are and how you deal with things.
Do you want to have children?
Yeah, I'd love to have children.
Have you always wanted to have children?
Yes, I used to want to have 5 children. But I think my partner might have something to say about that one. He's probably slitting his wrists. As long as I get my little girl, then I'm all right.
Yes. It would have been quite nice to have had a girl. I think probably each time before they were born, if I'd been able to choose, I might have chosen to have a girl. But, you know, the whole thing to do with motherhood is often quite mixed emotions, isn't it? Here, why don't you sit down? Sit down, darling, sit down. Oh, precious love.
Helen is 47. She's brought in her 10-month-old son, James.
I have 2 boys already. Ben's 15, Joe's 12, but I think I always wanted a 3rd child. I think 3 is a nice number. But I think Mark, who is the boy's father, was not very keen, actually. So that was always a little bit of an issue. I think Mark and I split up, and then in due course Pat came along, and then it seemed to be the right time because he didn't have any children of his own, and he was, you know, very keen and very happy. But of course by then I was a bit older, so we thought that the IVF route would be the best one to take.
Do you want to come through?
Yes, that's lovely, thank you. Come along then, tiny man. James was conceived on the 3rd attempt. Shall we sit here?
I'm Ella.
Hello, I'm Helen.
Helen, hi. Are you mum?
Yes.
And what's the problem?
Well, the problem is that James has been vomiting since it's about 11 o'clock this morning. And normally I wouldn't be concerned, but he's got an absolutely horrendous medical history.
Sorry, let's just start with
But he is a bit grumpy. Yes, the medical history is long.
Okay,
so,
start from the beginning.
Okay, he was born at 36 weeks, but I had pre-eclampsia and he only weighed 1.67 kilos. He had a hole in the heart and a multicystic kidney.
Okay, has that hole in the heart been repaired?
Yes, that's right, yeah. The whole pregnancy was terribly difficult from start to finish. Every time we had a scan, the room would fill up with all these experts, and that's never a good thing, is it really, in that circumstance? No. At 18 weeks, they realised that he had only 1 kidney. Then 2 or 3 weeks later, we had a detailed cardiac scan, which showed that he had a hole in his heart. I could have really written a textbook about abnormal pregnancies after that. So once James came out, you know, I was really thinking, oh, that's going to be fine now, you know, he's going to... I do tend to be on the optimistic side, and he came out, he looked normal. Obviously they took him straight away to special care. It was all good the first couple of weeks, really. And then suddenly, when he was about 2 weeks old, everything went completely pear-shaped because he was so tiny, his fetal circulation didn't switch over. Suddenly he was getting breathless, he was distressed. And then the consultant came to me and basically said that they believed that James wasn't going to make it, he was going to die quite soon. And I remember just walking in the corridor and tears just, you know, they just pour down your face. And I met this really nice consultant, and I said to him, you know, it looks like James is going to die, and he just gave me a big hug. And he said to me, you know, where there's life, there's hope, and you have to believe that. And it's such a cliche, you know, but you can't imagine how powerful that felt on that particular day. I'm sorry you don't feel good. By the end of that day, he was maintaining his blood pressure, and I look back on it, it's dreamlike. It was an experience that you don't forget. Are you a happy boy? Yeah, aren't you? So yes, with that history, you can imagine that I would be very, very protective. There was absolutely no way that I was taking any more chances with him. There you go. Poor little mannequin, you do look tired, don't you?
This is what I'm saying. The longer we stay in here, the more sick people are coming in here, bro.
Okay, what you needed to try and do is go to a hospital in Africa. You hate hospitals for the rest. You even set foot in the door. People were dying. I'm telling you, like.
Yeah, because you come from a different environment, innit? You come from like here. When you come from here, it's different. When you're used to treatment here, where if you were born there, yeah, hospital is a hospital, bro.
I'm telling you. But then sometimes it's better to go in the hospital because we had the like local, and he was literally like a quack doctor. He was kicked out of his medical school.
Wow.
And he took out someone's tooth, yeah, with a chisel.
Hold on, what chisel are you talking about?
You know them little, you know them...
chisel?
No, you know them... No, literally.
No, because he said chisel.
And then he tried to inject someone in the head. Like, literally.
Ain't that back in the day treatment, bro? No, bro.
When the doctors were next to the butchers, oh my God. And he even he killed someone. And they spared him.
I remember somebody saying about when he killed someone. And
he killed the lady. He killed the lady at Kolikunda, and then they spared him because basically they don't have enough money to go to the hospital. So,
how did he kill her again?
He gave her a wrong injection, and her daughter was left without no mum. He was a quack doctor. I'd never let that man treat me. Never.
That's what I'm saying. I prefer the NHS.
Even if you're dying, bruv, go to the hospital.
No, I do. I prefer the NHS.
I don't want to bother people if it's not an emergency. I'm aware of how busy everyone always is in A&E, and I'll feel a bit silly if it's something very stupid or it's something not to worry about, and I feel like I've wasted people's time. But my parents are more insistent than me, so it's usually after being strong-armed by them that I will go in.
Sarah's had a headache for the past 4 days. Since she was 17, she's had 3 brain tumours.
Something that I question more and more, I don't know whether it's the older I get or possibly the more side effects that occur, is I start to question my identity a lot. Am I the person that I was supposed to be or am meant to be? How much of me is the tumour and how much is the side effects of the tumour versus how much is inherently me? I don't know. Mo Molam had famously a brain tumour, and she was known as being very wild in politics and would do outrageous things, flashing her bra, and when she was told about her tumour and how it could affect behaviour and personality, it was the first time that she broke down, and she said, "But all this time I've thought that was me, and you're telling me it's just a product of the tumour." And that really, I suppose, struck a note in me. How much of who I am is defined by the illness, and how much of me is still me.
Keep your head nice and still. Look at my finger. Follow my finger with your eyes. Tell me if you get any blurring or double vision.
Tell me about Sarah. What was she like when she was a little girl?
She was a joker. She was the one, when we'd go away, suddenly started entertaining people by doing little dances and taking people off from the TV. She was, wasn't she?
She was.
Yes, yes.
But very quiet. She was
yes,
very,
it's strange. Yeah, there's 2 opposites in her as well. Yes, shy as well.
Can you feel me touching on both sides?
Yeah.
Both sides.
Sarah, in some ways, is quite introvert and very deep. When she was younger, before she could speak, it would be hard to know exactly what she was thinking, and now it's sometimes hard to sort of get her to tell you really what's on her mind or what she's thinking.
All my tumour headaches have been frontal. This one was at the back.
All of it at the back.
All at the back,
head.
yeah, and real throb, where I was holding my head.
And on a scale of 1 to 10, when it came on like that, how bad was it?
7, 8.
7, 8.
Yeah.
And what sort of tumour is it?
It was a benign pituitary tumour.
Pituitary. Okay, all right, fine.
I remember saying to a doctor, do what you want. Cut my head open, shave my hair off, put staples in my head. It doesn't bother me. My only thing is I want to be a mum. I desperately want to be a mum at some point, when the time is right. So I didn't want that jeopardised. Pituitary gland is the one that releases all the hormones, so yeah, it does affect your fertility. The damage done to it meant that it wasn't possible to naturally conceive. It's even worse because I've got a baby now and I just think I can't, you know.
And the baby's with?
My dad.
Okay.
He's never changed a nappy in his life.
How old's the baby?
He's 10 months.
Yeah, he's going to learn.
He's going to learn very quickly.
Okay, all right. This is not going to be an in and out of A&E in 4 hours type job. So your dad is going to have to get used to changing nappies relatively rapidly.
When you say it's not going to be an in and out job,
Don't
could
know
I
how.
be home tonight?
I don't know.
My dad can't cope for a night.
Okay.
Okay, I'll have to make some phone calls. Yeah.
All right.
Okay.
These things never happen at convenient times.
It's just my baby.
It is your baby, yeah, absolutely.
Okay, I'm fine, don't get teary.
No.
Right, okay. It was around the time which personally wasn't great for me. I was going through a lot of things. I had to move back home with my mum and dad.
Press 9 for an outside line.
Thank you very much. Hi, Dad. How is he? What time did he sleep till? Okay, all right. I'm not going to be in and out. It's not a quick job. May not even be back tonight. Well, again, until they do something, they don't know. But basically, with my, if somebody forget my history, if someone had come in and said, this is what's happened, coughing fit, blah, 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 they would assume a small bleed at the back of the brain, like a blood vessel. It might not be, but that's what they would assume. He said, obviously, given my history, yeah. My concerns pre-Elliot used to just be, well, if something happens, then it happens and I'll deal with it. But the minute a child arrives, it suddenly changes your priorities and your perspective. But yeah, you're going to have to get Kerry's help or something, Dad. Okay. Bye.
Cheers.
Is it worth even remotely trying to move it in any direction to try and ease it?
Do you think men ever really grow up?
No, not at all. Not at all.
You kind of imagine that there's a certain age where everything becomes simple and I remember thinking, when I was like 13, I remember thinking, oh, those 16-year-olds, they've got it all sorted out. And I would get to 16, I would just think, and then I'd look at the 18-year-olds and it'd be all over again. I'm still doing it.
King's A&E. Yeah.
Outside a South London pub, a young man has been stabbed twice.
Some children are quite independent, so they can wander off and go off. He was very clingy as a child.
4, lovely. Okay, thanks. Bye.
usually people who did meet him thought, oh, he's such a lovely boy, he's so polite and he's so this, which was very nice for me. But then, you know, when they turn into teenagers, they sort of change.
Red phone, 4 minutes, red phone, 4 minutes.
Is everybody signed in that needs to sign in?
He changed so dramatically through those years. So we became more like strangers.
Hi everybody, this is Wayne. He's been stabbed twice in the left thigh. Done. Fucking hell. Hand back on. When we've arrived, there was one wound which is about 4 centimetres long and actively bleeding. There's a secondary wound which is about 1.5 centimetres, not actively bleeding.
Hi Wayne, my name's Emily, one of the doctors. I'm just going to check you out all over. Can I have a quick look under here? Just check with him.
Turn your hand over this minute.
I've checked his pulse.
Doesn't matter what they've done and what you've gone through, you're always going to be protective about them. And here's something happening which you have absolutely no control over.
Fuck yeah. Well done. Alright.
Well done,
Deep breaths, come on.
Just relax your hand for me, boss. Cheers, mate. Another sharp scratch.
I never thought I would ever been stabbed. I remember saying, I never get stabbed. I never get stabbed. And it was like, wow, I have been stabbed there.
Do you remember the first time you were arrested?
Yeah, I remember. What do you mean? As in, how do you want me to elaborate in that?
What happened?
I remember I took something. I remember running down the road, running through the park, and then I hid, and I got caught hiding in the bin. And then I was in the cell, and I think I remember, I swear I cried, because I was like, oh no, what have I done? And then they said, you have to phone your mum, and I was like, do I have to phone my mum? Can I phone someone else? I don't want my mum to find out. And I'm thinking, did I phone my mum or did I phone my uncle? I'm not too sure. I think I might have phoned my uncle, and my uncle phoned my mum. But my mum found out anyway. And then that was it. It was like, oh, the shame, you know. I felt shamed, but it wasn't like, I don't know. What the problem was when I went back out with my friends, I got glorified for it, you know. It's like, wow, yeah, what happened, you know? You got nicked. Oh, they let you go. And it's like, wow. And it became kind of cool. And obviously you're young and you're naive and you think, wow, okay, cool. You know, you were showing off like, yeah, you know. And then it became a habit. One thing I always said to my mum, don't ever blame yourself, because you haven't done anything wrong. It was down to me making my own choices. You know, she always gave me the choice to make. I knew right from wrong, to be honest with you. So you could never say it's down to my mum was a bad parent or anything like that. It was all down to me. I thought, that's it, I've got to do something now or never.
Precious babe.
10-month-old James has been vomiting since 11 a.m. His mum Helen has brought him in to paediatric A&E.
Hello. Oh, look at that smile. Very good.
James spent the first 13 weeks of his life in hospital.
When James was born, he was so tiny, and I just burst into tears when I saw him. I just felt this horrible sort of guilt that I've done this to you. It's all my fault, basically, that you haven't grown properly.
That doesn't help. Hang on a minute.
Oh, sorry. Hold my hand, darling. With that history, you can imagine that I would be very, very protective. And I think just a couple of months prior to that, he'd had another stomach bug, what I thought was a stomach bug, and I'd kept him on the sofa and looked after him and observed him. And in fact, it turned out to be a hernia, and in fact, he'd had to have further surgery. So I was even more neurotic than usual. Let's hope it is a tummy bug. Are you going to have a vestibular yet? Let's hope it is, sweetie. Yes. Lovely.
Okay,
Thank
I'll
you
keep
very
an eye.
much. Well, we'll see you in a bit then.
Yep.
I guess we should phone Dada, shouldn't we, and tell him.
As a parent, all you want is for your children to be happy and healthy.
I'm just going to move you ever so slightly.
Okay.
Just keep very still there for me, Sarah.
Sarah's scan will show whether her brain tumour has returned.
All right, let's begin.
Now, I've always said in a weird way, I'm glad I was a person going through it.
Okay.
And not the person watching someone that I loved going through it, because I'm sure it must be 10 times more difficult.
Okay, do you want to chat with the man? Here he is. Talk to Daddy. Say hi to Daddy. That's Daddy. I think that was the first time we'd ever been to hospital and it hadn't been something serious. It was really the beginning of not having to worry about him and really the beginning of treating him like a normal baby after everything that happened.
I know my mum, suffers a lot from her nerves, I suppose, because as a mother, it hasn't just happened once. You have one tumour and then you're told it's gone, and then it comes back a second time and then you're told it's gone, and then it comes back a third time and you're told it's gone. Well, you're always expecting the worst. And I think that's what my mum does now. Even when things are going great, there's always part of her that is expecting something bad. And I think that's the damage that it's left behind.
My feeling at the time was we must be in the best hands. They know exactly what to do. But the first operation didn't go too well because he told us that it was terribly vascular and it bled quite a lot, so he removed what he could. And obviously it came back. And that second time, they operated again, but this time was a huge operation whereby a skull was open and it was horrendous. It was so frightening, so frightening. And she was very lucky to make it, very lucky. And it came back again. It was as if we were going through a nightmare that would never stop. That poor girl.
Do you think there'll ever be a time when you won't worry about Sarah's health?
No.
Not for me.
I read an email that my mum had written to someone once, and it was after the second operation. And she said, "What have I done? What have I allowed them to do to my daughter?" And it's just that horrible moment of clarity, thinking she blames herself. And, she was nothing but amazing and wonderful, but she still blamed herself. So it's, I'm fine. It's okay. It's not a problem. It's partly lying to myself and partly lying to other people. It's not wanting to face if it is back or if something has happened again. Especially now that I am a mum, I just, the thought of going through it again whilst I have Elliot is sort of 100 times more scary.
Yeah,
tetanus in the last 5 years.
So what was you doing tonight?
I was watching the Arsenal game.
Did they win?
Watching the Arsenal game. We came back 3-0, but we never won.
Oh. So a double downer, eh?
Any question? To get you out? Why is it impossible to my partner stay with me for the night?
No. They don't allow it.
She's not going to be in a good mind right now.
Is there anyone she can be with?
Wayne, a 28-year-old glazer, has been brought in after being stabbed twice in his leg.
Okay, what I'm going to do is I'm going to give you a tetanus injection. All right? So we've covered everything, just as a precaution, all right?
My girlfriend phoned me and she was like, oh, where are you? And I said to her, I'm in the pub with my friends. She parked up around the corner from the pub. She came in, I think me and my friends had one more drink or so. And then we left to go to the car where she was parked. It was like down the side of a street. We got into the car. I remember the doors closed, the doors opened back up. And there was a group of guys all around the car. They waved the gun at my girlfriend. They grabbed my girlfriend's bag. I tried to remember holding it, and then one of them hit me in my face. And I got punched on my leg twice, what I thought was a punch anyway. And then it happened very quick, and then they just ran off. And I remember trying to get out of the car and trying to chase them, and I couldn't run. And I put my hand on my leg like it was like a dead leg. And then as I looked at my hand, there was just blood all over my hand, and then that's when I realized I got stabbed. I felt sad, knowing that, I felt sad for them as well, because it made me think, you achieved one thing, a mobile phone, and there was at least 5 of you, like, what's that, £10 each? Like, I would never have done something like that in my bad times, but at the same time, it's that how far we've come. It was kind of sad to know that, people going around stabbing people on random sprees, like, maybe it's the initiation of a gang or something like that, I don't know, but I did feel sorry for them, and I felt saddened, if you understand, knowing that I could have been heading that path.
Came in with more rolls than you had to start off with, eh?
More stabs from us than from anyone else.
I don't know who's worse, you or the bad guys.
Yeah. You have to put up with us as well.
I got to about age of 24 and I realised, like, enough is enough. Excuse me, man. Thank you very much, man. It's all right. Thank you for your help. You look after yourself, all right? Yeah, I was sitting in the police cell. I remember even looking up at the ceiling and seeing a Crime Stoppers number and thinking I've read that number too many times and this is not it no more, I'm sick and tired of this. And the police officer saying, hello, Mr. Marisha, how are you doing today? Didn't want any of that no more, to be honest with you. I thought, try to start a new, fresh start.
So many people do this revolving door thing, keep getting in trouble, out of trouble, in trouble. And I think he somehow managed to catch himself and say that, I don't need to be doing this anymore. Although it took time, he found himself, I think.
Sure you're right.
It was all a blur to me.
Yeah,
I
that's
was
what
still a lady. I didn't
can't really
know
remember.
what they asked me.
Yeah,
What
as
it looked like.
long as you're okay, that's all I care.
He took positive steps, Went back to college, did some courses so that he gained some skills, so that eventually when some work came along, he would be able to be, ready to take on a career, really.
Yeah. I remember the day my mum said to me she's very proud of me. It almost made me cry. It's like, wow. I remember I said to my friends, yeah, my mum said to me she was proud of me. And it's like, it felt a lot, to hear my mum say, you've come a long way, She let me make my own mistakes and it's made me who I am today, It's made me a better person, I might have gone through it the long way and it took me 10 years, but it's got to that stage where, I've learned who I am.
motherhood is good for learning about the sort of person that you are and what you can give as well, as a human being as well as a mother.
Hi, is that neuroradiology? I'm just trying to chase up a CT scan report for a head CT on a young lady that's come in with history very suspicious of a subarachnoid hemorrhage.
I think I pace when I worry. I was probably wondering what my dad was doing at home with my son and how he was going to change a nappy. I showed him very hurriedly before I left, but it was still crossing my mind. I mean, as a mum, you do, don't you? And you just worry anyway. And I'm always with Elliot, so to not be with him was very strange, and I just didn't like it.
Okay. Thanks a lot. Cheers. Bye. Good news and bad news.
Okay.
The good news is the scan doesn't show anything apart from the old,
right,
what's happened in the past. The bad news is that means that we need to speak to the medical team about thinking about doing a lumbar puncture.
They're supposed to be painful, I know that. As in, if there is just nothing wrong, is it still worth doing a lumbar puncture to prove that there's nothing wrong?
The scan doesn't pick up all bleeds.
Right. Okay.
All right. But as I say, a negative scan is good news, yeah? Yes. It's just going down the boxes, ticking them off, all right? Okay. First box is ticked, right. The next box, unfortunately, is a fairly big box, which is lumbar puncture, but we need to decide whether or not we do need to go down that route. All right?
All right. Cheers. I'd happily give up all the bad health for a life of good health. But then, in a way, it has made me who I am. If it hadn't happened, would I have my son? I might have other children, but I wouldn't have Elliot. So, in a way, I wouldn't change things.
It's in the hands of the doctors and in the hands of God. If you believe in God, all we can do is hope that we'll be lucky and that she gets the best doctors and the best medical care, and they can sort out the things that are wrong with her and keep her alive. That's, what else can we say, really? We can just be here to pick up the pieces if
I just sense she'll be all right. She will be all right.
Yep.
I believe that little Elliot has brought her a lot of strength.
Tell me about Elliot. What's he like?
He's just everything. He's everything to me. I can't imagine not having him. I can't imagine what my life was without him. I remember coming back from the hospital with him, and it still doesn't feel like it's real. I still kept thinking at any moment I was going to have him snatched away or wake up from the most amazing dream and be told that it wasn't real. You know, it's just so much more precious when you've had to fight for it. So yeah, having come so far to have got him and then for something to happen would be awful. And I know if something happened, it wouldn't be through fighting, because I would fight the whole way. Just want to do the best job I can, be a good mum, do right by him.
I never really had my dad in my life. Not saying that he's not in my life, but growing up, I don't really have any memories of him being in my life. So I'm going to make sure that my child has me until the day I pass away. You know, guide her through all the hard times, bad times, support, best friend, everything. Yeah. So that's what I will try to be. I'll try my best. That's all you can do, really.
It will be absolutely fine.
Yeah, there's a lot of room for optimism, and I think you have to make the most of what you've got today and dream about the future. I think that's what makes humans the way we are, that you live for the future as well as today.
And you need to dream.
Yeah, you do. Everyone needs a dream.
Yes.
I dream about Kate Bush, but there you go.
We get a lot of falls, people climbing trees, being stupid, people being drunk, falling out of windows.
I've only ever been in that sort of state like once, maybe twice.
He says he's got a knife on him and he's been really aggressive to us. I've just called the police.
Do you know where you are?
My guess is a hospital.
Yeah.
Surgery. We're just going to get on through this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir. Let's go. Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her. Come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
What was I doing when it happened? American friggin' football, right?
I've got to go home and keep it in a sling and keep it elevated all the time.
7% of patients come to A&E with fractures, breaks, or dislocations.
And there's some codeine as well. More medicine, sweetie, to make you better.
Where were you playing American football? Burgess Park.
28-year-old Ahmed dislocated his shoulder in a game of American football.
focus on the sickness first.
Yeah. Apparently in London, you guys have a few parks, so the parks are
Just
pretty
a few.
big, though.
Where are you
They're
from?
Pretty big when you get to them. So, Canada.
Whereabouts?
Toronto, you know, Niagara Falls region.
T-dot.
T-dot, yeah. I've been here this is my 3rd year now.
Okay, you studying?
Studying pharmacy.
You've got different methods of putting shoulders back in. You know, you kind of have the discussion with your seniors or your colleagues beforehand, say, oh, I'm going to use the Cocker's method, I'm going to use the modified Milch method, or I'm going to use all these kind of methods. When in the end, it's kind of like, and then you just pop it back in.
Yeah, I can feel it, you know, I'm just talking about nothing.
Right, you ready to have a go?
Yeah.
Okay, let's put this on that side. Have you got the collar and cuff? All right, I've got you. I've got you. Keep sucking on that. Relax. Relax. Keep taking nice big deep breaths on that. Relax. Relax. How's the pain?
All right, do what you need to do.
Yeah? Just keep taking it. Keep taking the thing. There we go.
Thank God. Oh my God, that's the best feeling in the world.
Really?
Yeah, no.
You can't think of anything better?
Well, right now it's all right.
Okay. When you hear the clunk of a shoulder going back in, you're like, yes.
I felt it just roll into place. Thanks a lot, man.
No worries. It's like scoring a goal when you manage to get a shoulder back in. Or winning £10 on the lottery.
Nearly done.
Oh no, we're very nearly finished now. I'm just getting it in the best position I can get it in.
Because we often see patients come in walking for 3 days on broken ankles saying, oh, it's a bit stiff, doc.
It was all right. That was Thursday, wasn't it?
Yeah.
It was okay. Well, I mean, it was painful, but it was okay Friday.
Yeah.
And you get somebody coming in with a paper cut who's screaming, you know, as if their house is on fire.
Yeah, to take a patient's pain away is quite satisfying. Because even though the problem's not gone, you've just taken away the pain, it's a start. Is it a bit better?
Yeah. When someone's in pain, they need your help. When you aren't able to do that, it's almost as if you failed at what you were trained to do.
Hello, Kingsley. Yeah. Okay, so just you had morphine and... thank you, bye.
The paramedics are bringing in a 24-year-old man. This is his third admission for chronic pain in the past 2 months.
Red phone 9 minutes, red phone 9 minutes.
When I see people with long-term illnesses, you do think about the family and how hard it must be for them to cope. You feel sorry for them because you can't cure them.
Hi Malcolm, it's Rubiel. I've got a 20-odd-year-old chap who I'm going to refer to the medic. He's got Behçet's disease and it's quite complicated.
Has Behçet's disease.
It's a syndrome. Pain all in his hips and down his legs. We've given him 20 milligrams of morphine.
Lee was diagnosed with Behçet's syndrome, a disease that affects the immune and nervous systems 6 years ago, when he was 18.
All right,
Pulled it
so
up and went another
Lord.
10. You should have seen him when we got there. You can see the pain he's in now. And that's after all that. He's been through so much. And he's in so much pain, every now and then he'll just go out.
Can you two do something simple like go for a walk together?
No. He can't even go to the shop downstairs because by the time he's done that, he's in agony. He would have been doing football, he would have been dancing a lot more. He would have been in the army.
Well done. Just got to write your notes, okay?
Danny, Neil, can you follow me?
Hi. Dad of one, Danny, has come in with a swollen toe.
Can I take a seat? Yeah. Hi there, my name's Chris. I'm one of the doctors. What can we do for you?
Well, I put my foot through my son's bucket just under 2 weeks ago now.
When you say through the bucket, actually?
He had a plastic bucket. I got dizzy, I banged into a bookshelf and an ornament fell, knocked it across in the path of when I was stumbling.
Okay.
And my foot went straight, into it, crushed the bucket under my foot.
Okay.
Barefoot. And for the first few days, the whole of my foot underneath was all swollen.
Okay.
But my big toe, which actually at the time, thinking about it, was the most pain I had.
And have you seen your GP about it?
No.
Okay, why not?
Because I just thought, look, I just bruised it a little bit and it'll get better, but it hasn't.
So what made you come in to the emergency department today?
Um,
So you've had it for 2 weeks. What made you come in today?
Well, I didn't really notice it before. It was just today when I actually put them down, I noticed it, so I thought I'd better come and get it checked.
Can we have a look at the other one then? Okay, let's have another look. So that's fine there.
Yeah, but when you get down to where the ball bit is, it starts hurting.
How about there?
No, not so much.
There. There. Sorry. So that's the worst bit there, is
Yes.
it? Okay.
It made it hurt up here, yeah.
Okay, let's get an X-ray of that. Men, in general, handle pain less well than women. Have you had any painkillers today?
No, I haven't had nothing today, because I haven't had nothing to eat, so
Would you
I
like some?
haven't... Yeah, actually, I could... Well, no, because I haven't eaten, so I don't really want to.
Okay. I don't know if that's because we get mothered by our mums as little boys, whereas girls are left to get on with it. All right, the X-ray's fine.
Yeah?
Yeah, there's no fracture, no break, so it's just bruised.
Okay.
So just simple painkillers.
All right, thank you.
Addy, he's had 20 morphine. Do you want diazepam? Diazepam is what works. Diazepam, yeah.
Do you mind if I take some blood?
No, go.
Try and keep it still as you can. Like
Sorry.
blood and all, it's really sharp.
Lee's acute pain is a result of Behçet's syndrome. It started 6 years ago with a numbness in his leg.
So some more morphine in subsidised meals for you.
Oh, thank you very much. Just take this edge off. See if I can close my eyes for a bit.
There is no cure for Behçet's. The staff can only help manage Lee's pain.
It's a form of vasculitis. It affects the nerves, muscles, immune system, blood system, ear, nose and throat, joints. It's just all of them rolled into one.
I said before I got this, I was playing football for 3 football teams, jogging like mornings and things like that, and then I got this and it was like, yeah, you're not doing that no more.
One thing I want to do, kick a ball again. That's my main dream. It's just to, even a 5-a-side football match is my main dream. Kick a ball again.
Have you still got it in your hips?
These used to right hips, but since I passed out and went to my house and I passed out on a wooden floor, landed right on my left-hand side. And since then, my left side's been playing up now as well. Since I got this 6 years ago, it's actually been nothing but trouble.
When I go past grass and smell of fresh cut grass, that's one thing that gets me still to this day. It just brings me back memories of back when I was playing before I had Behçet's. I love that smell. I could sit there and just smell fresh cut grass all day and just be happy. It's weird. I wish I had shattered my leg. It may sound horrible. I wish I was in a car accident and had a lot of broken bones because that could have been fixed. Like, let's have fixed for that. But yes, it's just, there is no cure for it.
Man, I was more drunk last night than I have been in, like, several days. Yeah, but you think for most people that would be weeks.
Yeah, should be weeks for you and all.
Yeah.
You're chomping away like a monkey there.
Very hungry.
Kamladi has earache. She has come in with her husband Ravi.
She was having a problem with her ears.
So you had a pain.
Somebody said if you put a stick of garlic in your ear, that will reduce the pain.
Okay. One clove.
Not the full one, only single one, yeah?
Oh yeah.
You can see it, huh?
Yeah. Okay. I'll go and speak to one of my seniors and then we can come back.
Okay.
Garlic clove in her left ear.
Sorry?
Garlic clove. She's got no hearing loss from it.
I'm sorry. I'm sorry. Okay, right. How long's it been in there for?
A day.
Okay. Do you want to take it out? Yeah. Come with me.
This garlic doesn't work, does it?
I've never heard of it,
I know.
to be honest. Try that.
Let's make one up, yeah.
So can you just tilt your head a little bit?
Yeah.
That's great, thank you.
It's got teeth on it. If you just grab it, you may be able to get some friction. There you go.
Yeah, done.
Well done. You can take it home if you want.
Would you like it?
Just double check. Make sure there's nothing left behind. You do find you get people with just really strange things wrong with them.
Way out.
You do hear about these weird remedies like that though, but I thought it would have been crushed garlic. Because when she said that, I was thinking, oh, this is gonna...
That could be a mess, yeah.
Yeah.
That will definitely need mug suction. Some people do put objects in certain orifices that are inherently amusing.
I guess, probably.
You kind of have to laugh, otherwise you'd go insane. So, yeah, they're the good fun ones.
Mum's here. Do you want her to come in?
Yes, yes, please. Mum.
Right, I've got some more diazepam.
Oh, thank you.
Yeah.
Oh, it's nice and warm. Hopefully it's 7 for 6 and you'll never knock me out for a little bit. Sleep is always good 'cause you don't feel pain when you're asleep. It's as they say.
Lee, when he was younger, he used to be in a football team, do training, just started work as a doctor's PA. Very outgoing, happy boy, always out.
Please get my socks on, please. My feet are really cold, get the socks on. You know how to do it, just roll. Oh, God, I can't even get pronounced words properly. This is getting ridiculous.
Row your boat.
Yeah, rowboat. Don't you done? Stream.
Well, let's start kicking it in a minute, mate. And then one day in work, he couldn't feel his legs. And we rushed him to King's, obviously, to try and find out what the problem was. Kept him in for about 3 weeks and eventually got to the point where we found out it was Bechet's.
It's not cold feet.
His life's on hold. It's been on hold for 6 years. You go from a child that can walk and play to a child that lies in bed most of the time and he's in a wheelchair or he's on crutches. He's fighting something so hard that there's no answers to. But I mean, he gets days when he's really bad, but I've got to cry, sorry. He gets days when it's really bad, but you just got to be there for him. You just got to deal with it. Great memory.
You can go for a fag if you want.
OK, we will do. We don't need telling twice.
Leave me alone.
You OK? You cool? Right. You might get McDonald's breakfast this week.
This week?
Today.
You're going to treat me to McDonald's breakfast?
Have you been a good boy?
All depends what time.
Are you going to treat me to McDonald's
Yeah, I
breakfast?
bought you McDonald's last week.
You're going to treat me to it?
Well, he has been good taking his morphine, and I did say I'd
then I will.
I'd let him have something.
Oh, see, I'm so happy.
No, I said I was going to get him something for when he takes it.
No. Can't relax yet. I'm painful.
The weekend we decided to go up to Nick's. I'll wear heels.
Fucking hell.
No.
I love my flat.
Lee? 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 Are you alright?
Can you ever forget you've got Bechet's?
No. I wake up in the morning, the first thing that hits me is pain. So the first thing I remember in the morning is you've got Bechet's sort of thing. And the last thing I remember at night is the pain sort of thing before I go to sleep. So I've got to take sleeping pills just to get to sleep nowadays because the pain's just too uncomfortable for me to sleep.
Huh?
That gas?
A little bit, yeah. It's just taking that edge off of it, you know what I mean? That little bit edge off it. And I think it's keeping my mind on something as well, which is helping with the sort of controlling the pain.
Do you take regular painkillers at home?
Purpose. That's one thing I've been missing since I've had this, having a sense of purpose, you know. When I had this, at least I knew there was things I was doing. There's a reason for me to get up the next day, there's a reason for me to wake up.
First year, I'd done a few stupid things and
doesn't hit me anymore as bad. I just get a few teary moments, as you can tell.
When I was just about to turn 20, I just thought that was a burden to everyone. And at that point, I was just like, oh, I can't do anything. It's just the point of me being here.
He just was really bad one night, and he called me and he said, like, he's got no life, he can't meet any friends, he can't get out.
I just felt worthless. I'm just wasting air, really, you know. Might as well just get rid of that. Get rid of it out, get rid of that, get the trouble out of people's lives. So we lived 3 floors up, and I was sort of looking down at the window. Sitting on the window ledge. Just back to sort of lean forward and just go onto the concrete. Mum saw me at the window. She just dragged me in and went, that's it. It will take you to a shrink.
Head back. And he's going to go sleep. Head back. That's it. Back a bit. Make sense?
Hey man, I'm just wondering if Ahmed is still in resus or whether you know anything about him. Has he? Oh, they discharged him. That's cool. All right, thank you. That's great news. Ahmed's already gone home. They let him out just after.
American football coach Jacob has brought in Andrea.
That's unfair. I want to go home too.
He was knocked unconscious in the same game as his teammate, who dislocated his shoulder.
Head up, man. Eyes open. Let's not fall asleep. So usually now it comes over the top.
First.
Lift your hands up.
Hands up to heaven. Oh my God.
Okay. I'm very sorry.
What happened?
Bent for my sins.
Yeah.
You got a nice young nurse looking after you.
Yeah, it's
and
unfair. I'm
you
very
hit her.
sorry. I was very concerned about having
He said he didn't want to take it off in case it stank. You've got to make up to this pretty young girl now.
I'm very sorry. I'll pay you a coffee if you want.
Oh, you're okay. You're fine.
Cheers.
You stink, by the way.
What?
You stink.
I got perfume in my bag, Coach, if I stink really too.
You're fine. I'm joking. It's my Irish sense of humour, don't worry.
Are you Irish?
Now you're gonna... So you've only just realised?
You don't recognise the accent? I'm not from here. How can I recognise the accent?
I'm stuck with you, unfortunately, for a while.
Unfortunately?
Yeah.
C'est pas très gentil, ça.
King's Recess.
Yeah.
The paramedics are bringing in a 30-year-old dad of 4. He was found unconscious at the bottom of a stairwell.
One, two, three.
Cole. Hi, this is Simon. He's a 30-year-old gentleman. Tonight he's passed out and fallen down about 7 steps. He's complained of C-spine pain and tenderness. He's had a relationship breakdown on Valentine's Day, and since then he's not eaten or been eating and drinking. And so I think it's probably all more emotional, and he's apparently passed out at the top of the stairs and fell down about 6 or 7 steps. He can't remember what happened, and his partner's just broken up with his children at the time. It was quite a stressful situation.
Hi guys. How are we doing? My name's Charles, I'm one of the docs. What's our friend's name?
Simon.
Okay. So Simon, we call this a log roll. We call it a log roll because you pretend to be a piece of wood, basically. You just lie still. Jackie, the boss there, is just going to, when you're on your side, is feel your back, give you a few pokes here and there. We need a yes for pain, a no for no pain, no nodding and shaking of your head. All right?
Ready,
All right.
steady, roll.
Sorry, Simon.
My kids saw me go downstairs and they're crying their eyes out. All they were saying was, Daddy, Daddy, Daddy's hurt, Daddy's injured.
Okay, is that your scapula that's hurting, the shoulder blade?
Yes.
Okay.
Is it
Right scapula is a point of tendons.
Okay. What about in the middle here?
No. 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 No.
Can you feel me touching there?
Yeah.
And there? And just squeeze your bottom. Okay.
Happy?
Okay.
On your call?
Ready, steady, down.
All right. You've got inline still? Okay. Okay. Simon, without trying to beat around the bush, because of your build, it's possible that we won't be able to get the X-rays that we need to get, because we have to see the bone at the bottom of your neck. But Simon also has a very small, we think, subdural MRI from a previous fall, so we may wind up doing a head and neck CT, but we'll cross the bridge when we come to it.
My whole body just melted. I said to her, there's your Valentine's card, there's your flowers and that, and she's just shouted it from top of voice, I don't love you no more.
Did you knock yourself out at the time?
My girlfriend and...
Do you remember falling?
No, I passed out before I went down.
So it wasn't so much a fall as a faint?
Yeah.
OK. Your background health? Asthma, diabetes, kidney problems?
I'm fine.
Regular medications?
Fine.
All right, OK.
Simon and his partner were together for 10 years. They have 4 children.
I felt like my heart broke and smashed them into pieces. I didn't know what I've done wrong. That's why I ended up in A&E, because I wasn't eating for like 4 days, solid.
All right, if you keep as still as you can, Simon, I'll do a quick heart tracing.
Did you ever think you would lose her?
No, never. Never in a million years, no, never.
He doesn't want us to cut his clothes off, Claire. It was a broken heart that led him to get a physical injury. For a male to come in and physically be, stop eating and being unwell over a woman, I can't say I've seen that a lot. Squeeze both my hands as hard as you can. Harder, harder, try and hurt me. Come on, you're tougher than that. I know it's scary, we'll get you all sorted, all right? Do you want a tissue?
Have you always loved Cassie?
Yeah, always, yeah, from day one. From day one when she moved around the estate. I see her walking up and down the street with her sister going to the shops. She'd be in a boob tube and miniskirt in the summer, right? And I was just like, wow.
Do you want your sock
No,
back
you got no, yeah, can you want something fluffy and cold?
Why'd you take your sock off?
Because she had a really bad itch and I couldn't get to it. I keep itching because of the morphine, isn't it?
I've asked her, she's just going to get the doctor to run it out for you.
Oh, brilliant, thank you. Yeah, oh!
We'll hold it, we'll hold it. Down. Lee, do you think you need some more morphine? Lee? Oh my God. Wakey, wakey. Wakey, wakey.
Where am I?
Hospital.
What?
You're in the hospital.
You're right.
This doesn't look like King's.
It is King's.
It's not guys, is it? It's
No, it's Resus.
It's Resus.
It's the new bit, remember?
They brought you into King's. Right. I'm just going to get... I'm going to get you some tissues.
No, leave it. It dropped. It dropped.
Lee used to have loads of girlfriends years ago, and then this big blot in his life for 3 years where he's not been able to go out, he's not met anybody, and then all of a sudden she comes along and it's just attraction straight away.
You can't have it yet because the gas it drops on the floor.
Oh, I hate the way it hits you like that.
I know.
They're just meant for each other.
Deep breaths.
Yeah, since he's met Megan, his life has changed.
It dropped on the floor, innit, so you don't want to...
Yeah.
Megan and Lee met 7 months ago at a party.
I saw him as he was coming downstairs, as I was coming up, and it sort of clicked from there, really.
Just drink. So you liked him from the moment you saw him?
Yeah. He lets people shine. If you can't shine yourself, he'll help you. I think I'm just lucky. Just luckiest girl in the world, really.
your drink, babe?
Hmm?
Where's the drink, babe?
The first time I had an attack was about 2 weeks into our relationship, and she slept on this little tiny chair, just didn't want to leave me, did not want to leave my side, and I was like, wow, it's the one. Without her, I don't think I'd be here right now. If it weren't for her. My head was getting back to a point where I was in a place where it was getting bad again. And she sort of just come in at the right point. Oh, sorry.
Really itchy, morphine.
What my head was like before she came along, sort of thing. It's just, wow, that's how lucky I am to have her. That's how lucky I am to have her. Just so I keep thinking, lucky.
Oh. Okay, so it's that.
His eyes are hurting him.
Yeah, he's not doing well for us.
Thank you
He hasn't
very
hit you
much.
again, has he?
Not yet. I think he probably wanted to.
Are you all right? He didn't hurt you, did he?
No, I'm fine.
Good. You do stink, though, you know that? No, that's good. That's the smell of success.
Yeah, well, I'm playing Sunday anyway.
Well, I'll be down to Coach Ramos.
No, I'll get clearance.
Hi, guys.
Good evening.
How are we doing? Do you mind if we turn some light on?
Yeah, he's a bit sensitive to the light at the minute.
All right.
Do you reckon you can cope with it for a short while?
Jolly good. Andrea, Mr. Gabus, is that how we pronounce it?
Yeah, you're good.
OK, my name's Charles, one of the docs. So, American football, hence the pads. Now...
I don't need that anymore.
No, you don't. That's fine. From a head injury point of view...
Yep.
No imminent risk of concussion. OK, the slight light intolerance is a bit unusual, but I'm sure that'll settle. I'd avoid contact sport, unfortunately, until it settles down.
To when?
Until you've been pain-free for a while, all right?
Can you just sign it? I can play Sunday.
I can't sign anything to say you can or you can't. The advice would be not to play until the pain is resolved, all right?
Okay.
All right, hold fire there. We'll get you some painkillers and get you on your way, OK?
So that's cool.
That's great news.
There you go. All's good.
See, I was faking it, probably.
Thank you. I'm
Take
sure
care.
you'll see another
Bye-bye.
one of the teams sooner or later.
Yeah, Steve, mate.
Simon's workmate at the recycling plant, Steve, has come to his bedside.
You hear what happened, didn't you?
I got the gist of the story.
I don't know if you can do this to me.
Don't worry yourself about my ex-player. Just concentrate on getting you better. To get you out of here, we'll make sure that you get well. Make sure you get better.
But I love her.
Take care of yourself, Simon. All right? I'll see you when you finish.
All right, cheers.
All right? I'll wait for you.
All right.
Yeah, literally just feel like that. Feel tiny. You think, hang on a minute, you know, as big as I am, the world's crashing down on you, and you feel like a little mouse. You ain't as big as you are no more. As soon as that woman says that, it's game over. Yeah.
They've just taken him for a scan about 3 minutes ago. He's under a morphine drip at the moment as well. Yeah. It's going to take a lot for him to build everything back up. He's not the same Simon I knew when we started to work, I'll tell you that for certain. Trying to keep Simon's spirits up, but even that's bloody hard. Just have to see how everything goes.
Ready? 1, 2, 3.
an
Fantastic,
X-ray.
thanks very much. All right, Simon, your scan's fine. Let's get this for you, huh?
So you better take me off now.
There we go. Now, I don't want you to start turning cartwheels or anything because you've been flat for a little while. Oh, man. That's better. OK, I'm just going to sit you up a little bit, all right?
Simon's nan has come to take him home.
I'm just going to sit you up a little bit, just let you relax, all right? And then I want to come back and re-examine your back a bit now that we know your neck's fine and see if I have to order any more x-rays or not. 20 mils Gaviscon, yeah? Yeah. OK.
So all the scans are showing nothing wrong. What's going on?
Well, probably just fainted because you lack of food in his stomach.
I've still been on my diet though. I just eat a little bit, not too much. 3 Brussels sprouts a day. That day.
3 Brussels sprouts, no thank you.
I had 2 Brussels sprouts a day and about 4 carrots. I was thinking a lot more what I've done. If I should have done what everyone was telling me. The whole family and friends said, get on with it, move on. You know, what she's done, she's done. She's trying to move on herself. But if I've hurt myself in the long run, how's my kids going to feel? That's basically my main priority.
Nah.
Simon, the other thing to say is I think you fell because you fainted, but sometimes when there's been a fall and you can't remember, there's always the risk that could actually be a type of concussion. And so if you get any signs of delayed onset concussion, sort of vomiting, eyesight problems, all those things, come back and see us again. I don't think it's going to happen, otherwise I wouldn't be sending you home, but just so you know.
But he's not eating either. He's not eating since last Tuesday.
Right, is there any reason for that?
Well, what he's going through at the moment.
Just finished a 10-year relationship.
Right,
4 kids.
You are eating something, you're not starving yourself. Nothing at all. You're drinking? OK.
Just fluid.
Just fluid, as in hydrating rather than alcohol, I meant.
Yeah, I don't drink, yeah.
OK, that's fine. It's always difficult to see somebody suffering, whether that is physical or emotional. And emotional suffering is more difficult to deal with than physical. All right. Charlie, good. All the best, my friend. Take it easy. All right. Any problems, give us a shout in terms of the neck injury or anything like that, but take care of yourself. Right. See you. Look after yourself. I would not want to go through what Simon went through. My wife means more to me than I can actually say. Losing her is not something I want to think about.
Matthew, yeah? Would you pay £711 for flight and hotel to New York?
No, too expensive.
I found one. In Turkey, under £600, flight and hotel, all inclusive.
Not for you.
Look at the hotel.
Is it I want, no. How about no pool? We just use the beach.
What do you mean no fucking pool?
Is there a beach in Turkey? Where is Turkey? It's near Greece, yeah?
Is your pain getting any easier with this one?
Yeah, a lot.
The cause of Lee's Betchits is unknown. Some sufferers grow out of it in middle age, but for many it's a lifelong condition.
That's look. When you do that, I give you that one on enough, right?
Yeah, but I couldn't see how far, if it touched your lips or not.
And just go like that on a general basis. When I do that, it's touched. When I do that again, it means I've had enough, all right?
Means that, yeah?
Let's try. It worked. So how many times have you had to come to hospital with me now? My newly engaged fiancé.
You don't have to keep saying it, you know.
Yeah, but you're my newly engaged fiancé.
Yeah.
My beautiful fiancé.
Do you like saying the word fiancé?
I love it. fiancée. I love saying it. I do. I love showing. I love showing her off. It's just one of those things. I love showing her off. I'm just happy.
Gassina, why have you taken it off your finger?
He's been annoying me.
Put it on that one then.
Okay.
Who should hold?
I don't like it. It annoys me.
Oh, shut up.
Okay, I thought we met a couple already.
Stop moving. Lee, stay awake. Stay awake. I'm going to take it. It's enough. Because you are very, very, very challenging.
Yes,
I want to get married when he is fine. When he's fit and able to walk, stand, and then walk back, and still carry on with the reception.
You got my slippers on.
I've just been rubbing the floor, ain't I? My shoulders are hurting my feet. Even if it takes till we're 60, I'll wait till we're 60. Doesn't bother me.
This is really hard. But I'm not going to lose this. It's not going to beat me. Nothing's going to beat me. It's only one thing that's going to beat me, and that's me missus.
Hello, honey.
Hello. As you can see, I've got my girl back. Best woman in the world. Lovely.
I just kind of, as I do, stumbled and fell, but how much you had to drink just for
health reasons. People don't come for a laugh to the marriage ceremony. It's not like a comedy club. Well, I don't know. Sometimes it is.
It hurt to lock my phone.
There is a massive spectrum in the way you can die. It can be very peaceful and comfortable, and that's very difficult to recreate in an A&E department.
Ortho surgery. We're just going to get on through this.
Not scare and get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output? You know?
One of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah. There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her. Come on. We've got to be strong for Mum. If it is the last bit, hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Is that for your car window? Is that for your car window? You crack it, you know that? You pour hot water onto a car window. You have to scrape the ice off.
Show me the way to go home. I'm tired and I wanna go to bed. I'm not tired, I want something to eat. I'm hungry.
King's A&E, how may I help? Adult male trauma. Code red, yep. Head, chest, limb, yep. Okay, good. Sorry, was that motorbike or motor car? Motorbike. Hit a car. Okay, cool. Thank you, bye. HEMS trauma call in 30 minutes. HEMS trauma call 30 minutes. What is it? It's a motorbike versus a car. Code red. Head, chest and limb injuries. Sick man.
Do people want to sign in at the trauma team, please?
Give it a hand, because if we're rapidly infusing, someone's going to have to hold blood. No, it's fine.
Can you make sure we have a head-to-toe CT, plus all the code red bloods? So
Consultant Chris is leading a trauma team of 20. They're preparing for a 47-year-old man with life-threatening injuries.
Which cubicle are we in?
Well, you can have
4. 4 is free, let's do that. Good.
Chuck it away.
So can we just check this is a male, not a female? It's very important from the blood.
The patient is being flown 50 miles to King's by air ambulance.
You're wondering what the impact speed was, whether the patient was thrown distance, whether they hit the windscreen, what other objects they could have hit when they were thrown off. So we're about 10 minutes away, guys. So we all know what we're doing. Everyone's happy with their role.
We keep people around the bedside to a minimum because it's getting a bit chaotic in here and it's just...
Okay, I've got an anaesthetist, I've got a B doctor, I've got a C doctor, and I've got my orthopod for us.
That's all we need. Now.
Hi, it's Chris Lacey. We have got a code red patient, which it's multiple injuries. It sounds like chest, head and limb. I don't let myself hope. I think I'm geared up to treat what injuries come through the door. Who's doing bloods?
I'll do blood.
So you're happy?
That's it.
Okay. Right. You're doing the abdomen. We're all set. We'll just wait. We'll not go anywhere.
What's he say?
Don't know, I can't understand him. I think he's foreign. can understand her either.
Very warm.
It is indeed. You're gonna put that in my hand?
Yeah.
Jesus Christ, don't let me see, don't let me look, please.
I won't let you look. I've not even done anything yet, and you're...
It's excited me.
69-year-old Steve has come in with a fishbone in his finger.
Right.
God, please take your time with me, please.
I will.
He needs to be injected with anaesthetic before it can be removed.
And then what I'm going to do is put a little injection that side and that side. It's a little bit...
Two injections?
Yeah. It's a little uncomfortable, okay? But once it's done, it's done. Well done.
Mama.
Sorry, honey. That's one side. That's one side. All right, and now the other side.
I was cooking for a lady friend of mine. I was showing off my skill in cooking fish.
You'll thank me later when you can't feel it.
I'm thanking you right now.
I can see you're happy about it.
Her being in the background, I suppose I got somewhat distracted, by her beauty, whatever it was, and I just got complacent in it. That's what happened.
Nearly finished. Nearly finished. Nearly finished.
You're such a comforter.
There you go.
I love you.
I love you too. There we go. Rest it down, and I'm going to leave you for a couple of minutes now.
Okay. Thank you very much.
You're very welcome.
You're so sweet. Thank you.
I shall back a couple of minutes. Let that
man.
just
Thank
work.
you very much.
All right.
I can you read my paper now, shall I?
Yeah.
Can I get 2 porters to majors for a wire transfer, please?
It's 35 minutes since the team last heard from the helicopter medics carrying the code red trauma patient.
Oh, come on.
You always worry if there's a long time. We all know with trauma that the best outcomes are those that are treated early on.
There we go. They're in the park.
If they don't come, you worry if something happened en route. Have they had to stop to do something? Has something gone wrong?
Yeah, 5 minutes away.
Okay, so I've got an A, B, C, D.
Is Gary, a 47-year-old single father of 2.
It was during the evening and I received a phone call from the police, and the gist of it was that Gary had been involved in a terrible road accident and that he probably would not survive the night.
Laura's running. Gemma's nurse 1, I'm nurse 2. She's doing bloods, I'm doing monitoring.
Who's doing airway helping?
I remember feeling numb, trembling. It was just an experience that I hope not to experience at any other time in my life.
Everything's there, ready to go anyway for the airway.
We've got A nurse, B nurse, C nurse.
Yes, you have. We're organised. Do they need to smoke, need anything? We just got it.
It's 2 hours since Gary was on his motorbike heading home and had a head-on collision with a car.
If someone's been hit by a car on their bike, there's no protection. It's literally, the rider versus the impact of the car. If 2 cars collide, you've got some crumple. But if you're on a bike and your car hits you, that's it.
Gary is on life support and has been placed in a medically induced coma to reduce the risk of brain damage. Everything consultant Chris and her team do in the next 15 minutes will be solely to keep Gary alive.
This is Gary, he's 47 years old. He was riding a motorcycle this afternoon and had a head-on collision with a car. Both the motorcycle and the car were very significantly damaged. Injuries top to toe, he has a head injury, he has a large scalp laceration down to the bone, he has right-sided rib fractures, right-sided femur and an open tib and fib fracture.
You're thinking what will kill him first. You've got quite a lot of information that's flashed in front of you. You've got uncertainty. Sometimes this doesn't quite add up. Okay, as soon as we've done the ABCDE, we're going to CT, guys. As soon as we're happy, we'll go straight to CT. If the blood pressure is above 90, we're going round the corner. We've got bloods?
Yeah, like this.
We're just getting bloods. I get bloods. We're going to take bloods and we're going to CT. You're always thinking about the chances of survival. Okay, fine.
Then we have a temperature. Not yet. It's freezing though.
Have we got a good palpable pulse?
Like for some reason the blood is not running through.
I don't know what the pelvis is, so I can't do a femoral stab, Leanne. Can we just hang up a minute? I want a blood pressure. If we're not getting one on the cuff, can we recite the cuff? But before we push any more blood in, I'd like to know what we've got. Have you got a pulse on the groin? No? Have we got a good pulse anywhere else? Have we got an output anywhere else?
We need to cut this. This is probably through. I can't get a blood pressure.
Do you have an output? I have pulse in the right
I can feel his heart
You've got a pulse in the right groin.
I have pulse in the right
Okay,
groin.
fine.
He's got a SATS trace.
Are we happy to go to CT? I'm happy.
I'm happy.
You're happy?
Yeah.
Anaesthetist, are you happy?
Yeah, I mean,
okay.
right.
Hi, it's Chris Lacey. Our trauma call. Are you happy to us to come round? He's not particularly stable, but we're... Yeah, okay. Thanks, bye.
Probably don't want to look at this.
Don't frighten me, please.
It should have worked by now. I could give you a bit more local anaesthetic.
Oh, God, please, whatever.
Yeah. I've not even touched you, really. I've only been pressing very lightly. Let me go and get one of my colleagues. First day back and my first failure. I was looking forward to that too because it's really juicy. So, but he's in so much pain when I try. I've given him loads of lignocaine, but it's just got no effect on him. Managed to use a paper, but touch it, it jumps out the seat. So.
I would love to get married again. I don't want to face life by myself like this. I would like to get married again, yes. And I'm married to a wonderful woman. But I lost that. I let my wife down. Above all, I let myself down. Life is about change. Life is about growth. And I would like to think I have changed. I think I'm more mature now. I think I'm more relaxed now. I think I have more respect now. And I think I would deal with married life much different from before.
80-year-old Hannah has been brought in by her mum with an extreme allergic reaction to her face cream.
How you doing, missus? All right?
Yeah, my face is just very tight now.
Still sore?
No, it's not sore. It's just very dry and uncomfortable.
I'm going to get some kind of, see if we can get some creams, but it's just really excoriated around here, isn't it? What can we put on that, like?
And I don't know if it's
Vaseline
still
or... Because the face was so swollen, obviously you think about the airway, if there's swelling inside the face and in the throat and things like that, and her tongue. So until you know that her airway is safe, you would always put a patient with that amount of facial swelling that's clearly having a reaction to something in recess. For me, hon. Okay. I don't want to put anything on it because I don't want to make it worse. I just want to think we should leave it alone at the moment, yeah? I know it's sore, but just try and hang in there. If once the swelling goes down, it won't be so bad. Just got to wait for that medicine to work.
I'm allergic to wheat and soybean, nuts, eggs, cow's milk, tree pollen and grass pollen, hair dye, and then a whole bunch of chemicals that are in things like washing up liquid, cosmetics.
How you doing? Your eyes are opening.
Yeah.
They are, aren't they? When a patient first comes into A&E, it's a guessing game. It's like Sherlock Holmes trying to work out what's going on.
What do they say?
That you are allergic to oat.
I am.
Oat in this.
Oh.
Oh, at least we know what it is.
No.
Right, give that a good wipe and get all that off. It's just baby wipes. I'm sure you're hopefully not allergic to those. We'll rinse it off with water afterwards, okay?
Oh, that stings like... It's busy, isn't it? Do you want a sweet?
Have a polo, yeah, please. Thanks, darling.
How are you? My doctor. How did you manage to get
Fishbone. I was scaling a fish.
If you're scaling a fish, how can you get a fishbone in it?
I think that's a very nonsensical question to ask, but I'm not going to rebuke you. I'm going to try to answer that question to the best of my own answer. I'm giving you an answer. How can I manage to get a fishbone in my finger? It's very, very simple. Like you get a fishbone in your throat.
While you're scaling?
It all depends how the bone, how tall the bone is and what type of fish I was scaling.
Right.
It happened.
It happened.
I can give you a plausible reason as to how it happened, but it does happen.
It happened, okay.
That's the best answer I can render.
It go in?
I think it's a fishbone, sir, because, yes.
Do you feel me touching your hair?
No, no, sir.
Do you feel that?
No, sir.
Do you feel here?
No, sir. I'm sorry for my being boisterous a while ago,
no, you're
sir.
not boisterous. You're fine.
Very sorry for to be rude.
You're not boisterous at all.
Thank you.
Is this painful for you?
No, sir. No. Oh, that's it.
You said you loved me and you were jumping around for me.
But I don't feel it now. I would jump.
This is a new knife, sir. We just opened it. The one she used before, she had it at home.
Peeling potatoes.
Chopping carrots and
She's such a sweet
stuff.
bear. She's
Yeah.
just sweet, man.
I can't believe you've just done that. I can't believe it. I've done all the hard work and you've got all the glory.
No, I do the same thing. I just need to be more patient to let it work.
Are you saying I'm impatient?
She's trying her endeavor best not to inflict any more wound in me, so she becomes very meticulous.
All right.
Thank you very much, doctor.
Just keep some pressure on it, sir.
Okay, sir. Thanks a lot, man. I appreciate it.
I believe you took all my glory.
I am a little bit lonely. Sometimes the loneliness grabs you. I regret not being the father I would love to be able to be. I regret not being the husband I ought to be. I regret not being loyal and loving and caring as I have gotten from my family. I regret not being able to give them some of the things that they have given me. They give me love, they give me compassion, they give me understanding. What have I given them? Anxiety and stress, etc. Yeah, I regretted that.
I'm ready, steady, go. So ready, steady, go.
Since his arrival in A&E, motorcycle accident victim Gary has had almost half the blood in his body replaced.
Okay, now just stop. Let the anaesthetist readjust and get her arms in the right place. But it's not actively bleeding, is it? No? Okay. He had injuries to both sides of his chest. We knew he had a bad head injury, so you're worrying, is there something in the head that's going to cause big clots or bleeding into the brain? You're worrying about spinal injuries. This is the motorcyclist versus a car, possibly at high speed.
None of us actually know what's around the corner. I didn't spend a lot of time with Gary before. And with hindsight, you would think, gosh, I wish I'd done things differently, wish I'd made more efforts.
Pupils reacting.
Isn't family more important than all the other things? Shouldn't we make more time to do things with people who are important to us so we don't have regrets at some stage?
He's got a fracture there, yeah. And he's not noted to move his lower limbs.
This is not going well. This is not going well. Everyone that, when you came, gone.
Yeah, they're gone.
Everyone that when you came here, and before we said that, they're gone.
Actually went.
Except for these two in front of us.
20-year-old Marcus has come to King's with stomach pain.
Yeah.
As it's his first time in A&E, he's brought a friend along for support.
This is actually unbelievable, fam. This is actually unbelievable. I can't believe this. Like, that much of pain. So I need to take painkillers then. No, I'm just gonna walk. Stay cool.
It's an RTC, motorcyclist versus car, brought to us from Hampshire by Surrey and Sussex Hymns.
Gary's scans reveal his injuries are no longer immediately life-threatening.
Not noted to be moving his lower limbs, but moving upper limbs on scene.
Chris's worry now is that he may be paralysed.
He has a fracture at the T11-12 region. There's a lot of free air that's in the soft tissue behind the spines, which we're not certain where he's come from. Before we log roll him, we'd like your opinion on what you think of that. You can have broken bones around the spinal cord, but not always injury to the cord in the middle, which carries all the nervous impulses. And so it's important for us to understand fairly quickly how much damage there is. The spine has a T11 fracture, which neurosurgery are coming down to have a look at. I just spoke to the on-scene doctor who said he did not notice him moving his legs.
Gary was very much a family man. Immediately before the accident, sadly, he'd separated from his wife, but he was a pretty hands-on dad, actually. He doted on his children. He'd go out to the garage and, he would tinker a bit or fix the children's go-kart or little motorbike, for his son. He'd always liked to tinker. He was great fun. I can't say he should never have got on a bike, to be honest, because where do you draw the line? With hindsight, he might not have made that trip, but he wouldn't have lived his life differently.
I was what when I was laying down?
Yeah, because she has it elevated like I told you to.
God.
A year ago, 58-year-old Terry was diagnosed with lung cancer and given 2 weeks to live.
I've got to lay down because it's paining me when I'm sitting up. I'll see if I can do it.
All right. Let me hold on.
Oh. Oh.
Do you want to be sat up some more? I think that.
Yeah, it's just. Oh, now I'm getting a pain in my leg every side. Oh. And I'm going to miss Judge Judy.
Well, you got it taped. What are you worried about? You got it 10 days taped.
Yeah.
didn't you?
I ain't got the energy to do anything.
What are you muttering about?
I said I ain't got the energy to do anything.
Think yourself lucky. At least you can shut your eyes and go to sleep laying and with your feet up.
I smoke more now since I've been ill than I ever did because it's boredom, innit? When I first was diagnosed, I thought it was just getting old and walking to the station. I found it harder every day, getting out of breath, and I just put it down to too many fags and getting old. Then I went to my doctors and sent me to the hospital and they did diagnose cancer. Yeah, a bit of a shock. Oh, God. Oh!
What's the problem today?
What do you think the problem is? Does I look well? Huh?
No.
Pains in my feet are swollen up and pain.
Smile, that confuses me.
My foot's all swelled up and painful and everything. And
That's only the feet.
well, I've got lung cancer. That's originally what I was in, and chemotherapy. And then I think it's a question of all the medication I've been on, the steroids.
You're on chemotherapy.
Finished it now.
You finish it now.
Yeah, there's no more they can
When
do.
was
It's
the
Oh,
all
last one
finished.
done?
4 weeks ago.
4 weeks.
There's no more they can do. It's over. Finished.
Okay.
Terry's not a person you can sit and go, oh, I do feel sorry for you. He's just not that type of a person. You say to him, well, you know you've got it. You know how far it's progressed. You know how to deal with it now. And if you can't deal with it on your own, I'm here to deal with it with you. But I'm not going to sit there and wallow in self-pity with you. We are going to fight whatever it is, that comes along. And this is what we've done. Terry's a fighter. He's not giving in on anything.
Any chance for a cup of tea?
After this.
I'm going to keep on till I get one.
Just as you doze off, someone's going to come in and wake you up, you know that, don't you? And poke you.
They wake me up with a cup of tea.
At least you had your toenails cut, so that's all right.
Yeah. I'm here.
Yeah, and your hair. And your beard's off, so you're all
They
right.
asked me, it fell out, all right.
Pain. Stomach.
I have a quick thing for Tom.
Yeah.
I have a listen to your chest as well.
Yeah.
In abdominal pain, we usually check the back passage as well.
All right, that's fine.
Yeah? Have you had that examination before?
No.
Okay.
No,
But,
I haven't been tested.
Okay.
At all.
It usually involves inserting one finger into the back passage to check if there's any problems in the back passage.
Okay. That's
Yeah.
fine. Okay. Okay, that's fine. That's fine. That's fine. Yeah.
Here?
No, not there. Mostly in the middle.
In the middle here?
Yeah.
Alright, so if I just get you to lean onto your left hand side. That's it. So just bring your knees up towards your chest. Yeah, that's perfect. You okay now?
Yeah. Oh.
You know, shouldn't it? All right. Wait there a minute, leave it there.
Can we see? Yeah, more open, most definitely. Look here. You know, the allergies are actually, in terms of my life, are quite recent. When I was younger, I was carefree. It's literally only in the last 3 years that it's been bad.
You and Dad are so great.
She probably doesn't see how I feel. You kind of cry inside, really. I know there are worse things that happen to people, but me being her mum, I do find it really hard to know how to make her feel better.
Just want you to know it doesn't go unappreciated. And I don't know what I would do if I had to sit here on my own right now. If I'd have known what was coming, I'd probably say I would have stuffed my face every day. I regret not trying more, because when I was growing up, I didn't like to try a lot of stuff. I like to stick to what I know, and now I wish that I'd tried it.
You want to go home?
Am I allowed to go home now?
Of course you are.
Am I? I've always said, every situation that could possibly happen, it has to happen to someone, and this just happens to be my thing. This is my one thing I'm hoping that I got in my life that was, you know, not fantastic to deal with.
They've done nothing, thank
Come
you.
in and saw the ulcer 5 weeks ago. The district nurse came in and dressed it once.
Be careful, yeah?
Yeah, I'm okay, thank you, darling. With only chocolate biscuits.
Wait for the doctor first.
I know, well, he's taking his time, isn't he? Go and wake him up.
Hopefully your second trip is in.
Yeah, go and wake him up. He's probably a kip somewhere.
We're probably sitting on a chair on a kip now.
That was disgusting.
You drank it anyway.
Wet and warm, isn't it?
Yep.
Wet and warm.
His brother died last year, and I looked after his brother.
I wouldn't have done that.
No, you shouldn't have done, should you?
No.
His brother said to me, if anything happens to me, Terry won't handle it. Make sure he's all right. And you know, you look after him. I wouldn't say we enjoy each other's company. We tolerate each other. But we get on. And because of Tom and what Tom asked, then I now do it for Terry.
Yeah, a couple of papers on the way home.
Who said you're going home?
I ain't staying here.
You won't go home, I shouldn't think. They're going to have to give you a massive dose of antibiotics.
I can give you the night, but I'm going out tomorrow.
Yeah.
And not at no 3 o'clock either.
Why, is it race time at 3
It's
o'clock?
racing day
I
tomorrow,
know
yeah.
that's what you was going to say. It's race day tomorrow.
Yeah.
He likes the pub and racing are the only two things that I know that him and his brother they've ever liked. They love their drink, you know. I've never known two people like drink so much, but they did like their drink, and that was their life. That was it. Can't you look at your newspaper and phone them through to one?
I could do, but it's not the same. I'd like to watch it.
I'll get your telly up here and you can watch it.
Oh, yeah.
Okay, I've got neurosurgery here with me. Okay, so the facet joints are widened at that T11. Okay, and the canal at the we can't tell. I agree. It's just, we won't know. We won't know.
Depending on where the spinal injury is, will depend on at which point your function is cut off. And the area that he had fractures would be sort of lower limbs. You need to know for sure, and you can't know for sure until you wake somebody up. It's grim. It doesn't happen a lot, but it's grim.
Nothing else we need to do. We're just going by our playing when you're ready.
Yeah.
When that's written up, the notes are done.
The trauma team have done all they can, and Gary will be taken to intensive
I'd be
care.
happier if I had a temperature.
His family is being
We
informed
couldn't
and
get
are on
one
their
because it
way.
was too cold. He's stable at the moment. He's been seen by a number of different specialists. He's going to go to our intensive care unit. At the moment, we have had our CT scan, which has shown us a number of injuries, none of them which are immediately life-threatening. So I can put your mind at rest there. I think you never want to break bad news over the phone if you can possibly avoid it. But by the same token, you don't want to lie or deceive or lead on a relative. He'll need some further imaging tonight, which is an MRI, which is to look at his spine, to his lower back. So he's had lots of pipes and tubes going into him, but he's doing very well, and he's very stable. Okay. All right. So he's in good hands. Very shortly he'll go round to a ward called surgical critical care.
I suppose if I hadn't been expecting that maybe he had died, this would have been bad news that he was so badly injured. But because I'd been expecting to hear, perhaps, that he had died, this was good news. So the fact that he had all these horrendous injuries, but he was alive and there was hope, was wonderful.
Doctors suspect Marcus has irritable bowel syndrome.
When I walked, cause I walked out like hobbling in that, cause Mum went, when he done it, cause I was like, oh, cause it hurt. My mum was gone from, cause he just put it up there, but they had to do it. He had to do it because he didn't need to do that for me. Cause, I feel loose blood. I feel loose.
Where are they taking me next?
Who?
These lot.
Taking you?
Taking me.
Taking you nowhere? Not at the moment. You're dreaming again, aren't you? Why have you got your arm up near?
I don't know.
You waiting for a bus or something?
Pubs are still open.
That's what your right arm's for, love.
I ain't good for nothing else.
Was Jacko there? Was Jacko at the pub?
Yeah.
All right, okay, well, you got to see him at least.
He annoyed me, he did.
Why?
He annoyed me. I didn't say nothing to him, I just let him wash. I said, look, I told him what was going on there, and I ain't got long. And all that, and it's final diagnosis and all that.
Yeah.
I said, do you fancy coming away again in March? Oh, no, I can't do anything in March. He said, I've got to go to Cheltenham, watch the races.
Oh.
And something else, and I felt like saying, Jacko, this is my last ever holiday, and my last drink with you for good.
You could bloody well go anytime.
You couldn't cancel a horse racing meeting. So I just walked away.
Yeah, because you can do that anytime.
Yeah, so I said, you can go
it's like what you said to
after.
George.
Yeah.
Yeah.
Really
You can do all them
I didn't
things
say
after.
nothing, I just let it pass, but I was really annoyed with that.
I get more angry than I get upset. Because I wonder why. You know what I mean? 2 brothers diagnosed very shortly after each other. You know, what's the chances of that? You know, most people have one in a family that's ill. Unfortunately, this family had it, and it was only a few months after each other. So it is a bit of a kick. But no, we get through it.
Oh, he's a twin brother, identical twins, Tom. I miss him terribly. We done everything together. Everything. There wasn't a day go by where we didn't speak to each other or see each other, even when we was with our partners. Don't start me off. I miss him terribly. 57 he was. What's this?
Same stuff you have at home.
Thank you.
That's not the same, is it?
Yeah.
Tastes different.
No, yeah, same stuff.
Sometimes in a way it makes it not so bad when I think about it. I think to myself, well, at least I can join Tom. Not going to be on my own, you know what I mean? Got me brother.
There's a lot of A&E nurses, and the character that we are, people think you're a bit nutty and you're a little bit hyperactive and you're a bit... But I think when you do that job every day and you realise how short your life can be, literally nothing's taken for granted. You know, you can end just like that. You're not going to waste a day, are you? You're just going to do it.
Hello, Gary.
He looks really good.
You're looking great. It's good to see you. We brought all sorts of stuff with us. It wasn't for some weeks that actually made the diagnosis and told him, Gary, you're not going to walk.
This was the one where the car went over the top of us.
Oh, Gary.
With this one. This is the one where they got the bar. That's it. He was explaining. The bar goes all the way down.
Yeah.
And that, and he had it.
I'd talk to my husband on the way home and I'd just cry, you know, with the sadness, you know, everything that had happened and how different his life was going to be. It was just a very, very sad time.
Won't never make any stupid mistakes like that before.
Good.
That's 100%. That is. I want to live a lot longer and I want to watch my kids grow up and have them watch them and when they have kids.
Find me a wheelchair so I can get to that shop. I'm starving and thirsty. You can push me, all right.
You watch this one. And they go.
Please. Be careful.
Don't they smell really nice? Ah.
Can I give Willow a
Is it? No. I don't know if that's a good idea with chewing gum for a horse. Ah, cheers. But you don't put your fingers. Could have one more.
Good girl.
Oh, nice one, Jem. You're doing really well. Just go careful, sweetheart.
I can do a double one.
They're saying you can have an electric wheelchair. If I did have an electric wheelchair, I'd want something which has got some oomph in it so you could so I can pull wheelies on it and have a bit of fun with the kids. I know. How old am I? 48? Or is it 5 years old? Yeah, see? So you know you are. I love you. That's well impressive, Jem.
Look it.
You weren't particularly attached to those T-shirts, were you?
They're the best T-shirts I've ever bought, to be honest with you.
Laugh, and the world laughs with
I
you.
know, yes. What I want you to do is get your bottom right up on the chair.
Cry and you sleep alone.
They look after me nice today.
Surgery. We're just going to get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output, you know?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up, I know, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
For me, says the chimpanzee. Don't just grab it, says the angry rabbit. I like that story. You?
It hurt to lock my phone. It's ridiculous. I need some pills.
Hiya. I'm in A&E with Billy. She had an accident in school and got rushed to hospital by ambulance. She's got a massive contusion on her head. They said she lost consciousness. I mean, hopefully they'll let us out and it'll be, we'll be tucking into a bottle of wine in a couple of hours. Hello, King's A&E. Yeah. Thank you.
Adult red phone, 10 minutes. That's adult red phone, 10 minutes.
Laura is the nurse in charge of resus today. Her first patient is a 94-year-old man with breathing difficulties.
Hold on.
This is Dougie. He is 94. Georgia said today he had a sudden onset of DIB about 7 o'clock when she went up to give him his nap. He's had 5 milligrams of salbutamol and oxygen. Sat at about 92 now.
Cool.
And that's his ECG.
pain?
Douglas has come in with his youngest daughter. His emphysema and bronchitis have been deteriorating since this morning.
Started amoxil and prednisolone. Okay, let's get some blood out of you, sir. All right, so big old needle coming up. Let me see if I can get your daughter in. Can your daughter come in?
Yeah.
Hi, my name's Chris, I'm one of the doctors. Do you want to come through, see your father?
Hello. My name's Laura. I'm one of the nurses. I'll be looking after your father.
Sylvie has been her father's full-time carer for over 20 years.
So that medication, I don't know if he has nebulizers at home.
Yes.
Yeah, it's the same
But
stuff.
he stopped taking it at the weekend and he's been back on it yesterday and today.
Okay.
He's on a set of steroids. He took some yesterday and today.
We're just about to give him some stronger steroids through this drip.
Oh, even though he's had some today?
Yeah. Because your relative is in hospital doesn't mean that you suddenly become redundant. And if you wash them every day at home or help them go to the toilet every day at home or brush their hair, who am I to take that power away from you and say, no, you need to sit there and I'll do that?
I've got quite a bit of, I say quite a bit, some tea and that down in today and some other liquid.
Mm-hmm.
But you tell him he's got to drink liquid and he won't. Sort of does the opposite to what you say he's meant to be doing.
Sounds familiar.
Yeah.
It is a trait of most A&E nurses to be able to just talk about anything to anybody. You have to be able to create relationships with patients and relatives really quickly so that they trust you and you can support them through whatever's going on. Is it just the two of you at home?
And a 20-year-old cat. Who doesn't know what the hell's going on at the moment, bless her.
So she's doing well at 20?
Well, she's 20 and 2 months old. Bless her heart. My husband had died, and I came up to look after Mum. When my mum died, I ended up staying and looking after Dad. It just suited. I don't actually look at it as taking care of someone. It's me dad, I'm his daughter. There's plenty worse, trust me, but he's a good one. Put your head back. Put your head back properly. That's it.
I don't like to go on the bed.
Well, hopefully we can go home in a while and I'll give you some chocky.
But my head is not hurting anymore.
Doctor's going to come and have a look at you just to make sure that he's happy with the lump.
So, how old are you, Billy?
4.
4. Do you remember what happened?
Yeah.
Can you tell me?
Yeah, but I slipped over and bumped myself.
Oh dear, that's a shame. Where did you bang yourself? Where did you bump yourself? Which bit? Over there? Oh, can you remember banging your head? Can you remember falling on the ground and it going, ouch? Do you remember that bit?
Yeah.
Oh, that's good. I'm glad you can remember it. I'm not glad you hurt yourself.
The only thing... All right,
Mummy.
we will.
We might be able to let you go
Listen,
home.
I think we will go home because
Nice
Mummy's got
bed.
you some chocolate.
All right, let's have a little look. Can you see everything normally? Does it all look fine? Does Mummy look fine? Does she look normal?
She looks a bit stressed.
Funny. That's it. Is it sore anywhere in your neck? Does your neck hurt or you... Am I tickling you? I think that's all right, isn't it? Shall we sit you up? She's got no indication that there's any other damage going on in terms of examining her.
Yeah.
Just want to see her walk and make sure she looks like she's steady on her feet. And if you think she's behaving normally as well, that's the best indication for me that things are fine, because you know her better than I do, or anyone else probably anyway.
So, it's spider, the water. That's a point. Again.
Right, come on then.
Sylvie's been joined by her neighbour Maria.
Hello.
And older sister Heather.
You alright? Where's glasses? In the bag. It's all right, he had a mask on just now, just left it on.
I love my dad. Too much for words. He's our centrepiece. Yeah. You right? You're still here then?
Sense of humour. I think them words were made for him. He'd do silly things where couldn't go on holiday, didn't have the money for that. So he'd take us on a long bus ride. And we're literally going round in circles. But we really thought we'd been on a good trip, you know. End up back up Crystal Palace at grounds in the end, and it's walking distance.
I thought you might have gone home being fed up waiting for me to come back.
I'm going to see if I can find him a pillow to make him a bit more comfortable. Yeah.
Douglas is a highly decorated Second World War veteran who served in an elite commando unit.
These things are like gold dust, you know.
Dad's a very brave man, and definitely as they get older, they go to the garden party at Buckingham Palace. Thank you.
Yeah? OK.
And he had a good old conversation with the Princess Royal when he went. And I just think to myself, oh gosh, I hope he didn't tell her any jokes.
Some antibiotics into your drip and then some fluid so you don't feel quite so dry.
One of my best friends sent me a card years ago that said on the front, "Nurses are angels in comfortable shoes." I've still got that at home. I thought it was quite funny. It made me smile.
Okay.
Right. If you see someone vulnerable, whether it's a baby or an adult who is unwell, you want to look after them and reassure them.
I'll just be whizzing back and forth, getting him different medicines.
Did you have instant pain? Did
Yes.
Yeah. Turn your hand over.
Laura is the senior nurse in Miners today.
I never really got on with resus and trauma because that's working with death and dying a lot. And I knew I couldn't do that forever. So it's all across here.
All
yeah.
there, and my finger is numb. My little
That
finger.
one. Not that numb.
It's not that numb. It's like if you move it,
It hurts.
Yeah.
There's always something a week that I haven't seen in 8.5 years at King's. Why did you trip over? What happened?
I think I tripped over the wedge shoe.
It is wedged, isn't it? I had a guy that slipped on a banana skin last week because he'd just left it on the living room floor. Why would you leave it on the living room floor? I don't know. But anyway, he slipped on a banana skin.
I just kind of, as I do, stumbled and fell. But
How much you had to drink just for health reasons? I like the characters. I think that's the best. It's not always the injury of the patient, it's the character of the patient that you enjoy. So have a seat, Midge, and
Sit in
Midge's
the
friend,
corner.
Midge's mate.
Yeah, I'll be fine, I'll just stay.
Yes, lovely, thanks. Let me just draw the curtain. So my name's Laura, I'm one of the nurse practitioners. How can I help you?
Pretty much hit a
Tell her the
punching
whole
bag like
story,
thing.
yeah.
An arcade game where you hit it.
Oh, okay, yep.
This morning it's all swelled up and
So
I
this
can't
morning
really
you
do
did it?
I did it yesterday, but
yesterday.
overnight it just seemed to have swelled up and
Did it hurt at the time?
Yeah, and pretty much.
He didn't make much of a fuss after it happened. He said it hurt, and
It whacked it really hard.
Yeah.
You're trying to beat your personal best.
he got the highest score.
You got a top score though. It's all worth it. Do you want some painkillers?
Yes, please.
You had any today?
No.
Nothing. Okay. Get your painkillers and order the X-ray. Now, what kind of stuff do you want? Do you want some codeine? You all right with codeine and paracetamol?
Codeine, yes.
That work for you? Okay, let me get those.
does A&E stand for?
So it looks like he may well have a chest infection. So he may well be staying in overnight. Blood tests, X-ray, usual.
He's had a habit of exaggerating sometimes, and I've got to the point I don't know what part is crying wolf and what isn't.
Yeah. You're not smoking anymore, are you?
He hasn't smoked for about 4 or 5 years.
Good, well done.
I do.
You need to stop then.
At the moment I can't because it's making me a nervous wreck.
Okay.
I've been saying to him he's going to cry wolf too often and I'm not going to know what's real and what ain't.
He's nearly 95. He has to rely on Sylvie. As you get older, you revert back being a baby virtually, and you want the attention. So yeah, it's like he is the child.
Gonna take your picture, Dad.
This young man, just going to pop a hard ball behind your back. Quick X-ray, then I'll leave you in peace, okay?
An X-ray will reveal how serious Douglas's chest infection is. At 94, it could be life-threatening.
He's the nicest, stubborn fool I've ever met in my life. But I've done a lot of looking after, and because it can be hard. And me being an amputee, I've had troubles myself. I was doing my mum and dad's garden, and I got carried away and I literally tripped over a garden rake, and the ankle fractured in 3 places. In the end, because of the fractures, it put a disease into the leg. So I carried the leg around on crutches for 3.5 years, and thank God they finally cut the leg off. So I'm back trying to walk in a leg again. But I'll do it. Even if it's just to keep up with Dad.
What's your first name, John?
Not Stephen.
Oh, sorry. You look like a John, see, Steve. Sorry about that, mate.
69-year-old Steve has fallen off a chair and injured his shoulder. He's come into A&E with his partner and daughter.
Can we go home? Oh, Carol, all right, I know. He'll be right here, right? He'll do whatever he wants.
When I first met him, he was wearing a wig. And it wasn't until I was dancing with him and he was rocking and rolling, and he just twisted around and I could see the 2 flaps of the hair going up, and I just melted. I couldn't stop laughing. And when I came home that night, I threw it down the toilet. I said, "That's it. You're bald, that's it." Hey, girl. Thank you very much.
You want to black him up, do you?
I don't need one. I'm hot enough. Oh, he used to dress really well. Yeah, he stood out.
We started off in Peckham, didn't we?
Yeah, we are still in Peckham, Stephen.
Oh, no. Oh, we're still in Peckham, yeah.
Yes, still. He was a right old charmer, yeah. Charmed the birds of the trees, he would. How you feeling?
Huh?
How you feeling?
All right, fucking
Want a
awful.
drink of water, right?
No, I've got a funny,
Huh?
got a funny headache.
You got a bad headache?
No, I didn't. I want a headache. I got a headache. What am I here for, Annie? What am I here for? Could you tell me what am I here for?
Relax, right?
Tell me what am I here for?
For the results of an X-ray now. The results of an X-ray.
Oh.
You're freezing with the cold.
I want my Valentine. Don't worry about me. Don't worry about my legs at all. Nothing. I don't know why you brought me up here for what. I don't know what. Oh, I got a pain in my hand anyhow.
Big pain.
Una was a widow with 2 young children when she met Steve 38 years ago.
A lot of men would run for the hills. He didn't. I always said the door was open, and if you ever want to go through it, let me know. Don't cheat on me. If you cheat on me, you're a dead man. He was a very good father to him. They called him Dad. Where's the little doctor? Oh, there he is. Hi.
Hi, Stephen. I've just gone through with your X-ray. There is the small fracture on your shoulder. The bone on this side, actually like here, has like broken into 3 small pieces as such. There's a reason why you're having so much pain. If you leave it like that, there are chances that it might cause problem in the future. I don't want you to have any further problem with your shoulder.
Oh, you know I'm too fucking old now, are you?
So I just put the sling on so that you can just keep your hand supported if it's possible for you, okay? I'll just show you the X-ray. Can you come with me?
Here you go, down the hatch. Now, do you want a proper sling? Well, when I say proper sling, kind of made an NHS emergency sling. I do like some of the practical stuff, like I love suturing and plastering. So just make sure the whole arm and the wrist is actually hanging in the sling, not outside. Perfect. And dressings and wounds. Because that is really nursey, isn't it? Gwyneth, do you want to see your X-ray? I'm afraid it's not good news. It's a broken bone. Some patients love to chat. Elderly have always got stories, haven't they? And they've always got time. They're never in a rush because they, you know, probably don't want to go home really to an empty house or the cat. Do you need any help socially at home with? Do you want to be referred at all to your poor husband? You always kind of try and think, what if that was my sister, mum, husband, friend?
This thing keeps coming out your nose. Yeah. Is that all right? Yeah. Okay.
I'm caught up with the crutches, it's all right.
It is like having a child, isn't it?
And he's been playing me like a fiddle quite a bit. Every now and again, he'll exaggerate because he doesn't want to do something. And I thought he was putting some of it on. And normally I get it spot on. And I didn't this time.
Why are you beeping now? Jesus.
You all right? Okay. Are you feeling all right? All right. His heart rate's gone very high. Now it's come back down. Must be my presence. Okay. Oh well, nothing to panic about. It just took me by surprise, that's all. Hello, King's A&E. Yeah. Adult red phone, 5 minutes. That's adult red phone, 5 minutes.
Laura's next patient is a 97-year-old man with life-threatening problems.
Unfortunately, I now know there is a massive spectrum in the way you can die. It can be very peaceful and comfortable. I think that's the nicest way you can go. And that's very difficult to recreate in an A&E department.
This is a 97-year-old Hector. He's from the nursing home down the road. It says here he's got pseudo-obstruction, anal stricture, prostate cancer, and he's blind in the left eye.
Okay, what was his name again?
Hector.
Hector's airway is in danger of collapsing and his blood pressure is dangerously high.
Hector, do you know where we are? You're in hospital. And we're doing everything we can to sort you out, okay? I know you are.
My nana, when she was very unwell and dying, had problems with her breathing. And she was on the similar machine to Hector. And although Hector wasn't awake enough to tell me that he found it scary, my nan was when she was really ill. So I was really aware of how scary it can be to have that machine put on you.
Hi, like I said, my name is Dr. Rao. I'm one of the medical registrars here. Can you hear me?
Douglas's X-ray has revealed that his condition needs close monitoring.
And how are you related, sorry?
Daughters.
Okay. You don't mind if your daughters hang around when I'm speaking to you, is that all right?
It'll be best because he won't hear much of what you say. He's a bit mutton chair.
Right. What brought you into the hospital?
Couple of weeks. I've been a bit upsy-dumpsy, and I've been hallucinating and things like that.
Now, it's the first I've heard about the hallucinating, because he's not mentioned that at home.
Okay. Now, I've had a look at the X-ray. It appears that you've got a nasty pneumonia on your left side. Okay. Yeah, you've got some changes in relation to your bronchitis and emphysema, but the pneumonia part is new. So what I'm going to do is, basically you need to definitely come into the hospital and stay with us, okay?
Has he got this because I've not looked after him?
You have looked after him, don't do that. You've done nothing wrong, don't you dare.
I don't think you should feel, I don't see any reason why you should feel guilty.
I felt responsible for him. He relies on me, and I just feel I let him down. We found out in the end that he had double pneumonia and his kidneys were collapsing, and they told us he probably, wouldn't last a week. It was like all my nightmares coming through at once. I can't be without him, you know? There's just something about him. Everyone says, oh, their dad's this and their dad's that. But they ain't met him, you know? I don't let him know.
Yeah, but I can have a go to the toilet. Oh, I have to go to the toilet. I want to go to the toilet.
Stephen, I really want to nurse just to get you down off the bed.
What's she going to do? I'm not going to piss in the bottle. Don't tell her that I'm not going to do that.
Excuse me. Hello. I need a nurse. He wants to go to the toilet.
Nurse is right there.
I'm so busy looking after him. I forget you forget about yourself, you know. It's just like if you have a child, you don't think about you. That child is number one, isn't it?
Yeah, you don't want to do it now.
I don't want a bottle. Oh, I don't want it. I want to
walk?
Yeah, I want to go to the toilet. I would just want to go to the toilet.
Are you sure?
I'm not dead yet.
No, we need that in the sling.
You need what?
Your arm in the sling. I can put a new one.
Oh. Yeah, I'm all right, mate. I think I am, anyway.
Are you going to fall?
No, I won't fall. I won't fall, mate. I won't fall, mate. No way will I fall. Come on, now. Come on. Oh.
Put your arm on.
Steve worked as a plumber until 4 years ago, when he was hit by a motorbike while crossing the road.
Yes, you will.
Oh.
Which way's the toilet?
It's behind the wall.
You come with me.
Where is it? Oh.
The accident took everything away from him. He hasn't got a car now because he can't drive it. And he's woke. He's still got multiple fractures in the back. And the 11 pins on his legs and plates. Just wait your time. Take your time. Don't go on your own. He's only a shell of the man he used to be. You know. And on top of that, he's got dementia.
You can fall down downstairs. You fell in the front room.
Oh, the front room, yeah, but I just slipped over the fucking... I know what I do, I know what it is. I don't want it. I'm going to be all right, I'm not going to die, am I?
He likes a drink. He likes wine, red wine. Yes. I give him a bottle a day. It used to be 2 bottles, but I had to stop that. It was too much.
Your bones can't take you falling over.
I know,
So stop drinking.
Now, some days I miss out because I can't remember whether he had it or not. And I say, yeah, you did.
I've spoken with the orthopedics team. They have reviewed the x-ray and they have suggested me to refer him to the fracture clinic as such so that it can be seen and further treatment will be given.
So you go home?
Yes, you're going home finally, but you have to come back after 2 days.
How many days?
Tuesday. 2 days. On
2 days, yeah.
Okay. I'll come back to you.
Have you ever found caring for him too much?
No, not really. I'll look after him as long as I can. What can you do? Stick him in a home? No. No, that's not an option.
See you, mate. Look after yourself. Ta-ra.
Heather's going to go up to the ward with you. Right, so we'll know where you'll be.
I think everyone should care for each other. Dad might not still be here if Sylvie wasn't there 24/7.
Right. All right, see you tomorrow. Do as you're told.
Always.
There's an awful lot of people who are in my position have got nobody at all. But over and above that, they'd be extremely lucky to get somebody like Sylv.
In our family, we always get on with it, regardless of what it is. I reckon that's the commando. Dad being the ex-commando, and it's rubbed off on a lot of us.
I'm just taking the mask off, sir. What's wrong?
I want her to one word as well. And get on to my grandson. I think that.
Okay, we'll try to get a hold of him, okay?
Yeah, okay.
Asking him to call his grandson.
I can ring his grandson. Anybody who's alone when they come in and they're very unwell, you are aware of that added vulnerability. Hello, Hector.
Doctor? They've got nobody to stay with them and comfort them and reassure them like a family member normally would. So you take on that role probably much more than you would if they were surrounded by family.
I will.
He reckons the key to long life was obviously to live a decent life. He said, "Oh, make sure you eat your porridge."
Would you like to lie on this side?
Yeah, for a while.
And do you know what? I've been eating it, and I'm on it. And I'm telling you, I've noticed since I've been eating porridge that my memory's getting a lot better.
If you put this hand over there, you can pull yourself over. Or is it easier just to shuffle?
He was a foreman at a sugarcane factory in Jamaica, and so he was a working guy and part of the Windies that come over back in the 50s, 60s. You know, he certainly made England his home. But he did say, I've got to confess to you, Glenn, when West Indies play England, I want the West Indians to win.
Hector's blood pressure has come down and he's breathing more evenly again.
Mr. Buchanan. Hello, sir. Yeah. Hi, my name is Dr. Rao. I'm one of the medical registrars here. Just let me have a quick listen to your chest, sir. All right?
Yeah.
Still got feedback.
He has no.
Okay. And just reduce breath sounds. Okay. Hector.
Yes.
What we think has happened is that we think that you had a minor heart attack. Okay, and that's why the blood flow through your lungs has slowed down considerably.
Yeah.
I think that's what made you very breathless, and that's what sort of created all this scenario before you came into the hospital. Despite our maximum treatment, if things don't improve, things have improved dramatically. I'm not expecting them to go downhill, okay? But just in the event, if things go downhill, has somebody at any point of time discussed as to what needs to be done, like try and jump and try and restart your heart? Have you thought anything about that?
No.
Okay.
No. No,
Okay.
sir.
Well, if I say that we will do whatever is possible, but if it comes to an extent where things have gone quite downhill, okay, and if your heart stops or breathing stops, and it's not the best idea for us to try and jump and restart your heart, do you agree with that?
Yeah, I understand.
So what I'll do is I'll put you on for active treatment, and I'll also make a decision that should things go downhill, then we won't try and jump and restart your heart at that point of time. Is that okay?
Yes.
Is that reasonable?
Yes.
Good man. Okay.
Right, Hector,
You've been brilliant.
We'll pop this mask back on for a little while, okay?
Yeah.
I don't think he was ever frightened of death. I don't think he knew he was loved.
Yeah?
I think he knew his life was coming to an end.
All right.
I was going to see what I had in the freezer to cook you something for tomorrow night.
Oh no, I'm going out tomorrow.
Oh, you are? Oh, I don't need to worry then. When you go out to dinner like that, you like a glass of wine, don't you? Well, I do. That's what I was going to ask Chris to bring over, a box of that wine. Mine's getting a bit low.
They did an X-ray.
I've got this for you.
What's this? Just crutches.
What? So what? Say that again?
Do I get one or two? Crutches suck.
My blood didn't look very red. It looked I suppose it's getting a bit old and stale.
It's been pumping around there for a long time.
Should we wheel you over? Wheel you over.
Yeah, I might last.
"93-year-old Peggy has come in with her son after falling and hurting her leg.
Peggy? Hi there, I'm Charlotte, I'm one of the nurses. I'm just going to come and clean your leg up, okay?
Yeah.
So how did this happen?
I was getting in a taxi.
In a taxi?
Yeah, and I hit my leg. I fell and I hit my leg on the thing that came out. Not very pretty.
Well, you made a good job of that, didn't you?
I certainly did. Didn't want to waste your time.
Are you allergic to anything?
No. Only nurses washing your leg.
Did you just lose your balance?
I think I must have done.
Yeah.
No, I hate getting in those black cabs. I just had a nice day, a nice meal, and I was so pleased to be going home. I walked away and they said, "Oh, look at all that blood coming down."
Oh, really?
I didn't think I'd...
You had
done
some
anything.
tights on though, didn't you?
Stockings. Mm-hmm.
That would have helped a lot.
Yes.
All finished?
Oh, lovely.
Job done.
Job done.
Well done.
You've made a jolly good job of it.
I hope so. I hope that heals nicely.
Hector, I've got another pillow for you. Should we put it here? There's a reason I remember Hector, and I don't remember everybody that has come into resus in the past 4.5 years. How's that?
Thank you very much.
Hmm?
Thank you very much.
Okay. I felt like I'd done proper nursing and he was getting better. And the luxury of time I had with him as well, because he needed to sort of have one-to-one nursing. That's not what every person who comes into resus needs, so he stood out from that point of view, and that's probably why I remember him more. In 20 minutes, I'll ring Glenn, because it's a normal time in the morning to be up by then.
Yeah,
And I'll say to him, I'll ask him if he could pop in.
that's right.
Okay?
That's great news, thank you.
Okay. I'm going to turn the lights off for you.
Okay.
There you are. Then maybe you can get a little bit of shut-eye.
Yeah.
Okay. It won't be too long. We just have to wait for your blood results and do another little test in a few minutes, and then hopefully we can get you somewhere more comfortable.
Yeah.
All right. He does, doesn't he? He looks so much better. Hello, is this Glenn? Good morning. I don't want to alarm you. This is one of the nurses from King's College Hospital Emergency Department. We've got your granddad in with us. Yeah. So he was brought into us last night. It seems like he's had a heart attack. He came in and he was incredibly poorly, but he's a lot better now, sitting up and talking and asking us to call you. Okay, no problem. All right, thank you very much. Okay, bye. He was awake, taking the kids to school. Hector? I've just spoken to Glenn.
Yeah.
He's going to come in and see you.
Yeah.
But he's got to take the children to school first.
Yes. Yeah.
So he said it'd be an hour or so.
Yeah. Okay. Thank you.
All right.
Thank you for everything you've done for me, nurse.
That's okay.
What time you going home?
About an hour.
Oh, no.
Yeah.
Yeah. Bye.
All right, I'll leave you in peace.
Yes. Thank you.
Okay. Bless him. My nan died last week.
Oh.
Oh, babe.
Just a bit. Like, it's all just a bit much. And then I can't remember any sleep, and my coffee table's broken. My nana, when she was really unwell, I was going to meet my boyfriend at the time's parents for the first time. And this is probably one of the last conversations I had with my grandma. And Mum had said to her, oh, Laura's going away this weekend, rah, rah. And Grandma said to me, I'll give you one piece of advice, dear. And I said, oh, yes. She said to me, his mother will never like you.
I've got 4 children still. I've got 17 grandchildren and 19 great-grandchildren. I'm dead chuffed for them all.
And if my son's half the man he was, I'd still be happy.
What would you say to Hector if you see him again?
Hello, you old git.
You're next, yeah.
Unwitnessed fall off a roof. He has a traumatic brain injury.
There's very little happening. I mean, they're not busy, are they?
No. We're getting a little bit full now.
How's your chefing skills?
It's all right. Do you just want to go over there and look after him? The old man.